programs of today's auspicious ceremony, which is the first state-level conference on teaching and learning process in nursing education. So the program details are as follows. From 8 a.m. to 9 a.m., we have planned for registration and breakfast, and I hope everyone here have taken their breakfast and they have also received the conference kit. From 9 a.m. to 9:30 a.m., we have the bouquet and langan presentation of our respected dignitaries. From 9:30 to 9:45 a.m., we have a welcome speech by Mrs. Karaibam Surjia, Assistant Professor, Raj Medicity Nursing Institute. From 9:45 a.m. to 10 a.m., we have a speech by our respected Shri Haubija Rajan Singh, Chairman and Managing Director, Raj Medicity Hospital and Raj Medicity Nursing Institute. From 10 a.m. to 11 a.m., we will start the academic session. And for the first session, we have our resource person, Dr. Aribam Jamuna Devi, Registrar, Manipur Nursing Council, and the topic is Transforming Nursing Education through Innovative Teaching Method. From 11 a.m. to 12 p.m., we have our resource person, Mr. Lashram John Singh, Lecturer, College of Nursing, RIMS, and the topic is Psychological Adaptation and Coping Strategies in Educational Environments, Strengthening Teacher and Student Well-Being. And the chairperson for the first session will be Professor N. Nalini Bala Devi, Principal, Acme College of Nursing. After the second session, we'll have a short lunch break, which is from 12 p.m. to 1 p.m. And just after exact 1 p.m., sharp 1 p.m., we'll again start with the second session. That is from 1 p.m. to 2:30 p.m. We have a third session from Mrs. Naraipam Bindya Devi, Assistant Professor, College of Nursing, Medical Directorate, and the topic is Strengthening Evaluation Skills in Nursing Education. Last but not the least, resource person will be Mrs. Chingthon Liu KG, Principal in Charge, College of Nursing, Churachandpur, and the topic is Enhancing Nursing Education through Educational Media and Emerging Technologies. And the chairperson for the second session will be Professor N. Santi Devi, Vice Principal, Irengbam Thamcha Devi, College of Nursing. At 4 p.m., we have the complete academic session, and from 4 p.m. to 4:30 p.m., we'll have the valedictory session, and from 4:30 p.m. to 4:45 p.m., we'll have a vote of thanks presented by our Miss Monica Lashram, Assistant Professor, Raj Medicity Nursing Institute, and from 4:45 p.m. to 5 p.m., we'll have a short tea break. And that is the end of our program schedule. Thank you. dear dignitaries and delegates, I would like to briefly introduce about our college. Our college, Raj Medicity Nursing Institute, was established in the year 2025 at North AOC Imphal, and it is a premier private institution under the Raj Medicity Human Care Foundation. The college is affiliated with Manipur University and recognized by Manipur Nursing Council and Indian Nursing Council. The college is dedicated to nurturing competent healthcare professionals with a sprawling campus equipped with cutting-edge simulation laboratory facilities. Let me also briefly introduce about the conference. It is our first state-level conference on teaching and learning process in nursing education. This state conference is designed to bridge the gap between traditional pedagogy and dynamic needs of modern nursing. The conference aims to equip teaching faculty, clinical instruments include integrate technology and media into nursing education effectively. I would like to introduce the patrons of our today's program. In the patrons, we have our respected Sri Habijam Rajan Singh, Chairman and Managing Director, Raj Medicity Hospital and Raj Medicity Nursing Institute. We have Dr. Ngarangbam Narendra Singh, Chief Medical Services, Raj Medicity Hospital. We also have Dr. Aribam Ibotombi Sarma, Medical Superintendent, Raj Medicity Hospital. We also have Dr. Kangujam Razo Singh, Senior Consultant in the Department Anesthesiology, Raj Medicity Hospital, and former Director, Health Services, Government of Manipur. And in the conference chairperson, we have Professor N. Nalini Bala Devi, Principal, Acme College of Nursing, and Professor M. Santi Devi, Vice Principal, Irengbam Thamcha Devi College of Nursing. As our resource person, we have Dr. Aribam Jamuna Devi, Registrar, Manipur Nursing Council. We have Mrs. Chingthon Liu KG, Principal in Charge, College of Nursing, Churachandpur. We have Mrs. N. Bindya Devi, Assistant Professor, College of Nursing, Medical Directorate. And last but not the least, we have Mr. Laishram John Singh, Lecturer, College of Nursing, RIMS. Thank you. Let us take a moment again of highlighting our program of our first state level conference on teaching and learning process in nursing education as we wait for our dignitaries to arrive. So from 8 a.m. to 9 a.m. we have our registration and breakfast. From 9 a.m. to 9:30 a.m. we have the inaugural session and live lighting ceremony. We also have the bouquet and langan presentation from 9:30 a.m. to 9:45 a.m. We have a welcome speech by our Mrs. Karaibam Surjaya, Assistant Professor, Raj Medicity Nursing Institute, from 9:45 a.m. to 10 a.m. We have a speech by our respected Shri Habijam Rajan Singh, Chairman and Managing Director, Raj Medicity Hospital and Raj Medicity Nursing Institute. There is some slight changes of the timing. This was the proposed plan of our program schedule, but as we are waiting for our dignitaries to arrive, there may be some changes in the timing. So for the academic session, in the first session, we have our resource person, Dr. Aribam Jamuna Devi, Registrar, Manipur Nursing Council, and the topic is transforming nursing education through innovative teaching method. For the second session, we have our resource person, Mr. Laishram John Singh, Lecturer, College of Nursing, RIMS, and the topic is psychological adaptation and coping strategies in educational environments, strengthening teacher and student well-being. And the conference chairperson for the morning session will be Professor N. Nalini Bala Devi, Principal, Acme College of Nursing. After the morning session, we'll have a short lunch break from 12 p.m. to 1 p.m. And after 1 p.m. sharp, we will start with the afternoon session. That is from 1 p.m. to 2:30 p.m. We'll have the third session by our resource person, Mrs. Namarapam Bindya Devi, Assistant Professor, College of Nursing, Medical Directorate. Ladies and gentlemen, let us take a moment to welcome our resource person, Dr. Aribam Jamuna Devi. Welcome, ma'am. With sirs and ma'am permission, I would like to start the program. Once again, Kurum Jiri. A very good morning to one and all. Knowledge shared is knowledge multiplied. The classroom builds knowledge, the clinical area builds confidence. On behalf of Raj Medicity Nursing Institute, I warmly welcome all our distinguished dignitaries, respected faculty members, delegates, students, and guests. With this inspiring thought, tell me and I forget, teach me and I remember, involve me and I learn, it gives me an immense pleasure to cordially welcome all the distinguished dignitaries, eminent resource person, respected principal, faculty members, delegates, students, and honored guests to the first state level conference continuing nursing education on teaching and learning process in nursing education, organized by Raj Medicity Nursing Institute, not AOC, Imphal. I myself, Mayabam Anjubala, and it is my privilege to be your master of ceremony for today's program. Today, we have gathered here with a shared commitment to enhance excellence in nursing education through innovation, collaboration, and lifelong learning. We sincerely thank each one of you for your gracious presence, which has made this academic event truly meaningful. May I now take the moment to acknowledge our dignitaries. Before we proceed further, it is my privilege to express our heartfelt gratitude to our esteemed resource person, patrons, and conference chairpersons whose generous support and unwavering encouragement have made this conference possible. We are honored to acknowledge the gracious presence of our resource person, Dr. Aribam Jamuna Devi, Registrar, Manipur Nursing Council. We also sincerely acknowledge the presence of our patrons, our respected Sri Habijam Rajan Singh, Chairman and Managing Director, Raj Medicity Hospital and Raj Medicity Nursing Institute. I will also take the moment to acknowledge our respected Dr. Aribam Ibotombi Sharma, Medical Superintendent, Raj Medicity Hospital. And I will also take the moment to acknowledge our respected patron, Dr. Kangujam Rajo Singh, Senior Consultant in the Department Anesthesiology, Raj Medicity Hospital, and former Director, Health Services, Government of Manipur. Though our chairpersons have not arrived, but I would like to take the moment to acknowledge them. We respectfully acknowledge the presence. We are waiting for the arrival of our chairpersons and some of our resource persons. I would like to acknowledge them, though they are not present here. We respectfully acknowledge Professor N. Nanili Baladevi, Principal, Acme College of Nursing, Professor N. Santi Devi, Vice Principal, Irangbam Thamcha Devi College of Nursing, which will be our conference chairperson. And we are also honored to acknowledge our resource person, Mrs. Chingthonliu KG, Principal in Charge, College of Nursing, Churachandpur, Mrs. Namarapam Bindya Devi, Assistant Professor, College of Nursing, Medical Directorate, and Mr. Laishram John Singh, Lecturer, College of Nursing, RIMS. I sincerely acknowledge our respected patron, though sir is not present at the moment, Dr. Ngarangbam Narendra Singh, Chief Medical Services, Raj Medicity Hospital. On behalf of the organizing committee, we convey our sincere appreciation to our respected patrons for your generous financial contribution, constant guidance, and steadfast support in making this state-level conference a grand success. Your commitment to promoting quality nursing, education, and professional development is truly inspiring. May we request everyone present here to join us in giving our esteemed patrons a warm and heartfelt round of applause for the financial support and the unwavering, steadfast guidance they have given. Thank you, sir. We now proceed to the life lighting ceremony. This symbolic ceremony, through the pouring of water, signifies the continuity of life, unity, hope, and our collective commitment to serving humanity with compassion and dedication. To comment this auspicious program, I request our respected dignitaries to kindly proceed for the life lighting ceremony. Thank you, esteemed dignitaries. May I request all the dignitaries to kindly take their seats. Thank you, sir. Thank you, ma'am. To express our gratitude to our honored dignitaries, we shall now present our token of appreciation. I now request our respected Professor Okram Subadani Devi, Principal, Raj Medicity Nursing Institute, to kindly present the token of appreciation to our respected patrons. I request ma'am to kindly present to our respected Sri Habijam Rajan Singh, Chairman and Managing Director, Raj Medicity Hospital and Raj Medicity Nursing Institute. Thank you, sir. I request ma'am to kindly present to our respected Dr. Aribam Ibotombi Sarma, Medical Superintendent, Raj Medicity Hospital. Thank you, sir. Thank you, ma'am. I request ma'am to present to our respected patron, Dr. Kangujam Rajo Singh, Senior Consultant in the Department Anesthesiology, Raj Medicity Hospital, and former Director, Health Services, Government of Manipur. Thank you, sir. Thank you, ma'am. To honor our resource person, I request our respected Mrs. Chungkham Bidarani Devi, Vice Principal, Raj Medicity Nursing Institute, to come forward and present this token of appreciation to our respected Dr. Aribam Jamuna Devi, Registrar, Manipur Nursing Council. I request our respected Vice Principal, Mrs. Chungkham Bidani Devi, to present a memento to our respected resource person, Dr. Aribam Jamuna Devi, Registrar, Manipur Nursing Council. Thank you, ma'am. To formally welcome everyone gathered here today, I now have the honor of inviting Mrs. Karaibam Surjaya, Assistant Professor, Raj Medicity Nursing Institute, to deliver the welcome address. I would like to take a moment, Ma'am Surjaya Karaibam. Before moving on to the welcome address, I would like to take a moment to present the memento to our respected patrons who are present here today. So I would like to request our respected Professor Okram Subodhani Devi, Principal, Raj Medicity Nursing Institute, to kindly honor our patrons with the memento. I request ma'am to present the memento to our respected Shri Habizam Rajan Singh, Chairman and Managing Director, Raj Medicity Hospital and Raj Medicity Nursing Institute. Thank you, sir. Thank you, ma'am. I request ma'am to present to our respected Dr. Aribam Ibotombi Sharma, Medical Superintendent, Raj Medicity Hospital. Thank you, sir. Thank you, ma'am. I request ma'am to present to our Dr. Kangujam Raju Singh, Senior Consultant in the Department Anesthesiology, Raj Medicity Hospital and former Director, Health Services, Government of Manipur. Thank you, sir. Thank you, ma'am. Once again, I would like to formally welcome our Mrs. Karaibam Surjia, Assistant Professor, Raj Medicity Nursing Institute, to deliver.
Especially faculty members and students, and lastly, the organizing committee of today's function. Once again, I would like to thank you all. This is the first step level continuing on nursing education. Topic is teaching and learning process in nursing education. And the one important thing is that this conference is awarded Star 1 point is awarded to the members present here, namely faculties from different institutes and students. This is very important one. As in my opinion, such type of CNE, continuous nursing education, is very important thing, because college ama or institute ama to why basi koi class ngak takpa asingak nataba different resource person kaya gauraga makhoi gi knowledge kaya ama share toramba aduga torumibas knowledge du share person amagi through the discuss toba khangdaba kaya nainaba class ta takpa khang nataba atoba topa knowledge kaya ama maduri the putho kanda resource person no ngang ba sida as a faculty member or as a student khangdaba lei raga su function dugi share person dugi magi man moderator moina wang bagi matam piba adagi sumai doroga conference have silly conferences hain pangthok da mi ga isi akhui leiriba horkadaba Satra Singh Sidda, Yam Pajaba message Makuin Tambagi Tanjama, Adu Tamakak Natana, my personality is built up to Bugi Tanjama, Adumba, both administration as well as education and knowledge. Assume Mayam says that Yamna Afava idea Yam Pangadava Adumba Yam golden opportunity among Nihana Itamjage. I physically handakse kidang unfit oibagi matang oibanina aisi am kuin ngangjaroge aisi kuin lepada kidang nungaitaba ma sum leibani kaisuna tabada miniscus ta kidang tiar khar leibuna maram oraga aisi kidang rest oraga leibani doctor ge advice ki matungina medication toraga adubu ngasi ki function asi yaudagadi yam nungaitaba ma I want the Paubagi put them a lack with na no I drag so war so one stick season the Ragatorga and see functions he Shatra Singh Laiba Mayam Maruena Raj Medicity College Shatra Singh Aduga different institute the Laiba Shatra Medi faculty member Mayam Jubu interact over Tanjaduma ꯌꯥꯝꯅ ꯂꯧꯖꯅꯤꯡꯕ ꯑꯗꯨꯒꯤꯗꯃꯛꯇ ꯉꯁꯤꯒꯤ ꯄ꯭ꯔꯣꯒ꯭ꯔꯥꯝꯁꯤꯗ ꯌꯥꯎꯖꯕꯅꯤ ꯑꯩꯁꯤ ꯌꯥꯎꯔꯣꯏꯅ ꯈꯜꯂꯝꯕꯅꯤ ꯑꯗꯨꯕꯨ ꯃꯌꯥꯝꯒꯤ ꯌꯥꯝꯅ ꯏꯟꯊꯨꯁꯤꯌꯥꯖꯝ ꯑꯣꯏꯕ ꯃꯌꯥꯝꯅ ꯄꯔꯐꯣꯔꯃꯦꯟꯁ ꯐꯖꯅ ꯄꯤꯕ ꯈꯣꯠꯄ ꯃꯌꯥꯝꯁꯤ ꯎꯕ ꯃꯇꯝꯁꯤꯗ ꯑꯩꯉꯣꯟꯗ ꯏꯅꯣꯠ ꯑꯃ ꯍꯥꯞꯄꯛꯄꯗꯨꯅ ꯃꯔꯝ ꯑꯣꯏꯔꯒ ꯉꯁꯤ ꯄ꯭ꯔꯣꯒ꯭ꯔꯥꯝꯁꯤ ꯌꯥꯎꯗꯕ ꯌꯥꯗꯦ ꯋꯥꯔꯁꯨ ꯋꯥꯅ ꯃꯇꯝ ꯈꯔꯗꯁꯨ ꯄ꯭ꯔꯖꯦꯟ ꯑꯣꯏꯒꯦ ꯍꯥꯏꯅ ꯂꯥꯛꯆꯕꯅꯤ ꯑꯗꯨꯅ ꯑꯩꯅ ꯁ꯭ꯇꯤꯛ ꯄꯥꯏꯔꯒ ꯁ꯭ꯇꯦꯖꯗ ꯊꯣꯛꯑ ꯈꯣꯠꯂ ꯇꯧꯕꯁꯦ ꯃꯌꯥꯝꯅꯗꯤ ꯌꯥꯝ ꯑꯣꯠ ꯑꯣꯏꯅ ꯎꯕꯗꯤ ꯂꯩꯔꯝꯕ ꯌꯥꯏ ꯃꯌꯥꯝ ꯋꯥꯔꯧꯕꯤꯒꯅꯨ ꯑꯩꯁꯦ ꯌꯥꯝ ꯌꯥꯎꯖꯅꯤꯡꯕ ꯑꯗꯨꯒꯤꯗꯃꯛꯇ ꯑꯩꯁꯦ ꯁ꯭ꯇꯤꯛ ꯄꯥꯏꯔꯁꯨ ꯄꯥꯏꯅ ꯉꯥꯏꯍꯥꯛꯇꯁꯨ ꯊꯣꯛꯀꯦ ꯍꯥꯏꯅ ꯇꯧꯖꯔꯝꯕꯗꯨꯅꯤ ꯑꯗꯨꯅ ꯑꯔꯣꯏꯕꯗ once again I would like to say something because today's conference may not be success without the support of our patron members, especially Dr. N. Narendra, Dr. Aribam Ibotomi Sharma, and lastly, Dr. K. Rajo. We may not be able to success this conference without the support of this patron member. And once again, thank you, all of you. Goodbye.
Thank you, sir, for your immense support, guidance, and inspiring speech. Let me take a moment to welcome our conference chairperson of our today's auspicious program, Professor N. Nalini Bala Devi, Principal, Acme College of Nursing. To honor our conference chairperson, I request our respected Mrs. Chungkam Bidarani Devi, Vice Principal, Raj Medicity Nursing Institute, to come forward and present the token of appreciation and memento to our respected chairperson, Professor N. Nalini Bala Devi, Principal, Acme College of Nursing. Thank you, ma'am. We now begin with our academic sessions. It is my privilege to inform you that this session will be chaired by our conference chairperson, Professor N. Nalini Bala Devi, Principal, Acme College of Nursing, whose guidance and expertise will lead us through the proceedings. I request Madam to kindly come forward and take the seat on the dais. Ma'am. Ma'am, sit. We are honored to have our distinguished resource persons for this session, Dr. Aribam Jamuna Devi, Registrar, Manipur Nursing Council. I would like to briefly introduce our chairperson first. Our chairperson of our first session, Professor N. Nalini Bala Devi, Principal, Acme College of Nursing. Ladies and gentlemen, it is my great honor and privilege to introduce our esteemed conference chairperson, Professor N. Nalini Bala Devi, respected Principal of Acme College of Nursing. Professor N. Nalini Bala Devi is an eminent nursing educator and administrator with an illustrious career spanning for more than 44 years in nursing education and healthcare. She earned her Bachelor of Science in Nursing from Rajkumari Amrit Kaur College of Nursing, Delhi University, and her Masters of Science in Nursing from specializing in child health nursing from the Regional College of Nursing, Guwahati, Srimanta University Health Sciences. Throughout her distinguished professional journey, she has served in various capacities from tutor and professor to principal of the College of Nursing Medical Directorate, demonstrating exemplary leadership and an unwavering commitment to nursing education. With extensive experience in teaching both undergraduate and postgraduate nursing students, she has guided and co-guided numerous postgraduate scholars and has played a significant role in mentoring future nursing professionals. Professor N. Nalini Baladevi is a life member and executive member of the Trained Nurses Association of India and has twice served as the Resource Education Chairperson of the association. She has actively participated in numerous national and state-level training programs, continuing nurse education programs, workshops, and conferences as a distinguished resource person and speaker. She has also shouldered key academic responsibilities as an examiner, question setter, moderator, and office in charge of the MSc Nursing examinations and has contributed significantly to the Manipur Nursing Council in promoting excellence in nursing education. Her remarkable dedication, visionary leadership, and invaluable contributions to the nursing profession have earned her immense respect and admiration across the nursing fraternity. Thank you. I would like to extend a warm and heartfelt welcome again, ma'am. Next, I would like to briefly introduce our resource person, respected Dr. Aribam Jamuna Devi. It is my great pleasure and privilege to introduce our esteemed resource person for the first session, Dr. Aribam Jamuna Devi, Registrar, Manipur Nursing Council. Ma'am had completed her Master in Nursing from Srimanta Sankardeva, University of Health Sciences, Guwahati. Dr. Aribam Jamuna Devi is a distinguished nursing professional and academician with more than 30 years of rich teaching experience. She has served as an associate professor at the College of Nursing Medical Directorate, Imphal, where she made significant contribution to nursing education and the professional development of countless nursing students. Currently, Dr. Aribam Jamuna Devi is serving as the Registrar of the Manipur Nursing Council, where she continues to play a pivotal role in strengthening nursing education, professional standards, and regulatory practices in the state. With her vast academic expertise, administrative leadership, and unwavering dedication to the nursing profession, Dr. Aribam Jamuna Devi has been an inspiration to nursing educators and student life. Ladies and gentlemen, let's extend a warm welcome to our distinguished resource person, Dr. Aribam Jamuna Devi. We are deeply honored to have you, ma'am, with us today and eagerly look forward for your valuable insights. May I now respectfully invite our session to our conference chairperson, Professor N. Nalini Baladevi, Principal, Acme College of Nursing, to take charge of the proceedings and conduct the first session of our today's first state national conference on teaching and learning process in nursing education. Thank you, ma'am.
Cina depan. Hello.
How are you? Yeah, Malaysia. Good morning. I welcome the speaker of today's first morning session, Dr. Aribam Zamuna, to deliver on the topic transforming nursing education through innovative teaching method. So I handed over the speaker to.
Thank you.
Yani ano sila?
Okay, thank you, my respected senior Professor N. Nalini Bala Devi, chairperson, conference chairperson of my topic. So now I'll be discussing, I'm speaking on the topic transforming nursing education through teaching, innovative teaching methods. My topic will emphasize especially on the innovative teaching methods, and the approved class hour is 1 hour only, so I will highlight the important points first. Let's see, we know what nursing education is. Actually, nursing education is a planned and systemic discipline that is implemented through curriculums. Teaching learning process is going on in order to prepare the students, the updated knowledge, skill, social skills, professional skills, required knowledge in order to render the health care of all the peoples in all the stages of the life, in all the phases of the life, maybe in the healthy way or in the ill health conditions. Also in all settings we are preparing the students. Once nursing education is mentioned, there are 2 points. That means there is interrelations. In the scopes of the educations, we are performing teaching learning processes by, that means utilizing a particular curriculum of the nursing. There are many perspectives of the nursing programs, we all know. For every program, we have the specific curriculums, and that curriculums we are implementing through teaching and the learning process, and we are inducing knowledge, transforming knowledge and the skills to the students. So to introduce the topic, let us just highlight what is teaching and what is learning. Teaching, we all know that it is an integral part of the educations. In teaching, we are providing knowledge, develop understanding and the skills. But while providing knowledge, understanding the skills, what we need is we have to maintain the harmonious relationship between the teacher, students, and the curriculum. There should be correlations, stable correlations, and the harmonious relationship must be existed in order to render effective teachings. Then next, let's see the learning. Learning, we all know, learning causes positive changes in the learners' levels of the cognition, like cognitions in a sense in the thinking process. In the knowledge level, we are making changes into the mind of the students. We are inducing, we are infiltrating the knowledges to the minds regarding the nursing topics. Then the psychomotor skills, we try to educate, acquisite the required skills of the nursing to the students. Then another important thing is the emotional knowledge and the skills we are trying to modulate. Sometimes we used to tell like the emotional resilience or the emotional quotients. What actually it is, we need to discuss. It's not only imparting the knowledge, or it's not only imparting or acquisiting the knowledge, skills of the required nursing skills, but it is also important aspects that we are inducing about the emotional knowledge and the skills that is required of being a nurse. What actually this emotional knowledge and the skill is that this is nothing but the ability to understand, use, manage their own emotions. It is necessary to manage our own emotion as a nurse in our workplace. So we are trying, we are preparing their mind. We are instilling the emotional knowledge and the skills also while imparting the curriculum to the students in the process of their learning. This is why we are instilling the knowledge to manage their own emotion this is to empathize with others. By controlling their own emotions, nurses should be able to practice the empathy. Empathy, compassion, we should be able to implement in while caring the care of the patients. So how we can practice the empathy, how we can practice the compassion, that is by controlling our emotions is the prior necessary steps. We need to control our emotions first. So just controlling of the emotions so as to empathize with others and to overcome our own stress is also one of the important functions of learning in nursing education. And whatever we are trying to make changes, we are trying to induce the knowledge, skills and the emotional knowledge and the skills. Their students should be able to demonstrate in their behavior at the end. Once the students learns means whatever we have taught, whatever we have met up the objectives, that should be fulfilled at the end and that should be exhibited in the behavior of the students. Then only we'll come to know that the students learns the curriculum or learns the specific topics. This is about the teaching and the learning. But now my topic is about the innovative teaching methods. Actually, what is this innovation? Why there is need of the innovation in teaching? Actually, innovation it is nothing but the process of bringing about new ideas, methods, product, service or solutions that have a significant positive impact and value. It's not that nursing education, we are not there since the beginning. Yes, we are continuing from the very beginning, we are continuing our nursing education. Since the times of the Florence Nightingale, nursing education's curriculum has been developed and we are continuing the nursing education. Nursing education. But why innovations here at this era? This is because innovation is needed now. There are some reasons that we'll discuss. But innovation existing pattern to the anova process, anova idea, anova methodology, anova strategics mayam sama implement of salakpa, ama mathok tarak pagine. Anova pot mayama, product mayama, method mayama, create torokpa, then idea mayama create torokpa, implement torokpagi, the whole process we know, we called it as innovation. But the need of the innovation in nursing education is very prior now. Let us see. It's not, as I told you, innovation in nursing education means it's nothing, but it is the introductions of the new methods or techniques. In the existing pattern of the nursing education, in the existing pattern of the, say, educational methodology, what we are doing is that we need to introduce some new strategies and methods in the existing patterns. There should be some aim for introducing these innovative new techniques or strategies. The aim is to empower learning. By applying the innovative strategies into the teaching learning process of the nursing education, what our aim is to empower learners to take complete ownership of their learning process. Students should be able to take their complete ownership in their learning process. By utilizing this, by using this innovative techniques, we will make the students to take their own responsibility to learn their nursing curriculums, their nursing skills. They will take the whole responsibility of their learning process. This is the important things. This is the aim for implementing innovations in the existing teaching methodology. So there arises some importance of innovation in nursing education. Why we need to implement innovations in the nursing educations? There are some important points that we have to be discussed. First point is by utilizing these innovations, by introducing innovation strategies, the benefits, the needs, the importance, number one importance is it helps to adapt the changes. Innovations helps to adapt the changes. Changes in a sense, we all know that the disease pattern, the scenario, the things, the demographic scenario, the disease pattern, the innovations, the technologies has been changing, we have seen. Aduki matik ahong malaygre. Ako'y loinamak khange in the medical field, in the nursing field, in the technological aspects, there are many changes, there are many innovations. IT technology mayamam puthorakre. Aduna di kayo batay, if we do not use the technology, who will use it in one sense? Ako'y chusisin na batawa. Kayo na ba? To be able to make the students to take their own responsibility in their learning process. Innovation techniques mayam decision na rakanda, we will initiate the critical thinking process. We will instill the logic and the steps of the problem solving techniques to them. That means the students will be able to take their own responsibility of their learning. Innovation techniques mayam decision na rakanda, moida ako'y na adopt to hale ba hong ba mayam se khang ba ubak understand to ba helan na bagi da magta innovation season na ba mathok tai. Then moreover, changes is not only in the technology, there are changes in the policies also. Healthcare policies has been changing. Previously what happened, the main mortality cause, the main death cause was communicable disease, matamamda, natra. But now what happened is in the trends, the main cause of the mortality is because of the non-communicable disease that we all know. That means definitely there should be many policy changes. Moreover, global policies are under the roof of the global policies by the WHO. WHO and the policies yamakanda koi state country da in the state or in our context we are implementing according to the priority. So we need to be adopted. Sigi posi hong ba sida adopt to bangam na bagida magta nursing education da innovation darkar la have. Then atopam na mo kayo, and the other one is the emerging health issues. Emerging health issues. Can you guess, participants, what are those emerging health issues? Kariyoy batay? There are many emerging health issues now because of the climate change. Many diseases has been re-emerging. Again, many infectious diseases have threats on the lives of the people that we have seen in the COVID-19 pandemic. So might of the emerging disease, but it is re-emerging because of the very factors. Based on many factors, it is re-emerging. Then again, suppose measles vaccine na koi na copy. Measles vaccine kap na, there are evidence of the measles outbreak. Vaccine pina outbreak la isi kay no, that is re-emerging. Sigumba casing sida koi na, kay to batay, nursing education sida equipped to na bagida magta koi train to rakanda. Adagi innovation techniques mayam decision na nurses should be made to be able to help to adapt the changes. See, this is the first importance. Then next, another is the diverse learning needs. We all know that in the nursing there are students from different backgrounds. Institution namda koi Manipur da hang badadi ayambana from the hills and from the valley students. But in the international or national level, there are students from diverse backgrounds. Diverse backgrounds in a sense, every individual has their own learning styles. Masa-masa ki learning style am lai jane ba kaino kharam na di mami na yengaga wakhan khalakanda moi learn to ba kharam di ka dore they need to study from the textbook. This is their specific pattern. That means the learning styles of every students are diverse, are different. So by using this innovative methodology, innovative strategies, what will happen? We will try to meet the learning needs of the specific individual, specific students. That means innovation methodologies or innovation teaching methods are not a single method. It is the integration of different and diverse methods. According to the specific need of the students, the teachers will be able to adjust it to understand the topics at their level. Suppose the lecture method, now we are utilizing only the lecture method now. I am speaking and you all are listening. I don't know how much you have learned also. And I cannot make sure that everyone has got the information. That depends on many factors. But in case of by utilizing these innovative methods, what will happen? Instead of speaking here, we will divide the topics We'll make the groups, small groups. I can give you say, some assignments or some topics, and the groups will discuss. You will find out the strategies. Then the groups can explain here by coming up to the stairs. That means the one who involved into the group, they will learn the things. They will take their own responsibility to learn the problem-solving strategies of the particular specific condition. But here, what happened in the lecture method? Ay nangang ni mayam natani. That means I'm taking the responsibilities of your learning now in this scenario. This is the old technique. Aduna hujik tawra kadoi sidi kaino mayam si actively involved torok pagi pot ne bala kadoi si ko. Aduna karino hai kan the key to effective modern teaching is not about completely abandon tradition. That means it's not that we should not use completely the lecture method. Akoi sungsi season arugum si hai banatiam. But in the lecture methods there are also innovations. As because it is only 1 hour, I cannot go deeply through that technique specific small sets of the techniques. Adu the disang ba yararoi ba topic si maram di kaino this is above the overall methods to neba. Adu na kay do bata akoi na lecture method loi tok kani hai banate huji aina haijagri duni the concept of innovative pedagogy is recognized as proactive methods of integrating teaching strategies. Integrating in a sense there will be sets of the strategies natra. Tongan ba strategy mayam amna punjalaga yam proactive oiba mawng amada teaching learning process sida oja sing sina teaching toba matam da seasonarak panya ba adugi what are those different strategies haiba pot tu dane ba ina sanction jaraka dois kadona bano hojia lecture method khak tawraga curriculum cover taw ya bado different methods seasonar ka du se kari gino hai kan da last tanga sai ga ina panjagi ba importance ani do adu fulfill tawna bane ya bireko. Okay, then next let's see importance of innovative, still continuing. That means what happens is that while utilizing the innovative methods, the students' levels, we can make the students engage in the teaching learning process actively. Innovative techniques, the students, it's not that you are just sitting and listening to my lecture. You will come up and you will interact. That means once you are participating into the teaching learning process, means you will be engaged fully. Now some of you might have some daydreams. You might have things for some other own personal problem. But what happened in this case, by using these innovative strategies, you will come up and will participate. That means students will be engaged actively into the teaching learning process. This is one of the important objectives. Then number 2, real world application. We have heard about the simulation. Have you heard it? Simulation. I think the group is mostly the nursing educators. Maniko zangak ko yambana. Simulation tabire ko. Karino simulations. Just think and exercise in your mind. Karino simulation. There's nothing. But a real world scenario is created into the labs. Real world scenario laboratory. Before directly dealing with the patients, with the real patients, what happened that we are creating some real world scenario so that the students can learn into that, that means mimicking environment. Patient din nataba, living beings din nataba. Aduga swaida kay doktare patient heart attack togdore se utkadoini ngasagi medical high fidelity monikin sida. My heart attack togdore apnea tore chest pain emotional expression mayamama thabak na bagi adagi wa bagi sorphun bagi all those parameters physiological changes parameters will be that means in the mode of this physiological status we will that means programs on the high fidelity mannequins. Yamamantang ba phaba makhalgi mannequins sida koi heart attack to handoi ne ba just like the real heart attack atumaina lep sida. Students in heart attack patient what are those priority needs, what are those strategies, what are those say treatment protocols that we have to adopt in such cases. Real patient na tabadu da tam badu ne ba koina simulation kaurise tamisina karikana dore definitely they will earn the skills, but in a safer environment. Real patient the man khangdring the pyro ragati patient sigragati there is safety risks natra, but before directly dealing with the real patients, they will learn in the real world scenario so that they can practice the strategies repeatedly, they can acquire the required skills in the labs. Then once they will acquire the confidence, sabchana hairani, confidence lairani, then only they can directly deal with the patient. That is the strategy. Hujik akoi gi Indian Nursing Council gi teaching strategy da su simulation haiba poche akoi yam toina thengnaraba wafam ni ko. Simulation da phattaba means low fidelity mannequins thambagi thoidongna darkar oide. Simulation to gaya tar high fidelity mannequins, I think that will be more purposeful and more effective. Ko malhan ba koi na bhapna sagalaga malhan ba du na taba tas eng na parameter to an ba do patient sida yan da bi ko adu kumba mannequins samada tamhan ba taragadi adu ne ba koi gi focus innovative nursing kind of teaching methodology sida lakadu ise real world applications means simulation sibu ne ba then next improve outcome karigino khoina real world scenario ma sagalaga patient juna ta badu the patient mal halaga heart attack ta holaga tamdori ba adu karigino hai kanda definitely when they deal with the real patients there will be improved outcome patient gi outcome improve masana ta bata ba natro gyanta bireko. Then again next is adaptable strategies. That means it's not that only the lectures methods we will use, only the demonstration method we will use in the practical class or in the lecture class. Theory class. Theory da lecture ngata, then practical the demonstration ngata season ani hai base. This should not be fixed. There should be flexibility. While the teacher prepare to cover the curriculum, they have to utilize the different teaching strategies according to the need, according to the consequence, according to the type of the scenario. We have to utilize it. Integrated teaching methodologies we need to utilize. So that's why we need adaptable strategies. Then again, collaborative learning. Collaborative learning is very important. Suppose in our nursing curriculum also, we are discussing about active and passive exercise kind of tambi post-operative case. But if those active and passive exercise is being demonstrated by a physiotherapist instead of a nurse educator in a combined or collaborative program schedule, tambi targati how effective the teaching learning is. Oiroidra. Aikoina active and passive full range muscle exercise is seen in a tambibe an expert or a physiotherapist is coming, and if they are demonstrating or they are teaching in front of them, if the students practice, that means the teaching will be more effective. Collaborative. The interdisciplinary collaboration is needed now. Sigumba positive aikoina kaino ina lakaduise. Then current challenge later badinate. For each and every unit, if this, suppose you please imagine at your level as a nursing educator. Nang na takadori ba unit sida, instead of the lecture methods, if I am trying to integrate all those teaching methodologies, means how much study as a teacher you need to invest for each topic. Wazam na kayam na investor ko mathok tarakani. Unit 1 yahan ba topic sina ay na kari teaching methodology invest of sige. Satraji hainaba khangnaba. Second jina kari tausigese. You have to think it. You need to be very well trained and well. That means kari haitare. Yamna wazasing jihane. You need prior trainings, updatation aduki matik sang bapotnya. Yan tay ko. Jai na taujorom doi sidi innovative meeting method sing si highlight taujabani ko. But high ribbon method sing si implement taugi haita the teachers also needs training haibani. That is our challenge. Without training, I think it may not be much effective. The teachers will be confused. At the same time, students will also be confused. Aina bhajana khangdaba poto aina ta adi masana students sing si khangdaba ta bane. Ko aduna this is current challenge ni asai koin haijagre students hi tongan tongale na khara amdi kitang takpada khange khara amdi ka dore khangde khangdaba du hundu adra oja amagi mathau di kaino khangera khangoira tammi ba chatra se. How is her teaching, his or her teaching style is as a teacher, we shall have to identify, and accordingly we'll have to try to give the education high level. Class of the Satram the 90 Fangeba, class of the Satram the same class the 20 Kapangi fellow Karigino. There may be diverse teaching styles of the particular students. Student level to come or think about the teaching, different teaching styles of the students. Hai bangang si kari method tataga di learn to bunga mi habese. You need your research. You need your creative thinkings. Accordingly, according to the specific teaching styles, you have to modulate. You have to utilize the innovations. adugi level du ne buji innovative teaching method la ka doise again technological advancement har ga koine LCD sijina ba khaktang khalle ba no there are other modes I will see let me talk about that also in the following classes. Let's just have a learning pyramids. See, have you seen these learning pyramids previously? Khange ko khoi si loina maksya sida hai si hai ning si kaino. Please try to interpret it. Please try to that means analyze this cone. Si graph si am to isa isa gi level de analyze to biyo bakari no bahai ri se. These are nothing but these are the different teaching methodologies in one side. From the period active of the lecture reading in a period beside here. These are nothing but the different teaching methods to not rosibo. Akoina maroina akoina seasonal teaching lecture methods sineba. Lecture methods sina see the period 5% high after the after completion of your lecture method after some days, especially after 7 days, whatever you have taught, only 5% will remember by the learner. 5% khaktane ba teacher aina hujik ta isi so dunga. After 7 in the last class that you might have forget my topic. Aina hujik past class ta tai ba isi aroi ba da dinu kem ningjang da basu yai. Gyan ta bi ko sine ba teacher method ki lecture method ki effectiveness oi da bas aduga curriculum fulfillment da di ai syllabus loisan na bo na ba di we don't have any means. It's only the lecture method natra. So my own assignment ga that means very less effective teaching strategy ne ba koina seasonary se. Then next is reading. Satra sine mathanda pajare kaidore only 10% will retain out of 100. Then audiovisual act seasonary maram di kaino at the same time we are trying to stimulate two sense organ. With the suman audio and optical nerves we are trying to stimulate it now. I seasonary se uji ABSM seasonary voice seasonary ba. That means your two sense organ are activated. High river port and season rakanda topic sida dom na khangau doi se is only 10 retain tok doi se khangau doi ba means retain tok doi se in your mind. That is only 20%. Then again discussion means you have to come up, you have to participate natra doi thola ani participate or kanda di ka doni discussion topic ta to the 50% you will retain. Sida never interactive hello engagement of hello high is this finding shows it. Then again practice by doing. Adui mathak tanang na sana mahogala aga topic masam pira kan tanang na LCD ka se same dana different source sidagi nang na same saraga nang na tak na bo honarak pa matam dadi kay daw ni 75% will retain. Then this other nang na taklak pa kan dadi ay na topic ama mayam da tak na bo honarak kan dadi ang the retain to do this is 90% of the topic. Sineba do daw si ay ko na tawro mi si up to demonstration box di passive learning neba. Passive learning in a sense kay no. Have you heard about the passive learning? Groups. Passive learning si tabi rabo. Kay no passive learning idea. Kari no ko na hujik chathari ba teaching learning process ya. This is passive learning. One is speaking, others are hearing. You are not involving. That means the teaching and learning process is very passive. So me ko aduna passive learning sida koina khangdoi se koina satra the passive learning to kan the pi doi ban knowledge is only 30%. Aduna di fail rakta. So me ko adai koina di takre curriculum da di matik sana tambi satra di hairam de hai se that may be the cause. Janing ko aduna di usia koina active learning amo hen gai ta decision ra kadoi ba teaching strategy si karino discussion practice by doing. Teach others. Topic pithoga seminar tauraga satra duna seminar do sida kapaga mathanda pakpa da paraga interaction namta laitraga ma haini habanate. This other means you should the particular students should have to be accountable for the topic that it is. Ko satra da seminar loin piram gane khanjai oja puna ma tawalam gani class teaching. So me ko maduda mana only thing lesson plan ma semaga adu pa bana taba. The particular students should have to take full accountability of the topic that they deliver. Adugi level do you prepare to hantaba. There should be question and answer session. There should be feedback session. Atopa asagi skill sets of the skills mayam do koi loi hapchalak patab. Adu matam do deni husing 90% learn to ngam doise. Adu akoi na haina bam lai nursing students sing na. Aina seminar pi giba topic to question dala adi mayam kai dowi. What do you think? Suppose final exam year ki question jida aina seminar pi giba topic ama hanga eba mayam harau da braba. There is no response. That means there is no interaction. That means effectiveness will be very low. Kumbira over participate to wiro haibani. In a sense, I'm inviting you to interact haibani. Yanta because ya koina khangnar ba wafam ne sigi matungi na news ya koina innovation kaina darkar hoi rahi se. Innovative teaching, I no need to read the slides. I have already explained you. This is a proactive method. There should be integration of the different strategies. Sumeko innovative method teaching hai bisla kadoi si hanagi teaching method ama khak seasoner ga tak padu nati hai ba ma koi khange kaidora kani integration of the many methods. Anova method me ama punjal aga according to the needs, diverse needs of the diverse students akoi takani hai badu ma khangre ko takadori bu pose hanagi traditional yang conventional oi ba potu nate. That is unconventional oidoini. Hujik so aina hujik group am semga chage ba group se koi small group se ma ga assignment am piraga activity to mina se ba unconventional oira kane ba mayam se unconventionally feel tawni but at the same time you will learn the topic sine ba satra da taw khais even at the level of the teachers also you will feel unconventional definitely. Ek topic am piraga noi mayam je si discussion to rom minimum pige then you have to present it on the stage high go bada every one of you will feel very unconventional. Sumeko kari no koi di tage lag bani hair kane. But in the teaching learning process if we can adopt it student da high but teaching methodology se adopt or katar gadi definitely the educational objectives will be achieved at the end. Siniko Aduna, let us go through it one by one. This is the same thing. One of the important benefits of innovative teaching. Kari gino koi nang asagi constant engagement kay na satra si whole bunga mag class ida moy kok se class ida thamdoi ni interactive session sida aduna kari to hal ka dori ge haba kari no kana ba pido se hai kanda it boosts critical thinking. Critical thinking skill hai bado koi na yam toina hai na ba wafam ni but what actually is I say whether the concept is clear or not in your mind that is uncertain. Critical thinking steps, critical thinking strategies here. I koi no interactive ko helak pa matam da question na magi answer khumna bo hona rak pa matam da scenario ma putho akanda mimicking to na bo hona rak pa matam da di kai doira definitely critical thinking skill will be boost adu da neba. Critical thinking skill say na hai ho doise a theory gi step to ta agadi no there is no application. Problem solving steps kai se ko niam tak po neba but only the theory we are teaching. We are not directly that means make involve the students into the real steps. Problem am pithoga do the problem solve to ro kai na piraga di ka dorakani definitely that will boost the critical thinking and problem solving skills. Irai lai ba thabak nati haba Chima yang kana halaka doiba then increased engagement ma koi nai nagre then better retention and of information. Kari critical thinking skill hai ore problem solving skill develop ta gre then engage ta halle whole class ma do na ta ra doi di kaino at the end all the informations will be retained in the mind of the students. They will understand. The learning process will be fulfilled. The objectives will be fulfilled at the end. Sigi kana basidi then increase creativity and imaginations. Once the students learn the topic properly, that means in the similar another setups, another scenario, they will be able to apply the knowledge. Ay na pot naman mun nakhangraba siya tu manaba situation nam danang implement to bang makaneba. That is the climax of the learning. Bloom's taxonomy ki climax of the learning do. Once when the knowledge that you acquired, if you can implement in the another similar scenario, that means the climax is over. Do I do the total learning ay nalaka do. Okay, nursing education loin tambirok paganggu ni ko. Wazagi level ni na ay ju wazagi level dahai jabani. Si traditional method to niya ko na tamiba. Mayam tawag na tro physics tum lecture. Lecture do wazana no chembro. No chemata ibraiba. PPT chembra no chembro. Whatever it is, there is no interaction, no response. Very unconventional. Question kare la already unconventional adung oira daw niya koi se. Ko adugi unconventional barrier je thuga isi hai bane ba innovation na hairi se. Diyan tabi ko then textbooks learning. Textbook pusal laga takpi ba yaw bro. Classroom da. Yaw de. Yawi. Textbook para khang do isi ngasai percentage kaya no. In the learning pyramid ko nda kaya lagi. Textbook the learning the reading the only 10%. Then the clinical practice the coin to isi kay dawi demo tawi. Demo na khang risi kaya no 15%. 30% demo da. That means aduna di chatra se koina chaire last di kari haina takti takre hairam den. Why? What is the barrier? That we should, as a teacher, we should be able to find out the barriers, and we should have to modulate our teaching methodology at our level first. Wajang atani na haijabani ko ina haijari siya. I demand over na this is just a suggestion. Then the group discussion, sometimes is there any group discussion that I have prepared as a teacher for your students? So we have group discussion to ba? Library hajan ba duraba? Like ngasi di library award ni library sang ngohar 1 hour detain to badu group discussion ni hai do bribe. No in once teaching innovative teaching methods sikhanga avoid di. I koina tawri ba khuti magse. Whatever we have practiced, where is the deficiencies, you should be able to identify. How do identify to be effective? We are losing our time. 1 hour class, I say, I mango ineva, angangi, no kita mutai huzik mangi eba. But if there is no effectiveness, then what is the value? Value less or ba thabak to di kaino, that is not professional. For namesakes only we are working. That's not good. That's not the ethics. Adune ba ina laksa ningi point se. Sina asagi traditional to the innovation dai nga sai chu panjagre simulation. Then another conditions comes up, that is the flipped classes. We'll discuss it. Then interprofessional learning. Out of this, there are many sub methods. Amtang yang winasi technology enhanced learning. Je akoina educational technology. Dagi yam to ina haina riba po ni technology in nursing education kaise. Topic tadi am nga ba. Ko theoretically smai to lecture method tadi am nga but how much we can implement I do ne ba koina huji khando ise. Karino AI power tools. Ngarang the su in the nursing council, I think every one of you have attended the workshop. Ngarangi workshop yogi obro webinar. The nursing council gi AI use in nursing. Yogi ho bro. Restart tawi ko. I can find out no me am credit adum phangdoi ni certificate phangdoi ni. Ko aduna hujiki hai ba AI do ngarangi dudi in the overall nursing practice application gi pot ne. Auji koina huji na do isina kaino AI application in the teaching and learning process ne. The AI application is the Yamarona Tokla is here. Slight low patraga sukaidoni. There are two things. One is the BA and the other is the Kari. BA Hibama virtual Hibama deep immersion virtual Hibama Nevalaka. Hi Pose. At the end I have prepared one video that let us see together. Huziki Wena. Tools season adori AI tools season Narakanda teaching learning process. Real world scenario the Tambini Habaniko. Can you guess the point? AI use hai se teaching learning da. Can you guess the point? Ngambi bro guess the ba. Guess the one ngambi bro ngambi da braba. Adu bo huji at the end sa video sida mu yeng se ba. Technology enhanced learning sida adu kematik learning da kana doini kana doisi kari po no hai kan AI power tool ni season ar ka doise AI power tool lama isa da paksal laga sthatra sing sida paksal laga kai doni uphal laga. Moi masamak se ICU da thabak tawbagi pot ne ba udoi se masamak se decision lo da yaw doi ne ba masadi ma panda lai ba but mai mamita udoi se AI nurse ma marak serious patient udoi ne ba adoi marak sida patient gi problem si lai re adoi ta di aina han ba da kari tawni according to the priority needs phuting mak se hai riba AI power tool hai riba process season ragadi adugi system do the real world scenario si da tambayar kan hai bane adoi di definitely nursing education skills se adugi mati Pagala oidra improve to oidra. Torokadra to oidra. I don't know what are the response of the groups. Group na smite out agadi I have to just to cover the topics. I jo aigi topics hi cover tor masa kitab. There will be may not be no effectiveness. Yanda bigo groups need some response feedback to make to stimulate the talkers. Aigi wada na te sida lepa dori ba me khuti magto group ki interest ki matung ina wanga kanya ba this is the fact. If the groups are very alert, the talker will be very alert and she or he will try to transfer the information more and more. But if you feel say unresponsive and unattended, that means the talker will try to just complete the class. 1 hour class I lo salama lo ren sakhibiya ba. Sisu exam ni khangbi bam thokpane ba. You should be very much idle. Noina do maina da leraga di noina tambi ba chatra da noi kari hairi ge ba. Please don't mind the faculties. Respective the management groups of the Medicity. I am directly talking to the groups. I amtang mo interact og jage ba. I may adom ikai khudna tab dinate ko. I am excluding your groups. Please. aduna kay dogi ha kanda sumai sum leiraga di noi chatra na adumaina unresponsive oina leiba kanda noi yabra ha ba class ta yabro question answer session yok sela age aiso can you give the permission pipi bangam ga drive permission ko igo domorom zatkine na ai adwai do with help of jari neba but at least you need to give some psychological feedback to the talkers not only to me ai thandai wanate there should be constant psychological connection between the teachers and the students see connection laitraga di there will be no effective teaching panne amna nangi innovation seasonaraga so there will be no effectiveness this is research finding aduna masi interaction to biro hai bane sam samna do ai sida maroina ai se khoi india gi context ta manipur gumbai context ta di am di watli but this is the future trend akhoi no huji to baya badu ta musa thajara kya time ta na tenga sa gi ina haije gi the virtual augmented reality hai se virtual reality hai bam ne augmented reality hai bam ne poche sida is the lab darkar oi de ba lab darkar oi doi se manes the upi ba ai gear se sine ba ai se ai gear se mesi da option ga da mana sensor ang ma khut pai ne ba mai mamit si da ko ICU gi patient very serious ventilated patient with full of the complications unconscious then low urinary drainage high urine then unconscious vitals disturbed vitals adugi all scenario then difficulty respiration tracheostomy loina udoine ma marak sida yaudoine aise ko adu marak sida yaura kanda aduda artificial AI gi nurse mayam ma work tawne adu marak tanang tawdoine nang moi dei tam doine ba according to the priority moina kamai tawna monitoring tawi moina kamai tawna sai gi suction tawi moina kamai tawna patient gi heart rate kamai tawna moina assess tawi breath sound kari tari real breath sound will be able to hear in this lab si season kanda sigi pochi ne ba future oina USA da kangarang ka moina yam kana education de emphasize tawna ka do sigi lab sine adubu kitang wali akhoi gi scenario da khangdab dia dia khoi ko aju sima laire sima khoi kitang wat kidoni na matam du yora kan tawrasi hauji akhoi na tawba ya badi kaino kan the high fidelity simulation simulator de almost all the colleges and the schools school khudi mak se simulator laita ya de na parsu taw dana leidi loi leire but lairi ba simulator se there are 3 cadres of the simulator kai no low fidelity simulator mannequins haiba mane moderate fidelity mannequins haiba mane high fidelity mannequins haiba ma hum lakadoini akhoi da ayam lairi si low fidelity ne low fidelity means kai no patient amadi male ba but there is no parameter akhoi na sida thingedam ne na landmark to da ne bata ise yan tabi ko moderate fidelity da di kai daurakani e chen ba urakani ben urakani then suppose chest rise taurakani CPRP bakanda then chok taukanda magi pulse threadi o helakpa yarakani ko but response ti leiroi breath sound di taroi heartbeat ti taroi ba but in case of the high fidelity the dikai taurakani even the response also they will show mannequins will show the response adu me thakta amuk su ngasai all the parameters so oiragadi 3D pulse fast and 3D pulse lakani BP down taurakani heartbeat si kan oirakani 3D oirakani ko then colon clammy extremities all the scenarios will be simulated on that particular mannequins adu real patient ama dona adu dane ba treatment tam doise si poche akoi season bangam dri si masu akoi da lairi si low fidelity mannequin na ayam bani ko sidedi computer monitoring ama mapanda laini angang sina tawri si chumbra lanbra si expert sina mapanda phamma kanda magi effectiveness uba phangdoini lali gai tawhandoini until and unless monitor ji da chumme na thoktri ba that means repeated practice they can do habaneva adoi di how change the nursing education is if we can utilize such monitors such simulators yam change ma porok pangam gadra ngamoidra ko ngamakani habaneva ko aduma then simulation based learning da koi sidi am tawre khut mate ka leiraga IB te taido let us not go through this because there is time factor sima adum khangnara ba wafam ni as a teacher ko khwaidai kana base aina sigi slide se hapchari si kai no hai kan kana base ko benefits of the simulation training gi benefits si kai no hai kan da safe environment there is no question for the safety of from the patient side akoi the patient da di ani rakhana IB thilu ba the patient party saure patient saure asigi nurse pahela kanu hai ran ko they chainer ani emotionally harsh la ani workplace hazard la ani khoi da violation la ani ego crash tawrani confidential handagrani spoil tawre education do adu hujikti ke dore simulator da tam targadi safe environment, that means there is no safety points from the side of the patient safety ki wala ite you can penetrate 100 times until and unless you acquire the skill nang na skill hai tribau si da season ba there is no risk patient da di agadra yar oi ko aduni. Then number 2, build confidence. Hanjan torka haiba means I will have to have the confidence to na thabak torka doine bhaiya. Then again, enhance critical thinking. Ahan ba thin bada pandre kari gino kai do batai ai anirak subasi dadi ai da sure shot oina ba kai do batai adu bhau yaraktre sleepy oigre adu third di ai kari technique muk season na batai. That means the critical thinking strategies will be developed automatically in the mind of the students. Example masang khaktani ko ina pizari se. Then again, improve communication. Adu di hanjan thilam dai tesu just like a real patient you have to communicate with the patient. Ahan baidu di ai bhim thin jage ko adom dai flu sikap jage ko hairaga permission ma lorga kapu hai ko anirak je mu thin dore ba ahan baidu fail oi re handak so muk thin batare kap ta badi ya de kitang biar to biu hai do ne ba anirak phau di haire confidence line ahom lak su rak paddi nang kari hai dori patient na kari response to rak dori adu itaragadi sigi simulators dadi 100 times also you have to practice how to communicate with the patient. That means the communication skill will boost at your level, at the level of the students. Sine ba koina target or kado is again improve communication. Then at the end, whatever we have done is for the better patient outcome. Patient ki phagibna bang atana tro koin tog doise. Nurse na haiba means kedona bano nurse ka tang hairaga patient pai drati kari ka nei. Final outcomes is the patient outcome do not draw. See khakine ba koina innovation na mane ba simulation hai si. Sima then again simulation based learning in nursing si waja mana simulation to bi hai tardi these are the steps from 1 to the 7 step you have to prepare. Left tadi medikindi loi lai reko whether you are apply which steps you are applying that I do not know. Maram dia educational audit chat pangam dia ba institution me am chida. Ahen ba thabak ne ba madu. Ado sidai lai re ahan bada design ki stage je wajagi responsibility ne ba design ji waja se ne am appropriate design ma tawdraga di it is impossible to learn by the students am appropriate over design ma nang develop to ba mathau tai then design ji tor ba matung to prepare tor ka doi ni all the required articles environment you have to set it you have to prepare it you have to collect it then implement tor ka doi ne ba nang na hana ta ka doi ne ba it's not the students will directly go to the simulation you have to demonstrate it first. Adu nang hana tawjadoi ne ba nang implement tawbidoi ne ba aduga adang na tawr matung satra to holakan de nang na tawringa da atopam na mo observe to handoi ne ba ujasina tai ba se chumbrai se atopam na observe tawdoi ne ba monitor isam chamna deficiency khara laidoi ne as because you are also a human being as a teacher oja oi tar so khoi su sometimes aran ba dum yawe ba maram di kai no human beings are very prone to get error yan dai ko adu da kari step ta soi ri ge nang na tak pa sida hai ba se atopo exam na puthok pa yai. So that the whole teaching learning process should have to be improved. Badu nati ai waja oi re ai professor oi re akoi professor yam yame akoi gi nursing education da Manipur da huji self style then I don't know adu gi mayam je you think yourself you take your own appraisal whether I have developed the required skills of being a professor I do can be over. Sineba important oi re ko aduna adugi potsi togi haita di simulation to betarga su observe to han biu ina to bakanda ai gi asoi ba putho han biu so that I can improve amuka na improve to kani satra na to kani nang observe to ni asoi ba point putho kani at the moment you have to give the feedbacks to the student simulation dadi aduna te ngasi nang tawre ko loire ha beduna te ba there should be a feedback session satra sina nang na tawri ba se first test ma chungre second sima chungre third sida nang khara lali nang na tawgadong do aduni hai ba se for every students you need to give the feedback yaudra di kan improvement lai ro as it is it will be just like the demonstration class one-to-one feedback ne ba matang sida darkar oi gadoi se adu feedback si people were kan amukka su hanna mana practice to rakan the never at the end you can evaluate then and still repetition is needed hanjan to bodi mathok tai skill like is not that in 1 hour class I will acquire all the skill it's not like that to acquire the skill you need repeated practice hai basim di soidra ba pham ne ba yan ta bire ko sigi step sing se follow to bi batare oja sing na the active and the collaborative pedagogy ambal sulairi active ohen ge satrasi ka khalaga adu ki matik involve to nab ne ba adom parikha inaba na te ko gi session se exam thani habagi natte ko adom na tawriba thabak to improve tawna bani ko aduna lecture method oitar su question answer session ji am appropriate oina sem tar ada yari gai topic si thugairaga satra da group discussion to halaga present to hantare adu satra na pagre ai di nuaire ai gi 1 hour class loire harga koi gi nursing gi oja satra na sai gi seminar da oja na tumina tara tholok padu yaro I have seen many seminars like that adu na tam you as a facilitator as a mentor as a teacher as an expert you have to give the comments you have to supplement the deficit points dang ne na padoi ni like di Wazani hen padoi ni satra tu taki. So that you have to be, you should be able to add additional points. You have to make correction of the say errors. That's all. Adu ki level to the prepare tau tu ni. Ako ki hana subjan ki ba fasiar ki anatomy ki ICM lo igre. Adu ICM given no tu na hanjan pusalaga fasiar kuting ki takan edu yaro em. Dakar lai tre adu practice tu tau doi disi gumba class dakar oide. Modification nam pubiro ko then atopa yamaru isi case based and the problem based learning si yamathok I will come in details then flip classroom ama haiba maga lady then gamification haiba msu lady gamification means topic si game on thoga hen ba khangan ba mani nursing the maru ina season riba gamification se mayam class ta quiz ta bibro akoi gi Indian Nursing Council ki syllabus study mode of teaching and the learning si quiz ina piba yam yaure quiz prepare ta bibro I quiz ki question sample में हमदे खोंगा चबता रहा को institution खुदिंग मक्ता की year wise quiz sample technique question में हम दो खोंगा चबता रहे institution में हमदे की अदु की quiz दो interchange तो उन्हें रखा implement तो भी रखना बाहन बैठी कितना वामी न तारे को अदुम खक्तंग दी को प्रश्न पीबीरो आता इसी जंगल लकीरो simple to complex ता लाग से अब को अदु quiz the complete तो है बा syllabus सरुक तो quiz question same भी होगा आंगांग दा हन तो topic पिथो पियु पहलाओ class ta wazana quiz wa interview that means game ole adai quiz ta kamai ta wi satra sina once one student can give the answer means she is very much motivated koi student oring agi per to suning jeng view wazana hang ba question da ina khumbang ba means I am very much motivated and confident my pride is increased my ego is boost that's all that means the student will try more and more attempts to answer the questions gamification ki kana rakatu si gamification ina nursing students hanahan baduna te haba yantai ko quiz ni maroi na khoina gamification da then team challenge timangwa same topic piba topic content kana ne henge kai se challenge to honba that means they will be very much motivated simple but very effective yanta bi ko to baya besa sumain to da then duna kai dorakani that will create a long term memory long term retention of the topic so idan laigani habane ke pung si case study si nong na haibe mathok ta de akoina case study hairaga patient case study oina ta khale patient ji case study ro ina akoina topic pithoga ihal lakpa du sanai aba case study tu ma ina ba hona ba da kedore the students learn many things khangda ba dina te ba to ba da bo akoina akoi faida haiba da di phajara ro let the students that means let the students do the case study at her level magi level da masana data we have the information to collect or subjective objective investigation report then the treatments then the student at her level have to find out the nursing diagnosis problems out of the problems the students will be able to prioritize chatra dito kro jabo prioritize so khang da yaurim ne ba yan tarba adu som da innovative technique da haira itno kai no students should be able to prioritize the problems kari na hana tawgada ge yanta biko example macha ma sidai da nei na ba yabani but it will take time adugi poto tawri ngai da matam logi time constraint is here adu magi level da tawbiro problem phajana puthok piu possible solution kari no ise waja mo ina khoin hana khang bata si topic si tawraga di topic tu da satra sina irakadoi ba case study si aina waja mo ina ai hana in depth knowledge am leiba mathok tai aduga ni gai tawrakadoi se deficit mayam se yanta bire ko adu repetition jam darkar oi amukhak tawrak paduna fulfill oi haiba leite aduna ni chhatra gi kaino da exam matam da mana pirak pa submit tawrak pa bukta oja sing sina as if jam expertise hoina red pen na tik tawra thara ga contents manung da lan baje I have many experience adu da irak pa pathophysiology se boy ma salang phakto ga you explain it haiba kan many students fail to explain that means they are just doing the copy paste that means we are not honest in the teaching and the learning process we are committing crimes against our nursing education. Amarom the crime makhalamane haining yab. Aina yare haidra sign to means you have to go through it. You have to correct it. Satram na iraiba pathophysiology mo explain to hai bada moi fellow ba means kaino madude soi piri bo janang su mun yeng de hai ba se tuna ta hai ba am tagi wana te koi hai sa this is the general problem khanamina se hai ba ni ko sigim ba si thok tana bo hona biu innovation nai bu hanai additional to da ano bai dia hapcha lalo ra effective hello lo ra ko yam high tech ai lai bang amdraga su kai te for each and every step we have to innovate it, we have to create new ideas to make effective. Oh sorry, dai zakra. Oh yeah, okay. Aduna case study sima kaido batai yam problem solving skills, critical thinking skill develop to hodo ini angang sida. Case study ma igraba topic ma ama means there will be lifelong retention. Nijang bagi sang case ma masak phajana khangi do ini. Adugi potune koina hoji focus tawar ka doise. Then case study of successful teaching practice. Akoina case study haraga we are thinking about only the patient's condition. Patient ki case study tu da khalle ba koina. Patient ki case study su oijasa no ba kaisu kai de ba. Oire ba poche problem face really problem face ta urisi kai no ise. It's not maybe only the patient condition or maybe on the structural setup. Suppose satra sini yam tawning e thabak se real magi priority ki matung ina nursing care si pinning wa kanda pochai dakar oi basi lairam dre adu su problem am ne ba on that also we can practice the case study adu da su to ba yai hai ba yan ta bi ko adu na solution offer to gada ba solution puthok ka dau de adong kok ta lai biro ja moina satra da problem puthon biro khana biro nang na hana khang do adu kanda satra kai to adugumba case me am do they will students will learn from you about the problem solving skills effectively silai gani simain to dana flip classroom hai basi maga yamaro ina to baya khoina traditional classroom da di khoina to risi class da sanga ani ano topic sai introduce tawrani note pirani class loire lesson gre lore but flip ta to ka doisi di kaino aina ngasi 1 hour da class to godok se group sida hana topic si pithokro lesson plan am pithokro na tragana source am pithokro du dei par oina Adanangi 1 hour sida kay dora discussion to biyo ba group discussion to hallo ba feedback lo biyo ba aduna takpadi kay no Bloomsky taxonomy of learning dunia ina pijari ba konse sidai sida koina ta hana dai tawram mi sidi oja sina loi tak thok pire yan dai ko adu homework pigre homework sina mayum da mathan pajare tawjare eba adu kanda yamaroi ba portion ne ba koina homework piri se maroi ba portion means homework sida angang sina tawra ka doi se class sida phangiba knowledge apply tawru doi ne ba ko adagi evaluate tawru doi ne ba isi khangabar khangdi brai se adu last ta create to means in the new scenario the learned retained knowledge should be that means applied aina khangi ba pot ba manaba situation ba da scenario ma da apply to bong amudoi ne wong ba isi adu ne ba classroom da taki ba pot ma to halaka doi ne asi traditional method ne hujiki flip ta di ka dore sai gi applying remembering understanding applying sin exam biri bra Sigit Bloom's taxonomy of learning ja si khang draga di innovation teaching so mu yaro isam jam na hujik ta bane ba mayam na tawri si khang mana te kharam na ta ba mi understanding level da haigalam ani understanding level haigalam ba si karmai ta understand ta ge question na set to ba ta khang dei adu matam laitre ko aduna huji understanding da gi di ka dore once you understand the topic that means you will be able to apply it nang apply to ngam kane ko apply to ngam ba hai ba sina understand to ra bane tawrabari phajana khanga ga natro apply tawru doisa aduda ahen ba learning process lai riba mind je da kaidawni you should be able to analyze masi takri ba topic me am je you should be able to analyze it for each topic you should be able to analyze it if you understand nang na khang dar boi di thugai re dana adundi which part I can apply it in my class si khang mangam ga dawne ba adugi pose satra da exercise tawna ba gi da makta hana class topic se pithok pigro
excuse me it's a warning bell 5 minutes more left
okay class pithok rani question answer session akoi kano da tawra ani sima tawbiro sina huji worldwide oina adum nursing education da cover tawre akoi ju tawbai there is no goods required what am the sang de ko the only thing is your innovative idea to the ni ko as a teacher flip classroom se sima tawbiro collaborative as approach chhatra punjalan view small group sim view exercise tawhan view present tawhan view interactive tawhan view samna this is the conclusion then blended classroom in the same classroom computer thambaya akoina computer lab in tongan thami adu classroom na tongan thami same class sida hojikti innovative class tadi ka doctor classroom should be flexible high aina sida kainu ta habidi any time the seat arrangement can be manipulated group manga pun ge haira manga ge salong semba tara pulan ge haira tara ge salong semba ya ba du flexible classroom o helu ka isu lai riba aduda computer facility su tham doiba topic ama pithoya group amna computer du da topic tu study tawringa da group amna somda kaido batara discussion to hon that means hectically engaging the students to learn sigumba class ka se flip class topic you please note down and you please read in your internet. Yeah, go ahead if you want to go through it. Maram di yam eba topic se aduna ni blended learning the classroom da so jana khara takpa ad masana su study tawba. That means effective learning hai bane ko. Sigi pot ma'am se koi mathau tai technology dai panjagre masa AI duni maruina LCD season ba khot price is very common. Ada hujiki blended se technology online plus real class ani sigi kana basi am lai khare. It fosters the teaching learning kaino se process atu ki mati foster ta wi retention ta halli hai hal le bangang se ji yaraga disi manage to biyo ba ko computer room do only computer gi MIS tak ne na thambadu na di kana royam please utilize it ko you please manage the time then IPE interprofessional education ni asai na haijabado suppose pharmacy group ama nursing group ama physiotherapy group ama medical group ama chatra se punna project am tawrakan do pihan ba mai part to actively involved to hon ba tabudabu khitang di difficult oigane university suppose Medicity da MBBS su hanga ba physiotherapy su hanga ba nursing su hanga ba then the lab su hanga ba do tar di sin bi ba ya ko mafam khudi makta di applicable oide ado masi applicability gi matung ina effectiveness te du ki mati oiba po ne aduna IPE sima kana ni nursing education da collaborative project mayam piri akhoi gi kaino da syllabus ta piba natra project mayam ta holi do ngang da collaborative natra madu chatra ama khakta gi nate ba the whole group will learn collaborative learning then flexibility gi matung ina khoi de elective module tambiri ba natra mayam elective modules kamai tambi ojana khallaga pibi bra chatra da khalan bra kitang di matam ji hen de yar otherwise effectiveness will be very less please ko aduga kamai to ge ba elective module do BSc chatra na khalan bra ojana khalla pibra that is the thing elective means flexibility do different chatra ge different learning style lai bodo adu da suit to bodo moi na khanjar action hai bane ba it's not that teachers will select the elective module and that sahi disi to ro hai do na te there should be autonomy from the side of the students. They have to select it themselves. Yan tabire ko, ako Indian nursing syllabus to, INCG syllabus to, innovative methods, oy apply to ram ni ko. Muna yang biyo ay nga si kitang highlight to jari ba sida. Then personalized learning de koy loin tawri ko. Personalized learning to bro mayam. Internet to topic khudi mo pa dabra ba. Sometimes internet quiz yaw da bra ba. Aina deficient oiba skill do na sana self learning to bra to da bra ba to we ba adu bune ba personalized learning hai adu da certificate pi group to thira lo online certificate phang ba do adu akoi gi purpose kana na ba chatra do su to holla lo re adu thabak yan da bi re ko sumai to dana these are other methods lo na ma oriented or ba method ha kini like brainstorming session to bro mayam class ta brainstorming session chumna to bra to da bro mayam sa we need much more workshops and webinars on these topics. See, 1 hour is not enough. See, these are all the teaching methodologies that you can apply. Creative teaching, then brainstorming, role-playing, story, boarding, concept mapping, decision tree, brain sketching, and the questioning activities. Whether you applied or not, see, this is not new to you. Yabire ko se hai puna maksine ba koina teaching innovative teaching strategies hai se kari topic ta kari method sijin naga dage ha du khangal ko AI du di nang ai gi khuta laite management gi khuta government gi khuta lai koi khuta laite aduna future da di definitely AI da tam bata virtual reality da tam ka doine ba last ko maram the patients are very much precious healthcare cost is very high Osabari me mission to ga sadra sang pangthin de thin ya ga traba suppose in case of the Medicity also bujia pet to hospital da patient is to din pai ge ya pote ba ko adu khang na khang jan adri ne ba yan da bi ko adu ita di ka do tai sadra di AI da tam hanta this is the need of the hour for the futures also and at present also it is needed yan tai ko because now every patient knows their right patient rights patient am na loi khange hujikti hujikti knowledge explosion gi era ne ba ai gi right kari lege se mi pung khuding makhange ba mi gi right to violate tawraga di definitely some consequences will come up aduna di akoi education section da su akoi hujiki maroina ai da tamak patar simulation da yan da bire ko aduna hujik innovation is essential ai si yabira ba I'll conclude my topic yabira dro hanagi lecture do dum tawgi dori bro maya sanga ga textbook hangdoga pabi bado ithanda ikai bam poglani you will feel yourself side as a teacher adu ang pokpiyo ba adu pok nana bini ko inang jari sia then again diverse process enhanced learning asi yani ngabra lecture khakpi ba motor quiz tawsan ba group learning tawsan ba case study tawhan ba simulation tawsan ba adu itarga di maduna kanai asi yabira bro tawradra tawroidro ang ta kuthangar piyo so ne apply tawada ba kai okay almost 100% teachers confidence laitana thangata ya dabai thangat pasu yauri that I cannot accept
खुद से स्वयं थांगत भी दिखाना दो मैं स्वयं थांगत दे स्वयं दम थांगला तो है
please be ready in your mind yeah the honesty is very much important from the side of the teachers also oja ajna khoina tatpat togi siam ya ba syllabus lo hen basidi is very easy syllabus angan na loibo oja lai kamai to agui wonder ai pura ngak pa syllabus is moi di principal na when thing na bira mani hai na syllabus ngat ne da loi salak pa I really wonder it adu gi pot se akoi khan ma thau tai ko then again commitment is lifelong learning noi hujik tam badar ka oibo oidra bro MSc oire waja oire professor oire na tam drasu yar bo that means you have to commit yourself for the lifelong learning still you need to learn haibane ba ko asima yabi bata ba again collaboration is key nathande is impossible to do alone collaboration is the key ni ko then call to action on thoa se ba hujik mayam angam ba ghara di apply to ba ho biro ba effectiveness am tang di ohen bio ba workshop se ko samai to dana duna adu madongi level da to biro class ti swai delo sanjarage ise magi kaino su makha ta ba supplement kaino su I invite our chairperson to comment on the topic.
ai rồi
Si video se te kapta se mana hiring ba
How probable? Okay. Completed. Well done. Any question?
any question from the
Ma'am,
group
Ma'am Chairperson, can we put up some questions to the speaker?
The speaker
Yeah.
already mentioned, she already explained all the topics she covered nicely, but accordingly, how to overcome all these things? From
No,
the management group, challenges.
in my case, I am speaking on behalf of the other audiences. I have joined very lately, but very interesting stage of the talk. And many people must be there who may like to put up some queries.
Yeah.
Let us entertain these four.
From the group, I want to ask the question from the let the question come from the group. That will be more effective.
Yeah.
That will be more. All our teachers.
thank you ma'am if you permitted me I have a question it's a very interesting thing if you don't mind might be some mistake from my side but as a layman I want to put one question it's a very important thing for me today is very lucky day for Raj Medicity Nursing Institute because we have a excellent resource person, namely Dr. Jamuna, Registrar, Manipur Nursing Council.
Thank you.
And the ma'am has delivered a wonderful topic. And the topic also very beautiful. To be a topic of this conference. Again, I repeat, topic is transforming nursing education through innovative teaching method.
Yes.
It's very wonderful one,
Yeah.
in my opinion. And I must say, I have learned a lot from this session.
Yes.
And once again, I thank Saat nuring itu speaker, kamera, microphone am piro. Microphone di mana munda le. Marak third person mu kena kentore. Say, I have learned a lot from this
Topic.
conference, and then I have to say something because I think training for trainers is very important.
Yes, that's very right. That's very right.
That's why we want to start this training for trainers. Is very important thing because Satra passed by every student or every faculty member. Makoina Satra bu pass to on by si Makoi hope, Makoi ambition oidun. But it's not easy thing. So how to pass their examination? This is very important thing. So Aduna Madam Sahib earlier, Ma'am already mentioned in his topic. Kamai to raga strategy takpi gedege, tambi gedege guys. Even Ma'am was mentioned about the AI.
AI is coming.
Yeah, AI is coming. That's why Raj Medicity already started AI class.
And moreover, this week is AI week. This 1 to 5 is AI.
Yeah,
AI
sure,
day.
sure, sure,
And
sure.
performing different centers also.
Sure, and ma'am, I giving my commitment for multidiscipline, like say laboratory technician,
Yes, yes.
then OT technician, radio technician, so multidiscipline.
Collaboration.
So
and all.
it's
Yes.
coming in future, and right now, this is the second year of our this nursing college. In future, we are planning for a complete, compact compound for all these things for the allied healthcare services. It should be coming within a short period. And once again, I thank you, Ma'am Jamuna. If you have any idea, please deliver some idea about the training for the trainers.
Actually, it is very much necessary, I know, but conducting trainings need budgets. That is the important thing. And moreover, Indian Nursing Council sometimes hardly they used to call resource person pool for training for simulations into the Indian Nursing Council. But so far the MNC is concerned, as because MNC does not have any fund from the government also, we are surviving with our, that means files and some little amounts for registration and all. MNC is running. That's why it is very difficult to allocate the budgets for training from the side of the MNC. Still, if as possible, previously what I have done is that I used to take the loans, that means the budgets from the ministry. And in the previous years, I have conducted many training programs that is for nurses mainly, not for the teachers. But sometimes I have prepared out of that 2-3 programs for the teachers about these teaching techniques, new curriculums, then the new topics, new that means portion of the syllabus and all. I'll try to highlight some of the important points, but I cannot cover all 100%. So this is my suggestion that all the institutions, from the institution sides, you can prepare, you can just put up some workshops like this in the real interactive sessions, not in the knowledge level, but into the skill level. The sessions should be skill sessions. Topics we have to study first. Then in the real scenario, we can study the different groups, they can study, they can find out their creative methods, they can present it so that we can learn from each other. It's not that I will be the expert. You are also expert in some of the fields. So we can exchange. So from the specific institutions, from the college levels, you please prepare those sessions and please put up to me. I will try my level best to help to conduct those trainings. Otherwise, from the MNC side, we have many works also for our own. That's why that will be difficult. Tawadabu adom putopira agading asi suras na sa principal laktana adagi si tausi haibado akoina adum tawnabu honajari si mga from my level best I will try to participate and to conduct the programs to help aduga sugamba initiative innovative oiba kaino mayam sidi mayam gi site gi darkar lei ai thada gi site gi lakpadi tang burden ji hele ai tar burden ji
Hello.
ado
Mayam tang ngam
loy binaba ai ama khaktang ga ai sidi not questions, but this is just comment.
suggestion and comments
Comments. Ai na lakpada Dr. Jamuna gisi flip learning have stage zu low yo lerame. Flip learning hariba doctor na kano suggest because is beautiful. Usually if before reaching the class student reach the contents of the dish, when teacher teach them, they will learn more.
Many.
And they can even argue to the teachers, when we read it is this, if teacher skip something, some student can point out that too. Aduga sigmathak sexta akhoi nursing institute and nursing tutor in thamiko.
Like sir.
What is the function of this tutor? I see question nahi sidi.
Yani there are specific job responsibilities for tutor aduna ne I want the direct I will khunjau hairibra
Nate ai na khalli bo khan se chumbra chumde du haibiro.
si baruina clinical da chhatra singsina clinical sida chatpada moi si clinical da chhatra singsi tambina bane ba maruina clinical teaching gi ne ba tutor se aduna moi si chhatra ga attend tor chatpatai chhatra siga loina na bedside ta changaga oja sina tutor sina patient gi right from the patient assessment moi takpira dauni ward management gi patient care gi then khoi gi nursing process step aina luxury scientific process ama nursing care gi hairiba khudingmak sigi skill se tutor sing sina khoi gi kaino dagi takpira kadam ne real patient scenario de adu taktringai mamang da moina amok along with the assistant professor and the associate professor and professor college dagi masagi demonstration class simulation class kai se adu da hana loina mak ngasi tawdori se ward sida patient ma thengna bada tawdoi se sini ko be se simulation class ta hana takpira aba real world scenario sida taseng ba sida changdring aida adu dagi di ward sida thajala kandana real patient sida moina guide tawraga satra sida takpi ga tawne
Okay.
assessment am se tawdoi ne
Tutorial class haiba akhoi gi medical college da
Lai.
medical students ta tongana lay. Tutorial class hi akhoi na long time back ai digna chahi yankhai sur mani aina medical kham tori adugi matam se tutorial class kamai toge bu one tutor there should be around 10 medical students adada physiology ki tutor anatomy ki tutor singchina kamai toge bu what was taught yesterday in the classes or mashi kano sing se chhatra sing si de discuss torga si kaino adugi do hayu and questioning si torga when the exam comes adugi de yaw ki ba kano sing do magi do ningjang ga it has become very easy for us to write it down aduna tutorial classes sujiki do not only practical theoretical real si masi darkar oye ne logje yai di sum kan tan du
adu yam chumba wani sa adu ki tutorial ista waja sina taw grise quiz gumba dagi group discussion gi model ne ba adu ki photo ji akoi syllabus ta Indian Nursing Council syllabus ta hairiba topic si quiz da cover taw hairiba topic sina ji tutorial hai da bugi wane ba sa adu da seasonary ba teaching methods to di som da period ba
mani
adu ki teaching method to chumna seasonary abagadi satra waja sarna haibiri si sarda total retention of memory male ho bagi ne ba adugi memory to methodology to na pi bane adu mak se akhoi sida class tu gi mameng di tutorial class ti haidre akhoi na somda moina Indian Nursing Council na pirak pada taw bada bu ha du the seasonary ba technique sing duina pirak pane ba akhoi adu mak se apply to ba ngam si sini daina akhoi oja sing da aina request of jari sina
thank you very much
thank you chama
Yani I moi the question no. Any question you ask you throw to your speaker. Any question please you are not clarified.
Rajen ga hangbada sangman grama
I kitang I gi side speaker gi di yaren khali you have to remember all the pyramid of learning do ningjango demonstration and nangi teaching is more effective ka habadu ningjango all the things he cover tawre ko noina question hangninga di hango but every teacher I am a teacher niko every teacher should be thorough about the syllabus the changes because innovative is new changes, new strategies, new policy do never. To back up all these things, what challenges you face, group laying da noi management team laying da noi difficulties level sing do to work out all those, to achieve all those things, kari difficulties lege do hayo roba. There is simulation lab hire only noi das da hojik training attend to is only few teachers khatani. How you will be able to practice all those things in your different colleges. Aina khalle noi se aya man college ni ko. Si tawi mayam si noi di college am dai ani ni dang tawre. But many of them are not getting all this training. We need training and training. How we training darkar hoeba. Whatever demonstration, whatever theory you are doing, you need to practice. Practice to have never. And the module and everything, the syllabus of semester system is changed now. How the teaching strategies are changed. Innovation the high grade ko hogje. I don't know how you will perform, how you will try to achieve all those things. After knowing from this class, you share some of your knowledges, the difficulties faced, or now no loin thorough where I do kitang no you share toro. No, don't sit keep quiet at the pangono. Don't sit keep quiet. Actively you involve. No taubra. The gaming system, the quiz, you are performing or not. Ako sometimes ako quiz session tawe haba ko. Quiz tawe ako students sa group da. Accordingly, hadi semester ki matungin anatomy ki hapsan gani, then ako problem thoi ba hapsan gani, then ako situation Manipur ki kaino tauriba, then days pangthok pa World Health Day, breastfeeding week palan, like na mayam siya hangba quiz tawgadam ne haba, so that moi learning hapang theory learning hapang tawbadi, they are feeling very bored and it's not effective as shown by the pyramid, by the path learning ki kaino dunu utkre ko. Aduna every teacher si yengba matamda they are only theory based tawre. Aina uba matamda theory based. Theory khatadi just like saigi do. Aduna noina matam jisang bana written demonstration to honbra satra da. Even though you are teaching, you are performing written demonstration or not. Why some of the teacher theory matamanda taga demonstration at the last? Why? It should be hand to hand chatkadam nehmi. Theory ngasi tagadi you have to try to demonstrate, and not only some portion nataba. Kuding magsatra kuding demonstrate to haba. Aduna demonstration award is there. Aduna syllabus yam munna focus on. Innovation is nothing. The learning process, the new learning process. Adu the AI hapsalak pani. O adagi waza ayam ba koi di khara han noi re. Noi computer based learning computer yam haiba tai ko. Adai computer dagi thiba computer thiba online webinar mayam pangtoga credit system is there. Mayam jay to innovate to noi motivate to na ba tawreng deba. Aduna noi motivate to ba haiba si loina na sa to su motivate to jebo ko. Aduna how to motivate haido. Adu si tawo matamda matam yam logger ron mo si 1 hour award dam pibani na I need to I should ngang gadi yam ngang ngi kwa. Si tawo matam sida ay na hainin ba siya. Sidai sida ay na khara point khara lokthok say financial limitations is there. Whenever INC MNC na inspection lakwa matamda all the articles si akoy loina leiba ngamdre haba. Natra ado anauba college lakwa sing sisu matamatang liway na asay fidelity simulation kaino sing do hapsan bio haba akoi jo ham number honne ado you have to explain to the management no the management sing asi yawi di na we like bi nen khali han ho sa ju leibani na equipment ano baju yam leiram ni na khali ado aina tawjari we egmis di mostly women gi na ayam ba woi ko adu gumba adu haibadi satra sing sina learning tawdraga di skill di suglai le roi skill laitaga di ngasai percentage do very low we ne ba success woi roi haba adu waza sing si ju demonstration yam tawbiu adu challenges leiba financial limitations ji khara amda paisa thadar puglai da leibe su lei adu akoi gi su akoi na convey to jeba akoi nursing educator amoina nursing practitioner amoina what are the things required in this semester si semester na kari darkar lai karamba semester na kari hapsan gani like if you are coming OBG then you have to buy simulation lab OBG gi leiba tai then pedialani aiju pedialani so I order some of the things pediagi I order to hai so that third fifth sem lakho matam da tawna na ba haidana sumai tawdana the specialized teacher please focus on your topic go through the syllabus very nicely ko adu tawrakanda matam gi tanbiro then lab phajana semgat piro practice to the standardized patient who can be the standardized patient you yourself can be standardized patient many queens can be then any lay person anyone but you have to explain all your procedure what you are going to do so that you can solve the problem ngasai case scenario pithoga to ba do sigi learning process ya loina practice tawdi ko aduga sida noi lai de college ma ani dani na tawdi mayam de kamai khangni learning cannot be stopped. Learning is a long time process. Haibaduni ko. If you stop learning at the age of 20 or 80, nang learning togre. Even though I am old, I am trying to learn. I am trying to read more and more. Even today's topic also I read and come, and many things are there. Aduni ko. Aduna ain haining is simulation lab. Jana sempiu insufficient training. Training di am togiu. These trainings are no in taris here. You go and read again. And what I can do in this. Everything is in the internet. Lo yauro an heba. Satra sing does na piba matamda mobile piu hai. Kana with the mobile season hanji aba matam piba matamda. So that they can take out some of the things. Tisarna to wadu the moon hapten by hedo. Hapten by heragadi they can argue. And argument dung assist hatrona in the haina tarogadi. I should confirm to kan. I should haina huna doing it. Go. Aduna innovation abzik I should not there. Hozika anova togle was a heroine and a satpaduni. Time the Aquin isam chana, Ariba Matam Togja, demonstration am tawi Aquizuko. Aduga, say tutor Habido. I joined as tutor in the school of nursing. Tutor in the joint obani. I theory tie class manunda, even bending, whatever procedure theory, Tavatunda. I went with the students and are they the demonstration of the Nakotana according to the situation. Adumai Togana Tobiro, Aduga. Akoi lack of technical knowledge wali singse akoi hena equip tawnaba well equip tawnaba akoi myam honarasi ado topic gi wena di noina sudum khangamani MSc da loin tamabani Bloom's taxonomy
nam jamuna de warum dong mal phamba
ya yare nangon question hangaroi ko
Okay, thank you very much.
please take your seat
Okay.
adu maina tawrasi ko aduna hai bang asai gi mayam du cover tawrasi aduga mayam punna nangi follower haigadra nangi senior haigadra tanaraga syllabus sindu punna go through tobiu hauji waza ayam basi syllabus khangde waza yon bai wanate ko syllabus khangde haugi mandatory module elective module kari tawada no khangde adu even sida wa yolambagi di wanate aina thengdaba experience ta mu also very different mu also very difficult they don't know what to be added in the magi marksida kari hapani kari hapoi habu moju khangde aduna aikoina matam leba khibita e akoi gi medical education gi kainom leibado aduda akoi nursing person wa hapiu haibune so that there should not be any mistake nahanu tawgi duni supplementary exam tawdabai khotabagi aduna si mayam ji sangi ko adu mayam si ano innovation ni ain haiji kaino mu pusalai ji kaino ya anova syllabus lakpasina maram oirakanda mu sisu thoro oidre because our representative is not there adu haibani ko adu si hairaga ai matam ji tension jarage kaino da time factor am leibani ngangning badi yam lei ai swai da stop tawjare thank you all
Thank you, our resource person, Dr. Aribam Jamuna Devi, for your enlightening and educative session. Once again, I thank you, madam. With the permission from the chairperson, I would like to honor and welcome our resource person who have come in between the sessions. So in order to honor our resource person, I request our respected Mrs. Chungkham Bidarani Devi, Vice Principal, Raj Medicity Nursing Institute, to come forward. So before presenting to our resource chairperson, I would like to request our respected Professor Okam Subadani Devi, Principal, Raj Medicity Nursing Institute, to kindly honor our patron, Dr. Ngarangbam Narendra Singh, Chief Medical Services, Raj Medicity Hospital, with the token of appreciation and memento.
Thank you.
Hello. Hello, 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 hello.
Thank you, sir. Thank you, ma'am.
Hello.
As a continuation to honor our resource person, I request our respected Mrs. Chungkham Bidani Devi, Vice Principal, Raj Medicity Nursing Institute, to come forward and present the token of appreciation to our resource person, Mrs. Namarapam Bindya Devi, Assistant Professor, College of Nursing, Medical Directorate, along with the memento.
Hello, hello. Hello, hello.
Thank you, ma'am. I now invite our respected Dr. Pukram Ravin Singh, Administrative Officer, Raj Medicity Nursing Institute, to felicitate our respected resource person, Mr. Laishram John Singh, Lecturer, College of Nursing, RIMS, with the token of appreciation and memento.
Hello, hello.
May nganda ba to?
Thank you, sir. After the completion of our first session, for the second session, our resource person, Mr. Laishram John Singh, I would like to briefly introduce about him. It is my distinct privilege to introduce our esteemed resource person, Mr. Laishram John Singh, Lecturer, College of Nursing, RIMS. Mr. Laishram John Singh holds a Master of Science in Psychiatric Nursing and an MBA in Human Resource Management and a postgraduate diploma in Disaster and Emergency Management. He is also a registered nurse and a registered midwife, reflecting his strong academic and professional credentials. Presently, he serves as a lecturer in psychiatric nursing at the College of Nursing, Regional Institute of Medical Sciences, RIMS, a position he has held since 2011. Earlier, he served as the principal of Premwati College of Nursing, Jabalpur, Madhya Pradesh, demonstrating his leadership in nursing education. Mr. Laishram John Singh has made significant contributions to professional nursing organizations. He is the State SNAI Advisor of the Trained Nurse Association of India, the coordinator for Manipur State of the Indian Society of Psychiatric Nurses, and an executive member of the Indian Psychiatric Society. He has also served as the General Secretary of the Society of Psychiatric Nurses, Manipur. He has actively participated as a resource person in numerous continuing nursing education programs, conferences, and seminars and workshops. He has presented scientific papers at both state and national conferences and has consistently worked towards the promotion of mental health. He has also played a key role in organizing conferences, seminars, continuing nursing educations, and workshops. In recognition of his dedication and excellence, he has received the Best Teacher Award at Zinsar, Jabalpur, and the Best Bedside Nurse Award at the Bharati Vidyapeeth College of Nursing, Pune. Ladies and gentlemen, let's give a round of applause for our resource person, Mr. Laishram John Singh. I would like to respectfully hand over to our conference chairperson, Professor N. Nalini Bala Devi, Principal, Acme College of Nursing, to take charge of the proceedings and conduct the second session. Thank you, ma'am. Thank you, sir.
No. Oh, hello. Good morning again, everyone. The second session is going to start, and the time allotted is 1
Hello.
hour.
Hello.
After the
Hello.
session,
Testing. Hello. Hello.
the participants, I welcome to throw some questions, your doubts and everything, so that you can learn more. I can say that. So we welcome the second speaker, Mr. Laishram John. Your time starts now. And before this, before finishing, before 5 minutes prior, I'll ring one bell. Thank you, sir.
Okay. Thank you, Chairperson, for this session. And it's my privilege to be here in this institute, and privilege to be here in front of all the high-profile personalities of this institute, respected Sir Rajend, the CMD of this organization, and all the other the professionals here in this room. And it's my privilege to be here once again, to be here in front of you all. And I would like to share some of my experiences in adapting the psychological adaptation and coping strategies. Aigi topic kasi, in fact, this is one of the most commonest thing that we are experiencing every day, the psychological adaptation, how we are going to adapt. Now, I try not to bring the bookish thing today. I try to, share my experience. I also ask some of my friends what are the daily, the psychological consequences, the challenges the nursing teachers are experiencing. And in fact, we have students also here. In fact, what are those challenges that needs adaptation and that needs to adopt some of the coping strategies, right? So the topic given to me is psychological adaptation and coping strategies in educational environment, strengthening teachers and students' well-being. Ay topic siyam sangi. Teachers we aure, students we aure. And in fact, the time given to me is 1 hour, but in fact, almost 45 minutes is gone. But somehow I'll try to discuss more of the adaptation, right? Now, to introduce this topic, teaching is incredible and it's rewarding, but it is also one of the most psychologically demanding profession. The previous speaker have mentioned most about the innovative technologies, all those innovative technologies that we have discussed, how to adapt with those technologies. Also, again, it's something that we are going to adopt. We need to adopt. We need to adapt. We'll explore the science of psychological adaptation and some actionable coping strategies to protect our peace of mind. Burnout, many times we experience burnout. You know, these topics that we are going to discuss, most of the things that we have learned, most of the things we are practicing, and in fact, we are forgetting also. It will be rather a reminder to every one of us today. So it will be, as I mentioned there, it will be a recharge. We have already charged, but we are recharging again to move forward. I was just thinking about the ideal educational environment. What should be the ideal educational environment? An ideal education environment blends physical comfort, emotional safety, and mutual respect to help both teachers and students thrive. strive towards the goal, towards the common goal. In fact, when we talk about the ideal educational environment in such situation, in fact, the management also takes a very important role, the organization. In fact, Madam have mentioned about the university. We had lots of issues with the university. In fact, they also takes a part, need to take a very important role. How the teachers, how the nursing institutes, how we need to adapt each other with the new syllabus that have come in. University also have tough time. University issue, anova syllabus lakpa, anova semester system lakpa adapt over that. They are taking time. So once one or two batches pass out, somehow they may try to adapt it, right? So an ideal educational institute environment needs teachers, students, well-being at the same time, support from the management, support from the council, support from the university, right? So student well-being also is also very critical, because those students who feel better, they will be able to learn better and they will be able to explore more in their life. Now, I just want to put up some nice quotes of the teachers, now nursing teachers especially. Behind every successful nurse is a mentor who believed, guided, and inspired. Nice word. Now, this is, sorry. I like to highlight the second one. When you teach a nurse, you do not just impact one student. You touch every future patient that student will ever hold, comfort and healed. Your lessons survive in every life they save. So teachers matters. How you teach, the values, the empathy that you need to show that we want students to show to the patient, everything, right? Teaching again is not always easy, but it is always worth it. When we see the impact we have on our students' lives, we witness their growth, development. We know that we are doing something meaningful and important. The last one, teaching, the best thing about teaching is that it matters, and it matters every day. It matters every day. So that means we need to have adaptation every day in our life. We need to change our style of teaching, style of approach. Now this should go every day. I will not repeat this. The job responsibilities of the teaching of the nursing teachers, we all know very well. We have classroom, we have clinicals, we have student-related assignments, we have administrative-related assignments. Teachers are human first. Teachers are human first. They carry the burden of the class there. So mental first aid for the teachers is very important. Now the mental health and well-being of teachers is required to protect the student learning outcomes, prevent educators burnout, and maintain supportive class environment, the ideal environment that we have mentioned. Now, stresses among the nursing teachers, there are lots of stress among the teachers. If you find there are lots of researches done, so I will not go with this slide. Now, these are some of the common mental health challenges where nursing teachers need adaptation. High work and administrative tasks. This is one. Relationship with authorities and colleagues. Classroom management stress. Clinical supervision. Lack of experience. I have mentioned here specifically lack of experiences. Now, many of the nursing teachers lack clinical experiences. Now, that's one issue. Compassion fatigue towards students. They have been doing it, the routine things, so they lack that compassion, and they said, leave it. Then underpaid. This is one major issue happening around here in Manipur, and in fact most of the parts in Northeast. So underpaid. Modern trends in teaching learning. We have seen in the previous session the newer trends in learning, teaching learning methods. So we need to adapt. So that is again an issue. Emotional exhaustion, burnout from student concerns, then limited mental health support. These are some of the areas that we need adaptation.
Excuse me, sir. Sir, I would like to take a moment as our resource person, Dr. Aribam Jamuna Devi, had some situation to leave this conference a bit earlier. So, sir, with your permission and with the permission from our conference chairperson, I would like to honor and facilitate our resource person, Dr. Aribam Jamuna Devi.
Please, please, please. Yeah.
Okay, continue.
I now invite our respected Dr. Vijayaraj Haubizam, Executive Director, Raj Medicity Hospital, to kindly felicitate our resource person, Dr. Aribam Jamuna Devi, Registrar, Manipur Nursing Council. Thank you, sir. Thank you, ma'am. Thank you, sir. Sir, you may continue.
You can
please.
continue.
Thank you, madam. Yeah. So, there are only 2 times I feel stressed. Students are saying this, we are saying this. There are only 2 times that we feel stressed. One at night, one at day. That means we are at stress every time. We need adaptation, we need coping strategies to adapt to that situation. Yeah, so let me just go fast. We'll discuss more on the adaptation. Academic stress among the students, difficulty adjusting teaching methods, academic self-efficacy, heavy workload, exams and grades, time limits, homesickness, clinical stressors. Now, especially students going to the clinical areas, the fear of mistakes, whether they will commit a mistake because we are handling humans. Now, so this is again one issue again. Lack of readiness, feeling acute or lacking the practical skills. Now, Indian Nursing Council try to develop, many teaching strategies. They need to, we need to groom students in the classroom. We need to groom students in the clinical, lab, clinical skill lab. Then we need to again bring the students to the hospital setup, the tutors, who are with the students. They try to, make the students adapt with the situation. Right, so they lack readiness, then relation issues, relation with the hospital staff, relation with the teachers, relation among themselves, right? Then personal and social stresses, relationship with peer and teachers, family background, cultural adjustment, food habits. Many times since we are from RIMS, students from different states, they have problem adjusting with the foods, they have problem adjusting with the environment here. Right, so life balance, trying to make time, family, students, they want to be with their friends somehow, but assignments, they have to do, cover up many assignments, so somehow they are not able to mix up. Emotional toll, then pressure from the parents. Many times we experience this, students, the parents, they force them to enter in nursing, so somehow they don't want to be in nursing, somehow they were forced in nursing, and somehow they are not able to adapt. Now we have students who have lots of problem in the first year adjusting with the subjects, adjusting with the profession as such. So mental issues. So we do have counseling cells where we do counsel, where we send students to the psychiatric wards, and there are students who are undertaking psychiatric treatment. So these are such issues we have. Promoting mental well-being, why mental health matters, right? So we need to be aware of our mental well-being. Mental well-being is more than the absence of mental illness. More than absence of mental illness, it is more than feeling happy. It is the ability to cope with the day-to-day stresses. Day-to-day stresses that we experience, work productivity, interact positively with others, and realize our potential. On one level, mental wellness is about prevention, coping with life's adversity, and being resilient. Nowadays, we use the word resilient. We will be definitely facing these issues. We will be definitely facing the psychological burden that we are having, but how to come out, how to face those situations and adapt with the situation. This is what we call it resilient. Now, psychological adaptation. Now, we come to our topic, the psychological adaptation. Psychological adaptation is how we mentally adjust these heavy demands, right? So it's just an example I've given there. When we try to live something, we try to adjust ourselves. Now we are going to face life, we are going to face these students, we are going to face exams, we are going to face classrooms, we are going to face clinical areas, but how to adjust ourselves psychologically and how to make ourselves ease with those situations. Yes, psychological adaptations and coping strategies for teachers focus on managing high workloads, emotional exhaustion, and classroom stress through problem focus, emotional focus, and appraisal focus techniques, stress identification, cognitive restructuring, and boundary setting. So these are some areas that we are going to discuss. Now, psychological adaptation and coping strategies, there are certain modalities that we need to follow, make self-care a priority. We lack this. Now, self-care. No, we lack self-care. We don't love ourselves. In my first, in this particular slide, make self-care a priority. We as the teachers, as the student, as an individual, we are not able to give time, people, we are not able to give time for ourselves, right? So make self-care a priority, then self-introspection, we are going to introspect ourselves. Where is the area that we are having stresses? How we can adapt to those situations. Then accordingly analyze the stress, design stress management strategies, and implement those stress. Now, self-care as part of psychological adaptation, this is consciously placing mental and emotional well-being at forefront of our life. Now, I have used some captions here. Self-care is not selfish. Self-care is not selfish. We need to think for ourselves first. Self-care is self-healing. Self-care is self-compassion. Self-care is self-love. Self-care is essential. Right? So, unless we are full, we cannot, share to others. Right? So, how we are going to deal with students' problem unless we take care of ourselves, unless we learn how to adapt ourselves and use certain strategies to cope those situations, right? So, now the first thing that we can think about, self-care, a priority. We have lots of, senior personalities here in front. Madam is there. So how we try to cope up with those adversities in our life. Now, I just try to mention some of them here. Prioritizing personal hobbies and interests. We need to continue follow with all the kind of workload that we are experiencing. Try, learn, follow certain routines, regular hobbies, rest, exercise, going out with your family. Such things we need to continue. Set boundaries between work and home. Now, many times this happens with our teachers. They try to take back home. Many times we do have discussion with the clinical staff in the hospitals, clinical sites, and those in teachings. Clinical, those who are in hospital, they said, hospital ki duty pung 7 to 2 everything is there. But sometimes for the teachers, we sometimes take, because we need to assess the students, we need to evaluate the students' paper. Sometimes we need to prepare questions. Now, all those things we sometimes do tend to take some of the things back home. So that is again one problem. Now, I have read one nice caption in somewhere in the WhatsApp. It says, go back home early. Go back home early because the office work there will not save you when you are in ICU. The family members who are at home will take care of you in the ICU. Now, this is the nice word that I got from a nice caption. So we need not to take our home back home. So that's again one thing. Use time wisely. Time blocking, effective scheduling. Now, we need to block our time. Our time period, what time we have from 9, in RIMS we have our time from 9 to 4:30. So in that time period, you need to block the time for your teaching, you need to block your time for meeting the students, you need to block your time for planning your lesson, you need to block your time for, we have association related work, we have work related to many other things in college, right? So we need to block such time, and effective scheduling is very important. Learning to say no, set our boundaries. Sometimes overcommitment is also not good. Sometimes, I don't know, I can find many of the male faculties here in this room. So many times this happens to me. Sarjon di dum theng na tang lai ya bani na sarjon dum tang theng lan biro. Kai gi tabak lo shang ga to se nupa wi bising se yam we do experience these things, right? So our commitment with many of our works, our commitment with many of our associations or many other things that we are associated with, that's also again can be a burden. So it will be difficult for us to adapt with that thing, right? So we need to check those things. Maintaining emotions. Now this is very important. How to control, how to take care, how to maintain our emotions. Emotions are reactions that human beings experience in response to events or situation. Now there is a situation here, you can just share your observation. So we don't have time for interaction, so I'll just go in fast, right? So if you can just share your observation, here are two persons there. How a small puppy is there, so the two persons have different reactions. Now this is how we do react at times with the students. This is sometimes we do react with the kind of situation that we do face, right? So emotional awareness is very important, and how to manage our emotions and balance a way that we are able to cope such challenges. Avoid self-criticality. Now this also happens many times with, we do try to critically analyze ourselves, and we are not bad. We think negative words of ourselves. Okay, we take, negative self-talk. Sometimes it's called as negative self-talk. So we, instead of having a negative self-talk, we need to have a positive mindset. Setting strict work hours at home. Now sometimes, as we have mentioned in the previous slide, we do take work at home. Even phone calls, sometimes for the students. I am in charge with the first years, and I'm in charge with counseling cell for our college. So sometimes I cannot switch off my phone, because anything students have a problem, they used to call me. So again, this creates a problem with my family life at home. So I have learned, how to adapt with it. So I give a window period. That's how we intend to do. I give a window period. If you want to call, you call in this window period. Yes, but yes, sometimes circumstances may not allow, but this is somehow, from the management side also, sometimes they will call, and if you switch off again, that will be a problem. So a window period and, hours for my family, hours for the college, this we need to set up, right? Socialization, spending quality time with family, taking help from family members for house chores. Now, many of our teachers, female teachers especially, they have, they have to manage their family. They have to pack lunch for their kids, for their husband, for themselves, and somehow they have to run for the office, right? So this, then, nowadays, in fact, males, males, we also help a lot. Yeah, I don't know about your own spouses, but we need to help each other. We need to take help. When we take care of self, this is also again very important. We need to ask politely. We need to help each other. We need to cooperate each other. We need to, again, try to, such adjustment in the families will definitely help us in taking care of our mental health. Now, listening to music, singing, these are some of the things. Now, thinking about financial self-care. Now, we need to be, again, financially sound. This is also, again, one issue that we are experiencing at present, right? So, how to have a, the other term is side income. We normally say side incomes, right? So, this is also one thing that we need finances in all the areas that we are experiencing now. So, how to manage our financial states. So, this, again, this is also one thing that we need to think about. Social self-care measures. Regularly scheduling get-togethers, get-togethers with the friends, get-togethers with our loved ones, get-together with our families. Now, one thing I experienced in one of the department here in RIMS, microbiology, I still remember Sir Dr. Braja Chan. He was the coordinator for nursing program for a long time. So, they used to have lunchtime. All the the faculties, they will get together in one room. They will have lunch together, and they will share their happiness, sadness. So that's one good thing. Now, for the colleges, in order to have a cordial environment, now this is also again one very important aspect that we can think about, right? So, and then connecting with community and faith-based groups. Now, spiritual related, then the connection with some other organizations in order to, be out of our syllabus that we are discussing. My wife used to go for this Maira Paibi. I don't know how many of you are with Maira Paibis and their organization. It's a good thing again. My wife used to go every Sunday night. She said, I need to listen wakan pothaba salini hai ko mai Maira Paibi salaga ko. Chalaga wari utai sana raga nuai raga moigi maruk kasi am tawi ko maruk macam. So they enjoy there. Now this is also important because going out, then having, validating ourselves. Now, I have seen many of our nurses being part of Lion Club, then the other organizations, right? So, joining a local group, then seeking support from colleagues, friends, family members. So, these are some of the things that we can think about. Spiritual self-care measures. We are all spiritual. We all are spiritual when we are worried, when we have problems, we do pray. So the praying, meditation, listening to parvachans, spiritual gurus, these are all important things that we need to adapt. Now there are certain things, practice mindfulness, this I will not go because these are some practical aspects, meditation, self-hypnotism, guided imaginary. I'll just share something about self-hypnotism. Now I used to teach this to my students, and whenever I take stress management classes, I do mention this. Once when we have 9 to 4:30, as I told in my office there. So once I go back home, we can do this at home. Just relax, in the supine position. Now when we are in office also, we can sit and do deep breathing exercises. We need to learn deep breathing exercises. Since we know our all anatomical parts, we have our brain here. We are giving instruction to our brain. I want my brain to take rest. I want my eyes to take rest. Now, this is an instruction. Now, the funda here is, you are trying to concentrate on those organs and try to forget about the other things. And you get relaxed. Right, so this is one thing that we can practice. Right, so prioritizing daily tasks, like for some of the things, some of the practical thing I think about, I try to bring some of the practical things. Mental preparedness for your job responsibilities. Now, when we learn human resources, the management, when they appoint someone, they are supposed to give the job responsibilities. Now, many times we don't do this here in Manipur, I find it. The job responsibilities need to be given, and what you are as a tutor, what you're expected to do. Now, many times I find many of the tutors, hesitate to go to the clinicals. Sometimes they go just to take the attendance. What they are supposed to do, all those clinical, presentation, demonstrations. So they lack those things, maybe because of their lack of experiences. Now, I mentioned specifically the preparedness of job responsibilities. I remember one of my friends, she was appointed as nursing officer in AIMS. Then she was a MSc qualified nurse. She was appointed as staff nurse in the AIMS, and she was asked, you are an MSc nurse, you are expected to teach the students, then how you are here in this college, and you will be able to perform your duties. Now this is the question. I do have one friend here in RIMS. He tried for UPSC and all those things, and somehow he landed as a clerk. So with that qualification, how you're going to maintain, how you're going to manage the work. Now this is one issue, right? So priorities, tasks, ABCD, I mentioned there, must do today. What are the things that you are supposed to do? Prioritize yourself, should do today, nice to do. There are certain things that we can delegate, and there are certain things that we can eliminate that, right? So best thing is, I find some of my friends also doing the same thing. I practice Christianity, so I have my Bible in my room. When I go the first thing that I do is I just read a passage, I pray and start my day. I've seen some of my friends doing pujas and all those things like so this is the nice thing that we can start a day. Make a list of morning, separating urgent deadlines from your flexible tasks. So organizing yourself, batch your duties to give full attention. Now we cannot give full attention when we have this work, this work, this work, this work. As I told you, a window period for students to come and meet me, to talk, to discuss, to have some counseling sessions, then a lesson plan for myself, then for going to for a library, for going out. I normally, when I schedule my time, in a week, I keep, 1 day free. So instead of taking that particular day, instead of taking that particular class, I will take in another day. So somehow I try to adjust, because one day I keep myself free for myself. This is how we can adjust. Sometimes I had experienced the principal who says you cannot take the leave when you are having class. Now, nungtigi class I have class every day. How I cannot take leave then. So now management or the administration also plays an important role here, right? So plan your lesson in advance, plan your clinical supervision, plan days for your preparation. I'm going a little fast. Take short, regular break, model idle behavior with students and colleagues. Now this is important. Now how I want my students to be. So you can be a role model for them. How I react, my temper, my emotions, how I take care of that particular situation, how I deal with that particular situation. We need to show that the students, with my colleagues, as a role model. Respect is earned, it cannot be through threatening. Now this is also one thing that I experience many times among the teachers. Now scolding the students, then in front of the patients, again, this is one issue. I had this experience in my student life. So my tutor was scolding me in front of the student. That somehow my patient, they're not cooperating at me the next moment. So I politely, call off went to the tutor and discuss with this, right? This is also one issue when so we need to think about from student point of view also, right? So respect, sometimes, we think that we scold the students, we give punishments, and accordingly student will respect. No, this is something that we need to earn by being a role model. I've mentioned there, then encourage initiative and offer praise. This is, whatever initiative that we do, whatever initiative the students do, we need to praise them. Make a list of job responsibilities that we are going to perform. Optimize your table, cupboard, file. Now this is also one thing that I practice, organizing my files, organizing my cupboards. The files I keep, the immediate thing that I'm supposed to do, right? Then I organize my file accordingly, the students' assignments, right? So my cupboard, when you open my cupboard, I'll keep everything level, okay? Class coordinators, then class notes, lesson plans. Now this is what I do. Now I practice this at home also. Now in my kitchen, in my cupboard, I used to level the Corfu, then whatever Safu, and one of my friend told me, itawgi leveling shidi huran machine yam nungair ni ay man hayo to ko. Corfu huraning with the Corfu pura sakre ni hai ko. Bartin huraning Bartin pura sakre ni hai. But I find it very convenient for me. I even organize it in my children's cupboard. My wife is also a psychiatric nurse. So she told me, henman gare henang de wakan sukan khaning the wani hai ko. Dementia nani mo hai ko. So sometimes we teach the students, my kids, to organize themselves, right? So these are some of the things that I normally practice. Organizing our files, organizing our table, so that when we try to find an assignment, students' assignment, so it will be easy for us to just pick up and give it to them or discuss with the students, right? Personal relationship at workplace, then set clear communication window, as I've mentioned. Then we need to keep some miscellaneous time for ourselves, for some other activities that we miss out. Administrative strategies, we need supportive leaders, we need proper office filings. Office filings, again, for the nurses, nursing teachers, they also have some administrative responsibilities. Now again, this is a long, in fact, discussion is again, if you see point by point, it will be too long. Proper filing I can experience, I share this in how we are going to organize files in our offices. I had experience work with one director from DRDO, who was my managing director during my tenure as a principal in one of the college. So he taught me many of the things, how you're going to pile up your files, how you're going to manage your files. Yesterday itself, we had this one meeting there in our REAMS where how you're going to manage the files. Right, so this is again one thing, skillful job delegation as an administrator, as a head of the institute, or as a departmental head, how you're going to skillfully delegate jobs. Technologies, right? So Madam mentioned about technologies, how we're going to manage our technologies, how we're going to adapt with those technologies. Regular staff meetings, then clear communication, setting up of student counseling cells. Now this is important. We have a dedicated number in REAMS. Now Telemanas also have that number nowadays. You need to have a dedicated number for the students we can have, so that whenever students have problem, right? So students' mental health, teachers' mental health plays an important role here, right? So setting up of student counseling cell, a convenient office hour for the staff. Now this is one thing that I want to share, confident, office hours. I had a friend who is a principal in one institute. He said, my duty hour is from 8 to 2. Then how are you going to finish? So this is depending upon, now researchers also have said in the HR, this one I have seen that the productivity depends upon how the staff, how they manage their time. If we can have a convenient time, I don't know about how the management think about this, but if we can have a convenient time. Now, when I was the principal, my college hours is from 9 to 5, and I make the Saturday holiday for everyone, because we can have Saturday and Sunday holiday together. So 9 to 5, in that 1 extra hour, I used to get 1 extra hour. So this is how I manage. But how we can manage it, it depends upon the discussion with the management, right? So preparing of the calendar of events for our college, accordingly we can work out. Organization, also plays a very important, as I told, the mental health training and education for the staffs, and counseling and psychological services, creating supportive, flexible hours, as I've mentioned, then workload management, adequate staffs. Now there is the management tend to take less of the staff, but we need to take as per the Indian Nursing Council norms. This is one issue again. Providing adequate compensation and benefits. The leave as prescribed, as per the norms. Maternity leave as per the maternity norms. Yesterday, we had been to Sija, and Sir was also there. So Sir Palin was sharing, he was not knowing that the maternity leave for their staff was little lesser than it should to be. But somehow, they're supposed to give the adequate number of maternity leave. So these are there. So management also plays a very important in order to have a cordial environment, teaching environment. Promotion of physical and mental health for all the staff, access to mental health resources, then stress reducing activities in the organization. Now I have read one study in the Japanese, the form of this, how they have in their office, the terrace in the office, they have a garden, they have a vegetable garden they used to provide food, for the staff from that particular garden itself, and it's a beautiful garden where during the lunchtime, all the staff enjoys the place there. Now this is one thing that the management can work out. Now this is also a part of adaptation. Now I've mentioned here recognizing and appreciation of the staff. Now if you see the corporate sectors, they have best staff of the month, best staff of the week, like that. So these are some appreciation, positive reinforcement that we can think about. An eye on the students. Now I'll, as I told you, the students part, I'll just go it fast. Encourage students to keep up, but not to push them. Watch and listen, be alert. We have one student committed suicide last year. So, it's very important for us to assess the students' behavior. Are the students withdrawing from friends? Create opportunities for the students to talk, to share, to have a room for communication, help students to deal with the stress. Then, as I mentioned about the counseling cells, give enough room for the co-curricular activities, student grievance cell, keep class sizes manageable, and involving parents whenever necessary, role modeling the teachers, motivate instead of pressuring. So these are some of the things at back, at the students at back. Time management. Time management is important. Even for socialization also, going out, moving out, meeting people, meeting friends, right? For that also you need to schedule your time. I used to teach every year in the first year students how to schedule their time, the study time, how to schedule their time for outing, how to schedule their time for socialization, right? Creating strict study schedules, social support, then mindfulness, we have mentioned in the previous slides, practice self-care and self-wellness, maintain cordial relationship with all, then build emotional resilience. Emotional resilience is nothing but whenever there is something in your mind, you try to share it out. You try to share it out to someone very close to you. It can be your roommate, it can be your class teacher, it can be your someone at home, right? So emotional resilience, develop a study habits, maintain a positive mindset. Positive mindset is choosing solution over the worries. Then create a supportive environment, limit digital distractions. Again, this is one issue, not only to the students, with the teachers and everyone. Now, digital distraction is there, right? So, before sleeping, 1 hour before sleeping, right? Then, so these are again issues which is coming up with mobile addictions and all those things, right? So, remember, digital balance is key to mental balance. The core pillars, whatever I'm about to finish, I have 2 more slides. Empathy and validation among the teachers, among the students, and the management as a whole. We need to think about empathy. Teachers should actively listen and validate students' feelings. Autonomy to the students and supporting them. Clear boundaries, predictable safety, that is create a low conflict, reliable atmosphere, the choral environment. Now this is one thing, a very interesting thing. I just clicked from my cupboard and I just brought it. I find it from our Dr. Lenin, Sir Lenin's office. So he was putting up this particular thing. I just said, sir, I want this also. I just, so in order to have a peaceful mind, thought for a peaceful living. Today, I will include God in my inner conversation. I've mentioned this, to beginning the day with a prayer. Get up early and watch the sunrise. Balance time for others and for myself. Smile and acknowledge the people. Lend a hand to help someone. Speak only well of others. Learn to only listen. Now the second part, Nukshi nangangu, tap nangangu, kitang ngangu, fataba yenganu, fataba taganu, fataba nganganu, fataba khanganu. Now this is one very interesting thing I put up and I find it very helpful. To conclude, let me say adaptation is a continuous daily practice. There is no fixed rule. There is no fixing. We need to develop ourselves, how we are going to adapt. Empathy and understanding for each other. Then for optimal psychological adaptation, student, teachers, and the authorities' relationship should be supportive, balanced, and communicative. Choose your coping strategies for an ideal educational environment. So this is the message that I want to give. And finally, thanks for patient listening. Sorry, I go a little fast, so I don't know how much the audience have grasped. But I go a little fast, and somehow if there is anything that we can discuss or anything that we can add, please.
It's not fast. Thank you, sir, for completing this. And your time management is very nice. Before the time, his topic is covered well. And I just want to throw the question from the group only, not from my side. Group na kari-kari, how can you make adaptation of your students and yourself? Nang nasa adapt tong na ba? Amasung sa tragi adaptation tong na ba? What you can do as a teacher? Self and your student. Share some topic, some points. Share some points. Your adaptation first of all. What is well-being? Well-being phaba mayam darkar lay. So let us know what is well-being. Well-being is kayo ba? Ako'y well-being patragadi, we cannot adapt anything. Nangna phajana adapt tawdragadi, you have to throw your anger, your emotion, mayam say you have to throw to your students while dealing with mayamam tawduineva. Aduna nangi well-being, physically, mentally, socially, nang adapt over your well-being. Not only your mental, your health also very good. Pabatai, you have to prioritize. Nangi thabak prioritize pabatai. Hepazar una tawi dabani. Time management is very important. Ako ina satra da su nursing care plan sim matam da prioritization na nam he tawise. They have made 4, 5, 6 nursing diagnoses. Accordingly, they are doing kari tawi moi care se prioritize tawi haba. Ado ay na haining mabudi am lay ko prioritize tawi se satra jinjisu. Fazana amta tawdreba ngasai was Zamuna na Madam Zamuna na hybrid. Prioritization is not done properly. The same thing writing style they have wrote. In nursing care plan, whatever case study, case presentation, they are writing the same thing. They are just copying. Adu correct tabiyo habo ko. Adu so dum darkar hoy. Adu so matang kita dum panjaningi. Ano adaptation taw na bagi damakta sar na budi pankre. Prioritize taw hai hai. Adagi time management is very important. Your well-being phaba darkar ramlay. Yumda matam sana aigi magi thabak khandokpa matam sana thamba aina hayeng sagadabinga si satkadabanina you may be planning a bit early natra sumain tawduna khoi planning si yam maru oyaba aduna akhoi kaino sinda thabak tawbhamda aikoi gi adaptation nungai taba haibase yumdagi nungai ratraga su adapt tawdaba yaiba anu yumda su akhoi phajana manage tawgadabani akhoi maitai nupi sindi ayambana akhoi household chore yami we have practice of math thambagi system je kaya laite adu haupudi khara lagnare ko adu natabida even myself also doing the household chores myself only I loin tawri bani ko ada nang nanem na kulega de adu gi seba su sangi adu na di thabak tawbhamda nang hatwa tu tarodi there will be mistake chhatra su sapmanai even akhoi gi students sing si ju class ma panda lei harga mapan makha bo hip yawrim ni ne I go through the Magi Muigi hostel do salimni. They are just lying down. Wai hippaga lairami kaidore isangam di habisu yawi. Karamana matam nahan magsu parikha mapan makhai dara hauni harga thoglaktrabani ne. Parikha sibu moi bidre haba. Then aduidi as a teacher I am sawam darkar laire ko. Sawbaji uttre haba. Nang kari problem lege. That means problem solving is very important. You have to solve the problem. There are steps of problem solving. You must be knowing all those things. Akoi curriculum the loin yaur bani ko aduna hogiti wazasing sisu adaptation is very important new changes new curriculum are coming up si curriculum si amna no change or bani ko within the 6 months sida we have to finish many things and accordingly nangi time theory time practical time ngasai practical focus taw habado adu yam in view theory time practical time yam phajana focus to yam phajana calculate to so that at the end angang the burden to gumsi angang the matam sana parikha lausi khoi su waza mo ina leiragadi adugumba adubu factor khara sida ngasai victimization of teacher gan khara ju leiri ko victimization of teacher sisu akoi yengadabani akoi psychiatry tamamni akoi di khara hairabane but hairaga su akoi na thabak oina tawbadi loina watle haba waza kharana satra sida yam chaiba ju lei Mogi mistake ti ang dana satra pungchai seiba. Ado ai di satra seiba se ai in understand taw no ba mawong da ngang ba maram satra jingjina ingon te approachable yang moi haba. Ai na sometimes khale moi na ingon te approach taw je ai usitra bar ju khale ga ne ko. Ai ba di moi ji anything taw na ingon te hekta lak ne approach taw je. Principal ama oina oibagi su nataba. Hai ba khara ingani na ado ai maram sana ai explain taw kanda what can be done and what not to be done. Hai ba se ai explain taw ga adu maina tawi ko aduna wazasing si problem leitana ba anoba changes siga tawdana ba stress tawdana ba nangi well-being phanana ba matam sana tumba priorly nangi plan tawba si loina sangi nangi syllabus thoro oina ba tak tengda phajana khangdokpa mayam si loina sangi nayungi household management sangi ko adagi nangi namana ba group ki societal setting gi natra then you are going to deal with community people to the clinical field nangna nungai tana la agadi patient ju yai doine ba because you are going to deal with the patient along with your students natra ne suma mayam se adum thoi bani ko wazawi na noina khangda ba wani clinical da tawri sing se patient da lana toksan ju yam yauri bani haba mayum dagi saula ga time management leitraga ngasegi kaino ba yam to throw to bu yauri ne ba aduna ai koina adaptation ji togi haraga di ai koi subject si mastery oisi environment se akoi khangji ko ai ki pungji na sida howi sida loi ha ge time matam chana lakpa sometimes mistakes su lei ade sometimes akoi gi private sector da to was this not same like as government sector matam yam na fix tawi ko matam yam fix tawi adagi loss of pain he tawi pi ba to lo khara du da he kakthat pi ba ju tawi ko sometimes mi oisi kaino lei tab su leite adu khudong ja ba su yam pi ri bani aduna ain haining badi hauji world breastfeeding week su tawbanina macha chen bi mayam ni noi waza mayam ji ano bang hakane khoi ari ba oire ko waza ano ba chen ba sing ji mayungi adjustment yam changam gani satra gi ju yeng da ya ponte lairik su pa da ya ponte hauite ano la innovation lai hai duni natra aduna di kai do ba tai haba matam da ngasai sar na haiba du maina ai na si matam na si tawba satra kana sida loina ba satri problem jo ai coordinator oidi solve tawde ya de clinical chalaga di ai indaba ya de mayamam lai ri na ko aduna si mayam ji phajana tawbi well aina adapt toragadi organization se chawkhatoi satra phadoi satra pharagadi organization harau doin natra mayam je changeba aduga nangi organization site tagi su if you need any demand nangi demand changba sing do talu matam chana maram chana hayu moi pijagani akoi na puthoktragadi moina akoi gi subject sida mastery nate heba ko sumain tawdana and in another side ta aina mu haijaning basi satra gi waina di conducive environment haido conducive environment which is angang do nungai ga da environment simbiyo ba satra lauri niga hana amada langjallaga ita pulau daga loksan ba ko ekta congested oina thambi ba privacy he leita ba adai yam leidi na mawung yam se aduna the environment akoi gi syllabus aju extracurricular activities are there only not only focus on the nangi curriculum do the yauri bani ko extracurricular activities se ngasai gi quiz toba de mayam observe toba sports toba competition toba SNA gi akoi gi state SNA advisor ni sar zone ji ko aduna noi kaino gi SNA du yauro kan competition toba this is also important not only in study the nataba si mayam su toraga angang si su transform tawsia ba ko aduga angang gi well-being akoi gi well-being and some of the things he mentioned sathokpa no mayam unnaba ko adu su darkar lai scenery yang ba chatpa we ba hogi picnic kumba dum chali dana angang ni sometimes pubiba recreation oina ado time schedule du akoi na simba tare environment tu bhajan toba anti ragging free we ba aduna anti ragging gi loi thele ko hogi tia ragging da mi hatpa sinaba lai ragging bhajan thina tawre haragadi kanana su tamning de ko course pamna de adu mayam am lei heba aduna akoi gi course hogi su male nupa yam la nupa jingi nupi na khara ngang na ba nungai haiba tare nupi da di lam hen ba wa yaurga su 1 or 2% ka ni nupa di lam hen ba yam yawe nupa ni ko nan tummi je pung mapan makhai mapan na parikha tak du mapan makhai ba leiram mi ne kai dawri no haraga ngamdre adu kauraga tawre ade waza duna di parikha to sanghalam de this is example what I face parikha sanghalam dre ma parikha sanghalam dri se ai na yenge kai dawre angang parikha yaw da ba yaw se nupa ji masing chudi ne har moi sumai tawdre adu kamai tawi no noi di en hai adu mapan de lephalle adu di I mathakta kare 4th floor ni that also without lift I go off I ask the student hitana ma piung do loi leiramine value je kayam khangdagi yengune si sawning moidra haba oza mo sawning nam sanghandri mi oza dun tawri do adu ai marak sida kamai samjai ni si adaptation ni ko lai je ade ai na kari no noi kamai taw no madam sumai taw na tawre adu noi di sar madam da request owe adra ai kitang thengre sa ngapi ai matung tawjero habadi yaidana adu haire moi tadre thonglon jala leigri punghai mu pungmung lepa thonglon jala leigre haire ne adu di we are going to take internal assessment from that internal mark thagat toini shall we conduct another exam tawgadra ain haire noi waranu angang jinje ihallo tongane ihallo moi gi matam howasi de pirasi from my side I relax myself ai moi gi dong ta khalaga relax tore adu mai tawre punga mamu hengre changhalle moi matam du pire matam du di kanu tawdri yadra men pire matam du dum pire ira kan sida ayukta taibo ozaji na haire ne moi gi damak dandi je khoina phange haire ne satra gi yenga ga moi na dandi je phange pung hena exam tawdore haire then I manage another teacher ma inam thare punga ma du gi tawro satra gi damak tani samjaina ba haiba du di yaidana aduna anytime when they have problem they come to me I want the laeba madam suti loge adu loge siguma problem mayam se laeba aduna angang ching chisu mayum dagi sigumba professional course ama lorok tabanina adaptation is very difficult. Sigi said the management or the administrator is taking all these things and trying to solve how much we can solve from our level. Sigi ini haba sumai tok dana adaptation to bigadam ni sometimes mo sana ningi haire sana na aduna institution khuding ma se there should be playground haido akoi study playground ji hek leitaba akoi ma kisu leite aduna akoi na hire to ko sometimes adu nupa mayam si laga di ball sana ningi haye this is outdoor game ni na space yam changi sigumba sisu akoi na yengbi batai so that suti yam chatningi adu chalhandre moi adapt tok de pungning changde telephone pai ge hai sigumba yam lei haba sigumba se akoi site tagi kayam kaino to ba yabage haibu yenga akoi su wazagi su kari gi su adum yengini wazasing sina su dum hai pe nungi matang da su moi penja daba pen draga di thabok phajana perform to bongam de ko sigumba mayam su lei aduna aikoi khuding mo wazam sung satra singsi phajana tawrakanda aikoi na khangjan minaraga solve to minaba se tawragadi aikoi na fazana adapt to bongani na khali no khara gara sum training ji yauksalakanda akoi satra sing jo fazana adum loina bisi hai gumadana satra du lakragadi private sector da leiriba mayam se tolo phangoi doini ko adu ma jo koi khang haje duga loisalage atai di sar jonna haiba ngasagi meditation yoga adagi mayam do aduna assessment to bai sa thokpa khotokpa time management prioritize to ba adu mo mayam duna adu toroga koi kan to sanji ko natragadi topic se adum yam chawba mawong yam leiba jani. Thank you all. Yare sar da hangning question hango aduga leitragadi sar si matam piraga magi phambam da phamal lage yaraba. Any question from the group? Leitre ko amoy loy hai banida
Puki adaptation ka ba sanga project
sange
puk matam yorob nan ko sir
aduni puk yaw dragadi attention leite na attention leitragadi kaino leitre ko ha
thank you all
moy hai ram ni na hanin ponte da.
Thank you, sir. Thank you, ma'am. Thank you, sir, for your valuable insights and productive session. I now request our conference chairperson, Professor N. Nalini Bala Devi, Principal, Acme College of Nursing, to take the seats. With this, we conclude the first session. Lunch has been arranged. There is some slight changes in the timing. Priorly, we have planned it from 12 p.m. to 1 p.m. But right now, it's already 12:43, to my knowledge. So we'll have a lunch break for 1 hour. And I request all the delegates and dignitaries to kindly present here at 1:44 p.m. sharp, so that we can start with the second afternoon session. And for the lunch, I request Dr. Pukram Robin Singh, Administrative Officer, Raj Medicity Nursing Institute, to kindly guide our esteemed dignitaries to the 6th floor mini conference hall for lunch. And also, I request our Miss Monica Lyshram, Assistant Professor, Raj Medicity Nursing Institute, to guide our delegates to the 5th floor for mess hall for lunch. Thank you all. We'll meet after the lunch break. There has been some slight changes in the timing of the lunch. We would like to shorten a few minutes of the timing that we have given. So I request all the dignitaries and delegates to reach at this auditorium hall by 1:30 p.m. so that we can start with the afternoon session. Thank you.
hello, hello, hello.
A very good afternoon to one and all once again. I request all the delegates to get seated so that we can start with the afternoon session of our first state level conference on teaching and learning process in nursing education. Before we move on to the academic session, I would like to first acknowledge our chairperson of this conference for the afternoon session. It is my privilege to request our respected Mrs. Chungkham Bidani Devi, Vice Principal, Raj Medicity Nursing Institute, to kindly come forward and present this token of appreciation to our conference chairperson, Professor N. Santi Devi, Vice Principal, Irengbam Thancha Devi College of Nursing. Thank you, ma'am. Before we move on to the next segment of the program, I would like to inform the gathering that our esteemed Chairman and Managing Director, respected Sri Habijam Rajan Singh, Chairman and Managing Director of Raj Medicity Hospital and Raj Medicity Nursing Institute, has taken leave due to an important official meeting. We extend our heartfelt gratitude for his gracious presence and unwavering support of this conference. Thank you, sir. Now, I would like to invite our respected patron, Dr. Ngarambam Narendra Singh, Chief Medical Services, Raj Medicity Hospital, to kindly present the certificate to our conference chairperson of the first session, Professor N. Nalini Bala Devi, Principal, College of Nursing. Thank you, ma'am. Thank you, sir. Next, I would like to request our respected patron, Dr. Aribam Ibotombi Sharma, Medical Superintendent, Raj Medicity Hospital, to kindly present the certificate to our resource person, Mr. Laishram John Singh, Lecturer, College of Nursing, RIMS. Thank you, sir. It is my privilege to inform you that this session will be chaired by Professor N. Santi Devi, Vice Principal, Irengbam Thamcha Devi, College of Nursing, whose guidance and expertise will lead us through the proceedings. I request Madam to kindly come forward and take the seats on the dais. And for the third session, we are honored to have a distinguished resource person for the third session of this first state level conference on teaching and learning process in nursing education, Mrs. Namarapam Bindya Devi, Assistant Professor, College of Nursing, Medical Directorate. Before we move on to the session, I would like to briefly introduce about our ma'am. Firstly, I would like to give a short introduction about our conference chairperson of this afternoon session, Professor N. Santi Devi, Vice Principal, Irengbam Thamcha Devi College of Nursing. It is my privilege to introduce our esteemed conference chairperson, Professor M. Santi Devi, which is also a former Vice Principal of the College of Nursing, Medical Directorate, Manipur. Professor N. Santi Devi has hold a master degree in science in community health nursing from the Regional Nursing College, Guwahati. She has undergone several prestigious professional trainings, including GFATM training in Guwahati, Skill Lab and OSCE training at Safdarjung Hospital, New Delhi, and training of trainers, which is taught for community health officers at the National Institute of Health and Family Welfare, Munirka, New Delhi. Professor N. Santi Devi has served as a nursing resource person in numerous workshops, seminars, and training programs across Manipur, making significant contributions to nursing education and professional development. Her vast experience, academic excellence, and unwavering commitment to the nursing profession continue to inspire students and healthcare professionals. Thank you, ma'am. We welcome you, ma'am. Next, I would like to briefly introduce about our third session resource person, respected Mrs. Namarapam Bindya Devi, Assistant Professor, College of Nursing, Medical Directorate. It gives me an immense pleasure to introduce our esteemed resource person for the third session, Mrs. Namarapam Bindya Devi, Assistant Professor, College of Nursing, Medical Directorate, Manipur. Mrs. Namarapam Bindya Devi is a dedicated nursing educator with 18 years of rich teaching experience in nursing education. She is presently serving as an assistant professor at the College of Nursing, Medical Directorate, where she has been instrumental in shaping competent and compassionate nursing professionals. Academically, she completed her master's in nursing from Padma Shri College of Nursing and is currently pursuing her PhD, reflecting her commitment to lifelong learning and academic excellence. Ma'am has made significant contributions to nursing education and research with 3 research publications to her credit. She also served as a research guide, mentoring students in scholarly and evidence-based nursing research. Mrs. Namarapam Bindya Devi has actively contributed to the academic assessment process as a question setter, evaluator, paper checker, moderator under Manipur University, and also as an external examiner for nursing examinations outside Manipur. Her passion for professional development is evident through her participation in more than 20 national and 2 international conferences. She has also successfully completed a 6-week Dakshata training with support from the Japaigo, conducted under the Ministry of Health and Family Welfare, Government of India, New Delhi, further strengthening her expertise in maternal and newborn healthcare. With her vast teaching experience, academic achievements, research, contributions, and commitment to nursing excellence, we are truly privileged to have you, ma'am, as our resource person today. I now hand over our afternoon session to our conference chairperson, Professor N. Santi Devi, Vice Principal, Irengbam Thamcha Devi College of Nursing. Thank you, ma'am.
Thank you very much. So, good afternoon, all the dignitaries of the dais and all the participants and all the teachers of different colleges of nursing. Today we have come to the second sessions of this conference. In this second session also we have 2 resource persons, 2 speakers we have. First speaker we have is Mrs. Namayrakam Bindya Devi, Assistant Professor, College of Nursing Medical Directorate. The topic she is going to deliver is on strengthening evaluation skills in nursing education. The time period given is 1.5 hours, but very sorry, one thing is we have already 30 minutes left.
I'll try to finish as soon as possible.
Speaker will manage it. 1 hour, whether it be 1:31 and you can avoid it. Whether it be 1 to 2:30. Okay. It is again clear, organizers, that it is 1 hour.
Okay.
So, then it will be up to 1:30 to 2:30. So now, Mrs. Namayrakam Bindya, I call upon Mrs. Namayrakam Bindya to begin the session.
Okay. Thank you very much, ma'am. A very good afternoon to one and all. And I'm very thankful to Ras Medicity Nursing Institute for giving me this opportunity to be a part of this first TET-level conference. Everyone had a good lunch, I believe, and I try my maximum not to bore you, and also to go to a little practical part where we are currently countering when we come across to the semester academic section of BSc Nursing. Adun hana annual oirambadagi BSc Nursing da lakpa matamda evaluation ki process kamaina tawgadagi haibadugi practical part oina khitang changzhalaga entertain tawnabasu ai honazage cooperate tawbiro aduga in case doubt leiba oiro discussion oina chase one sided natabada. Anyway, my topic, which is I'm going to deal today, is regarding strengthening evaluation skills in nursing education. Now, when we talk about evaluation, what it comes in your mind? Evaluation haiba matam sida akoina kari haina kari ne haina lobi ge somna. Kari ne haina lobi ge evaluation haiba matam sida. Thabak ama tawrure natraga anything thabak haiba matam sida larik paba natraga nursing ki course khatang wa nataba chak thongbo oiro phi subo oiro khanom tawum oiro at the end tawriba poto karmaina tawgi haigi bagi at the end point akoina yengba potu ne ba evaluation hairiba potse adana question am khatang akoi college khara 8 semester se yaram gadra yaram da basu yai ai college 8 semester angang se yawi moina 8 semester lakpa matam sida final year sida kamain tawge da loire 85% phangdana moise marks se yam wangna phangdana like se tamba loire practically moise laktana bedside amada hengwai matam amada moise staff nurse side na patient care bedside the patient care loga da matam do laeba so adu matam sida internship 6 months intense internship haidana academic 6th semester matamdadi. First semester to 7th semester we have both theory and practical, but the last semester 8th semester the intensive there is no theory, only exclusively intensive clinical setting khatangi matamda yorok matamda angang sida hang question say, how did a student with excellent grade struggle to provide safe patient care? Khangdre ma je kemta mana khangda bagi maram se mana lakku matam sida ma se patient ki conditions sa kari haina lege, even basic vitals kamaina check tawgadage mana medication administration, different sides of medication administration kamain tawgadage khangjalakta continuous supervision kamaina pigedage khangjalakta mayam sida questionable se akhoi isada oireba akhoi na anga ama assist tawraga 85% the passed away haidana excellent haibagi mingthon pidoriba anga se kamaina my 8th semester yoksalaba internship matam sibok the magic stu yamna khangri se sigumba anga ama da excellent grade phangba ma sida ma sibu patient safe care, patient ki safety se mana kamaina provide to bangam gadra ngamoira ni yengjaleba adudi soiri se kadai dano 85% phangwaduna hekta ma se yam excellent oiba nurse amani ma safe patient care pigane habe guarantee amadi leiramdre kaidai de soiri. It all depends on the failed evaluation process. So why is the evaluation matters? First, it ensures the competency. Competent oibra oidabra. Patient safety ma provide to wangam brangam dabra. Promotes the quality of care. It's not the quantity. It doesn't matter how many hours he or she spend in the bedside with the patient. It matters how much, maybe it's just in half an hour or 1 hour or 2 hours. It depends on the quality of care the student is providing to the patient. And also it enhances the teaching. Akoy desune. Akoy na nga 85% phangi haina pihiba poto. Akoy evaluation soiba na neba. 85% phangaba angang man na 8th semester yobo matamda they doesn't know how to perform. So the failure is in the teaching also. So this evaluation also helps to enhance the teaching process and supports accreditation. Adun akoy na accreditation ama piba matam sida chana da bahai so evaluation juna khangni. So this is why the evaluation matters. So now when I was asking you about the meaning of evaluation, this is what I was expecting. Collecting. We collect all the source. We analyze it, what is happening, then interpret evidence to judge the achievement of learning outcomes and improve the decision. Akoy decision do. Clinical that haba matam da koy na yeng nang chalaga medication piru chon medication pire IM pire galai IM pire lakmas I gi decision se my evaluation it depends on my decision whether he or she is competent enough or not. So here when we talk about evaluation it's not only the percentage, it's not only the mark. We are going to collect what they do. We are going to analyze and see, and lastly we are going to interpret. Why? So that we can judge the achievement of the outcome. Tawthur ise kamay tawthur ino magi decisions ina aman tawthur iba po tuna akoy decisions se kamay na improve tawgadage haibaduni ko. So this is the difference between assessment and evaluation. When we do assessment, just the ongoing feedback. I know who's class lori ba class gi I know who's discussion tori ba po it's a kind of assessment. And evaluation high tardi overall pumna maksa loina maglor matung the horen session zigi conference lor ba matung the judgment people poto that is evaluation. So assessment guides the learning because it's ongoing. We get time to rectify, we get time to change it, but evaluation certifies the achievement. Achieve tawi tawde grading karino maze A ni A plus ni B ni B plus ni. That's what the evaluation do. So the principles of evaluation: validity, whether it is valid or not. We check whether it is reliable or not. Objectivity labra, fair oibra oidabra haibam suyeng doini. Practically, practically mo na pangthok pangam daboy tari, it's a failure. Next, it should be very transparent enough. Now, evaluation method. Hi riba mayam sida akoy na annual gining sa matamda, what we were doing was written, viva, and clinical observation. I believe. Singatan ni ko koy nang asiwag da tawra iba po se. Hospital da chatlani MU exam hires MU the 3 hours exam irani loirani. At the end of that, we send the student for the practical exam. When they go to the practical site, we give them some half an hour time for the history collection. Then we observe clinically how they perform. We bring back the student to the college, then we take Viva. This was what we know so far. But there are certain other evaluation methods are there, namely as OSCE, portfolios, and simulation. Simulation, thing as I first session the Madam Zamunan discussed the chap mane. Ano bukhara hapsal eibu po se I discussed the So traditionally what we were doing till now is only essays and Viva. Essay ihalani. Essay higher tardi heta essay ihan madunate ko. Writing part to na in haizeri se. Ihalani, tawhalani, Viva laurani, okay, angang je pass we fail we 50% pangadi pass, 50% pangadi fail. How's it modern the lies in OSCE? Main topic ay nga CD ay OSCE se oiga doini ko aduga DOP direct observation aduga mini CX ay silway discuss taw zarake oza yari ba mayam sida point ama khatang ay highlight taw sage akhoi gi university exam taw matam there are two kinds of university practical exam. First one is practical exam hairaga DOP ga OSCE ga taw bani mayam ningjang bi ko DOP na 35 marks ni, OSCE na 15 marks ni. Semester, first semester labor or second, third kana adugi pattern de follow taraga practical exam conduct to bige. Hanalai in 100 marks, higher 100 selway na mag practical never. Was it 8th semester exam lakma matam dadi fully 10% je OSCE de depend tau do never. Adu nataba first, second, third, fourth, fifth, sixth, seventh. It depends on OSCE, which carries for 15 marks, and DOP, which carries for 35 marks. Practical, huzik MU de marks sheet thaba matamda, huziki pattern do thabiyo. Yam kanna adugi pot se natradi haiba pot amakha instruction laibane. So let's go in detail with OSCE. So OSCE is objective, structured, clinical evaluation. What Marie se, si munna khangadi OSCE se yam laire. OSCE bukhangadi akoina semester gi BSc nursing gi chahi mari gi angang lauriba semester nipan gi clinical evaluation is it's very easy. So let's go in detail. So OSCE se practical akoina bedside tang asibuk da angang da to holiba bed making to physical assessment head to toe to IM injection PU adagi comfort devices me ama season no haina tawriba practical ne. Performance based assessment oiba tawi natraga tawde haiba po to performance based kanagi for evaluating clinical skills in a very important controlled environment. Now controlled environment haiba siga mamangi atopo laiba practical siga OSCE se chamane mamangi practical me am ju practical ni performance based yengini tawi tawde hai ti yengini ba. But I don't think you have come across the word controlled environment, because when we go to hospital, when we assign a patient to the student, there is no controlled environment. Patient lakani, patient party, atopa students me ama, doctors, nurses me ama, ato I marakta tao bani. OSCE dadi completely controlled environment ni. Scenario ama station ama, everything is controlled. No sound, no disturbance, only the one-to-one patient and the student and the examiner. This is a difference between the OSCE and the other mode of examination. So OSCE were originally designed for assessment of medical students, but now commonly it is used to assess healthcare workers, nursing, paramedics, physician associates, so meaning of OSCE ay nasa haibado objective niko yam na kup na one-to-one kari season yam ba matamda mayam loy mag OSCE gi experience loy mag leram when checklist ama season na draw. That is O, which stands for objective. Structured. I know OSCE matawgi have matam the sige classroom na troga sige conference hall tira OSCE tawgi have but changa in OSCE ekta tawgi have se ya ba. It should be structured, pre-planned. Kamaina same gadagi pungching kya same gadagi kari point hoy gadagi marks kyam carry hoy gadagi who will be the examiner, who will be the examinee, who will be the coordinating committee, who will be the coordinator. Circuit kamaina same gadagi. So it's a structured one. Next, third one is clinical. Now, the tasks representative of those faced in real clinical station. Aduna, see the controlled environment and a hospital the natabada isa isagi lab the skill station oski station semba matamzida mana de hospital ne natti haibatar so it should be exactly like a real clinical set station dong na sembi ga do buneba. Last is examination, which is the main part of evaluation. That means you are going to assess in the form of examination. Chatlaga ita yengaga tholak padu na tib exam ki type ta mark pi do any performance kamain ta we satisfied oibra moderately satisfied oibra fully satisfied oibra haibagi examination amasu lawga do ni ko, so that stands for OBSCE. So objective means fair without bias and use of checklist. Structured refers to the organization of the examination. Examinations pre-planned hande hong na structures mayama. Structures symbol matam chida syllabus ta yaubra yaudabra aina maonde yengdori ba skills kaino newborn assessment oitari newborn assessment ki kari kari yengadagi management of third stage of labor hai tari kari kari yengadagi haiba mayama curriculum da yauba curriculum do fulfill tawba skill yengadaba mayam do mathang mathang yawi gadawuneba aduga piba matamda aina examination amagi marking ama pigi hai tardi aina clearly instruction hana taseng na candidate amana OSCE station am lak matamda we are going to inform the candidate the instruction very carefully, what are the do's and don'ts, the time given, the exact thing what we are expecting from the student. Next is the clinical examination. So clinical, as I said before, it's not happening in the hospital, it's happening in a lab, but it should be a scenario of a clinical in nature. And examination, because it usually declares whether the student is competent enough to handle the patient or not. Now, OSCE is the kind of checklist, checklist, but somehow, akhoi cook sida mana tawri ba sida gi ahen ba mama je perform tawbra ngambra ngamdabra haina hangninge na khalaseba. You can put up the question, but that is not a part of structured. So structured means which you have already planned one. So in case if you put up some questions randomly in between the exam, you can put up, but marks will not be given for that. Please remember this. So principle, uniform. Student do tara waigera kun waigera 30 40 no matter what, it's uniform for all. It is a pre-planned structured one. It should valid 2026 ki hozik lai ribasida valid waigeda it should be reliable, feasible to perform. For example, bone marrow aspiration hairase bone marrow aspiration je aina OSCE tawo matam sida feasible oibra oidabra yeng matam de okay observation de di yai ba koina bone marrow aspiration tawo matam OSCE de perform tawse na hairase kaino de yaw bane BSc gi adult health nursing gi de bone marrow aspiration yaw bane ko adu gi do kitang khana magi ai je kitang mind de strike na feasible oibra oidabra confidential oina thamgada bane. And last one, as I said, it should be objectivity in nature. Now, how you are going to plan a OSCE? First one is planning. Obviously, it's before OSCE. Implementation means during, and evaluation is after. But what we need in planning, it's mainly the structure. Who, to whom? Man, money, material, and time. Man factor money is iniko. Next is the process of OSCE, which I'm going to deal. Last one is the outcome. OSCE ma tawre aina OSCE ma semi ba pot se hekta aina adu siznaraga angang evaluate tawni haiba kashu leite. We need to try that first. That means we are going to see whether it is valid assessment oibra oidabra haiba du yeng duni. Doesn't mean bindia aina sembo OSCE je loina ma follow ta wadam ne haiba leite. We are going to try it, we are going to make it, we are going to try it, then we are going to see in the outcome whether it is has a valid assessment or not, whether it is reliable. And we are going to see whether the satisfaction is what is the satisfaction level of the examinee and the examiner. Then only we can decide that particular OSCE can be used as a part of assessment or not, or as a part of evaluation or not. OSCE same siko dude. Ozang atene OSCE kamai same gada gedo ay laksarage. The major components of OSCE. First, coordinating committee ma mathau tai. College khudingi examination in charge amam roi lai biram gani lai ko. So coordinating committee, principal dagi horaga, exam in charge dagi horaga, lab mayam gi same gadoriba, station mayam same gadoriba, adugi coordinating committee ma. Now, head one person that is the exam coordinator. We have different subjects in nursing. Fundamentals tagi haurasi, adult health nursing, pediatrics, psychiatry, OBG, community. So we are going to see what are the list of skills. What are the list of behaviors and attitude to be assessed? It depends on the speciality of the subject also. The skill which I'm going to assess in gynae and the skill you are going to assess in psychiatry is different. So based on that, you are going to list out the skill which you need to assess, the behavior or the attitude. Next one is the criteria for scoring. Now here in criteria for scoring, OBG amagi, gynae amagi skill station amada, aina 20 steps ki piba matamda adugi phangadawa mark tuga asomda psychiatry ki 20 steps piba mark tuga chap manani haiba kaisu leite sidane structured ki importance lagtu ise procedure ma perform taw matamda mai magi clinical specialty de labor expert tuna khange si procedure ma perform taw da matamda he needs only 1 minute, he needs 2 minutes, he needs just fraction of second. So depending on that, there is some criteria for scoring. This is marking scheme for the checklist. 2 marks, 8 steps, 2 marks carry tauge, 1 carry tauge, 3 carry tauge, 1 adugi potuniko. Next, who is the examinee? Who is the examiner? Then next comes the examination site, which is nothing but the station of OSCE. OSCE station. Mayam lay na. Fundamental lab ki OSCE station, OBG ki OSCE station loi lay biram gani. Magi station duni ko ina haizeri se. Next, the very important examination station lai. Sigi mayam sidi ako ina list ka loi seme ko. Now examination station sida ay na sige kaze examination ki OSCE station mari lay hai na lawzerge. Station 1, station 2, station 3, station 4. Now since there are 4 stations are there, 4 students can be accommodated at one time. Now, what we are going to see is time and time allocation between students. For example, mamangi ahamba OSCE station, the procedure say 5 minutes ki OSCE or tardy. Okay, first station say 5 minutes ki skill je assess tower say na lower say. So station 1, 2, 3, 4 is a bell amat king bangaga angang magi station 1, 2, 3, 4 the chat krani. Even after 5 minutes, the bell will ring. Then the first student will go to the second station. Second station student to the third, na fourth, na 1. Sige time allocation. So yam kup na hoto po ama changeva. Like the lawyer harga. Oh lawyer bang atang ay koko ay atang lawyer kaurake. No, it's time bound. Noong mada angang 40-50 students ako'y OSCE na present or galoishan gadoy niko. Next. What we need is anatomic models for repetitive examiner. For example, you have a female pelvis. Female pelvis, like consider magi repetitive same sigi station number 1 sida OBG practical ni mawanda hangdori se fetal skull ni natraga kanwani female pelvis ne hai tardi models ko mathau tai ba. Newborn resuscitation mathau tawhange hargana mannequin mathau time. So that is what we need in the examination site. Then there is something called as couplet station. What's the meaning of couplet? 2. Couplet, I say 2 niko. Couplet stations in a kamaintawi. First we send the student. We ask the student to do the physical examination. That is one procedure. But depending on the physical examination, we ask the student to identify the problem, to prioritize it, and we ask them what is the problem and how you are going to solve it. Couplet station. And a station, ama khatang lai besu say, babachang physical examination taroga thoklo hai, that is a single station. So if you are planning for couplet station, we are going to plan the scenario, problem solving. Ako'y na angang dudagi diagnose tahoningi ba problem dohan ako'y na stimulate taroga thameba. Next is examination questions. Questions may like for example, observational OSCE kaina, breeds presentation, get different frank breeds, complete breeds, iraga thame. And on the bell je king changaga nang asi the period observational skill do write down the types of breeds and come out put in the drop box changani mana mark taramani drop box athamamani thoglani. Examination questions. Next, environment of the exam station. Now exam station sida amaga wangang bata thok ta sin tawra adequate light laitraba, adequate space laitraba, those all. Next is examination station circuit, which is very important. That is what I was talking about. If you don't know how to maintain the circuit, it's wastage of time to conduct the OSCE. because one factor of OSCE is to save time. Adana OSCE stations is circuit se kamaina lakadage is a khangdaba tari it's wastage. Next is ninth step is patience. Standardized oigera natraga simulated oigera. Ayama matamda psychiatry gi OSCE conduct matamda khoina patient ama lauraga sigi symptom ada depression na bagi ama na bagi nang phamo hangba matamda sisi question je hangong haraga khoina thamaga simulate standardized patient oina seasonable su yawiko. Simulated patients in antenatal mothers kumba oiro natraga mannequin oiro dum seasonable mayam duni. If you are using a standardized patient, it's very important to give proper instruction to the patient. Kari tawadage horen student namala kani exams na wanda low duni nang na kari khumgadage kari tawadage kari signs and symptoms utkadage haiba poto we are going to give the instruction to the patient. Next, timekeeper. We need a bail. For example, the OSCE time is only for 5 minutes. Whether the student finishes in that 5 minutes or not doesn't matter. Just have to ring the bell. The student has to come out from the OSCE station. Next, number 11 is contingency plan. Contingency plan se aina phana phajana plan tawrazu unexpected ama thogla adi anything can happen, so you should have a plan B. Last one is assessment of the performance by the OSCE. Last ine khoina akoina khangi ba part tu khatani ko OSCE conduct tawro chatlaga performance ta honba do khatani. Next one is steps. First is have a set of clear objectives. Now having a clear set of objectives se therapeutic procedure immediate care of newborn de yengase. Immediate care of newborn gi OSCE ama koi prepare tawdore. So first one is having a clear set of objectives, that is nothing but demonstrate the steps sequentially using the right technique. Objective like steps tawduri ba newborn assessment high kanjida akoina kaino hana gari head to toe assessment tawadab jida angang do phajana loi ma expose tawraga khollaga yengaga sequence ama head to toe la kadab je directly mana meconium pass over urine pass over han yeng budon tab sequence ama lai dana khoina angangi body build ka maina tawi magi anthropometric measurement yengi height and weight yenge then fontanelle yenge mathang because angang do fully exposed to tari magi thermoregulation that stuff to rokadong so you should have the sequence how to make for the newborn assessment. Scientific principles may follow the then you are going to document the procedure. Second step is identify the practical aspect. Now newborn assessment aina satra dagi student dagi practically aina pami se kari yeng bano. First one, hygiene maintain tawdabra. Next, thermoregulation maintain tawdabra haibado. Housing mana sequences at the tardy angang do sabak tak down like the pakto my meconium passed over umbilical cord hana yang tardy my thermoregulation to maintain tawdreba. Angang do kupsaling I do the magi face my fontanelle kaki magi low setting air when maging tukwa hana yareko. Then you can come step by step. So maintenance of thermoregulation, care of eyes, airway cord yengbra, hemorrhagic disease prevention tawbra, promotion of exclusive breastfeeding documentation. Just an example, practical aspect. Akoina newborn assessment angang da tawhan gi haba matam sida practical aspect kari cover tawgade gi haina yeng buduni ko. Now select the tasks. Aina mamang the high river hygiene maintain tawbra tawdara na check tawdu. How we are going to check? By checking whether the student washed their hand or not. Gantay ko ina hygiene se. Aduna ayun na mamang the p river practical aspects. The hygiene maintain tawbra tawdara je kamain khang do no. Hand wash tawdan makut ka je kabu mapimaron tay thu tak lang pai badu na teba. Yeng doi di angang je first step ma je hand wash tawbra tawdara hai badu neba. Second step ta kun yeng matam the maintenance of thermoregulation yeng matam je kangaroo matter care ka ma je p dabra. Gantay ko tax ama yenge hai tardi practical aspect yeng base adugi practical aspect to kari tawraga yeng handoi no hai baduna that is a third step. Next, break down into subtasks. Now five first tax macha first hand washing to holo gloves uphalo baby do pre-warm towel na dry tawro then sniffing position the thamo clean the eyes open the airways coat the clamp identify tech hapo mummify tawro weight measure tawro vitamin K piro. These are the subtasks niko kadai degi la iba subtasks no tax sidagi high riba tax 1 2 3 4 5 6 tasks se fulfill taw gi habi matam da koina subtasks macha sem do eba. Next same iba subtasks sigine hoji koina score pire sem nasai hen hygiene maintain tawra tawdabra do kari na yeng do no we are going to see whether the student is washing hand or not. We can give a maximum score of 2 High soft tasks me am scoring people in this is the 5th step. Now for this task the maximum score is 30. Now sembal were ko oski se list semdo galere kari yeng do no full mark ya no haidu semdo lore. Next oski perform to dori ba room do mu setup tawre seva. Station zigi maming kari kawi immediate care of newborn. Theto ga thamani changbam zida mathak to da angang do changaga table do lairani newborn lairani immediate care of newborn. Side 3 do da napaga thamani ko. Duration kya PC ke 10 minutes. That means high river the listed performance 15 steps. When the student was performing 15 steps, the time allotted is only 10 minutes. Whether he complete or he doesn't complete doesn't matter, but the time given is only for 10 minutes. Then station instruction. Changaga karita wadage have this station instruction pithoni mannequin darka lere mannequin thamani then equipment required se thamani. Station same tawada steps to lere. Next conduct tawro hose. Examiner lere ko Sigi mayam station sigi mayaida there will be the coordinating committee, someone with a buzzer or a bell who is going to buzz the bell stating that you can start the procedure. The second buzz or second bell indicates that it's time to wind up. So here the students are allowed to perform the required tasks within 10 minutes and should stop in the next bell. Next, make notes of the process. Hoji ho koi oski se final try tawine yenge process se. Mas aidigi aina semi bus station, aina semi bus tasks, stop tasks, coordinating committee, piri ba 10 minutes se satisfied oi da bra have do yinge satisfied oi de review modification kai kai darkar le this out tawre ko tawra matung da next kari lani analysis part lani. Now analysis part se sinang sai student na perform tawuduni examination BSc nursing first year date registration station 1 30 marks mana kya secure tawi station 2 how many marks and how much they secure name and signature of the examiner. Sigi mayam sida student ki performance na yam pharaba examiner and examinee is both satisfied and you can finalize the OSCE. Otherwise you can make the changes and you can make in a very performable way. This is how you prepare an OSCE. Now OSCE kamain tau gida gede khange. Now you are the head of the examiner or the coordinator. Now the question comes to you how you are going to organize the OSCE. Student perform tau budu dikhange ko list pirani ma tau tau de haibu khatani. Coordinating committee coordinator among ina OSCE kamain organize tau gida ge college amada exam amada MU exam da kamain tau gida ge haibu ni. OSCE station say about 10 to 15 lay, each of which requires 4 to 5 minutes. I would like to highlight that this 10 to 15 station is not that compulsory. It depends on kaigumba 8th semester examination where specialty mga mag oitadi stations mathok tai ko. First semester examination natraga second semester examination the fundamentals of nursing khatang lawta wuda we don't need 10 to 15 station. If you have 3-4 procedure you need only 3-4 stations. And the time depends on the type of procedure which you are going to give. So here the students rotates and move through all the stations. See the I say time bound ne haibedo. Example lamane 15 station later. 15 stations either roll number 1 to 5 say immediately one time the 15 station the 1000 groba. Piriba procedures they 5 marks oitardi. 15 student ki procedure mein assess ta bomatam that it takes only 1 hour. As simple as that. Mamang na ko na tawudu di kay no bedside ta law la or amo viva tawro amo assessment tawro it's a very lengthy procedure. OSCE da di kay no station mga layro tara layro ahum layro depending on 5 station 5 student one time. Ring the bell, make the student to do the performance, come out loire and next another 5 student. So one time the station depending on the number of stations, you can assess the student. Other time saving say yam oy bapot amani ko. Next, ay nga sabi do. Procedure station. Tasing na mana patient amada na traga simulator amada mana procedure. Tawuda boy tadi we agreed upon the checklist or the rating scale to score the student's performance. Next is response. Response performance ina na magi findings to. Ako'y na kayo mapire. Partograph mapire sa example. Partograph am pi kanje partograph yek thok ma pi re partograph loin khangbi ko partograph am pi matam ye ba partograph sigi matung ina what is the next step what is the decision for the patient haiba poto, it can be a right type of response station. And the response station gumba din matam gumba kitang piba yai aduga kari gumba procedure station oiga tari tasing na procedure tawhon gadaba resuscitation taw. Example, anthropometric measurement low high tardi, it's a procedure station which is little lengthy. Aduna time bound se procedure station ra response station la haiba dugi matungina time se khaidui ko. This is what I was talking about OSCE. Ai jangjan ge station je sidala is 1 to 15 ubi ko 1 to 15 si the student chang student 15 chang ba. After first 10 minutes for one procedure loire second bell king ko jar aduga king ba matam angang dina attend ta wodab di 15 stations loi ment attend ta wodaw ne ba adui di next bell king matam da the student which was there in station 1 dina kana da satoi no 2 duna 3 da at this station 1 da lak to students karamba student no 15 da labor yan tai ko adu minus 10 minutes speed ba matung da 10 into 15 150 minutes hires adu the 15 students huna loisan doing ne 15 minutes 10 minutes ki procedure oi tard and a sig circuit say it's very important to know this circuit se khang da tari anga amalwar ga mo ngai na ni amalwar ngai na ni it's wasting of time and OSCE principle follow tawdre ko si jine lai ri se mayai da mi ama lepi ko kanam tan nate maze buzzer pai budne mana matam yeng doini matam yenga mana bell je king aba matung the station je 1 2 3 4 5 6 7 8 station ne lei se mana hek buzzer number ga station da change perform tawre thogle perform tawga tholak phase mana buzzer namaka nam dige ma tholak pa su ya de ko because communicate to holoi dune scenario je kaino khangal loi dune loire ne ma tholak pa ya de please remember that I loire 10 minutes say I just 7 minutes loire I'm very perfect in this procedure I finish off early I come out no you should not allow that because if they came out there is chances that they communicate the scenario prepare to rani so aduna loi ji bhoba buzzer je pi ji bhoba my room da laiga do steps first step ahum di very common 1 2 3 it's high common step ne hai tare first one is registration student ki registration ma irani ai gi roll number c ni aduga instruction nang na station je si ka dai changba hodui ni ko si station je mari lei ni changba jira kari instruction no investigate yeng nang na sa da mobile yaw da bra loi ma yeng that is the first step registration second one orientation we are going to orient the student before they enter the examination site exam format kaino procedure kaino policies kaino team na ganano manang mayai sida haiba duna bel khinga kanda changa damni bel khinga kanda thoka dani everything orientation pire ba matung sida third step ta exam gi position juda mai gi station ma padur mo ji lephal laga tham bel khing ri bo changba ya de ko then buzzer hek khing ba ga student ji changa ga magi perform taw ba hore perform to ba hor man hek changbaga my station to get instruction tongan na labor because it's different procedure so once they enter the station they are going to read the instruction and which required 1 to 2 minutes yan tabra na instruction piri ba poto loina magyengani yeng matung da with the next bell they are going to start the procedure next the encounter asing ba procedure to ba matam duni 5 to 20 minutes size now there is no specific rule that the OSCE procedure should be of 5 minutes or should be of 10 or 20 minutes. It depends on the step and depends whether it is a practical procedure or it is a response procedure or natraga observational procedure. Next, post counter. Loire ko je chalure perform tawre thugle. Tholku matam da some OSCE will have post counter of 1 to 2 minutes which is assigned as an oral question by the examiner in the examination room whereas some will not have this post counter period. Ay nga sai haibado. Pire ko ma sai gi scenario pire ba matung da nangi anthropometric measurement olido centimeter olira inches to olira fontanelle to karam kanda close to we anterior fontanelle karam kanda close to we when does the posterior fontanelle close question hangadaba part yaw tadi you can take around 1 to 2 minutes okay you can assign the marking and you can send the student for the next procedure now like that when the student has done with from one station the student has to repeat the 4 to 6 steps station changani instruction parani procedure tawrani post counter tawrani loirani amuk changani adumaina station loinamak thungaga changadawa. That's how the procedure OSCE is done. Last one is completion of exam. Loire moisi loire matung angang he thokhanda na ngaktang thamme so that hojik thok tori ba angang duga nauna chang pa angang duga counter dong na dana bagi damakta kaino nauna changa ka dori ba mari hojik thokre mari je counter station 1 adu le hobani 2 da adu le hobani haiba pora ma khak la ka dori ba. So here completion of exams, they will be dismissal area hai je maru oiba part niko. Otherwise what you can do is you can change the scenario in station 1 station 2 the scenario no ina change tok thoke ju ka shukai de. For example, nang newborn assessment yang mapoto newborn child kanogi pediatric nursing gi do newborn assessment do nang resuscitation on thopiro kashu kai dena KMC on thopiro. Station 1 is for the pediatric, but the first student counted was about newborn assessment, but when the second student came you can change into KMC. Yan tai ko. Next, example of model OSCE. Just an example niko. BSc nursing gi program the OSCE gi Ziki na hybrid therapeutic procedure care of newborn. Si magniko akoina same ga dori ba pot se. Examiner na kari kari matheu tai coordinating committee do na same ga da ba pot niko. What we need is writing pad, pen, pencil eraser, chair, table, tray. Examini gi oina dikai kaino hai ba masai gi go space sigi list of equipments ma'am se. We are going to plan an OSCE. After that, examini gi requirement ga examiner gi requirement laire. Mathang the objective se kaino aigi objective ti si instruction in duni ko examiner de pi doini kaino da aina ras ta lakpa matam da ras instruction je aina kon college of nursing medical directorate ki instruction ga mana deba si ki college ke betongan be instruction ama lai neba. So when I come as an examiner to your college, I need to know the instruction which you have taught to the student. Yan tabi ko adun aina sita lakpa matam da you are going to give me the instruction to the examiner how I'm going to assess the OSCE of the patient, of the student. So these are some of the instructions, sequence, technique, labor, like the yengo fully hiragan angang je 2 marks PBU, partially hiragan 1 PO, incompetent sunghai chungtau hekta uragan 0 PBU, total calculator. Sigi instructions jo agi college kanu ge college ka manaram da basu yai ko. This is for the examiner. Next, this is the step. Asai pihi baduni ko. Si I want the period, I want the handover tawre ko. Tawraga huzik aina OSCE perform tawodo yenge yengaga magi scoring se pi do ineba. This is what the OSCE says. OSCE ge any doubt? Kamai prepare tawragadage, kamai conduct tawgadage, circuit kamai na same gadage, time bound kamai na, dismissal area kamai na. If you have any doubt, please clarify, because this is compulsory as per Indian Nursing Council since the semester system has come. Yes, yes, sir.
OSCE every year of nursing, 1, 2, 3,
4,
semester
5.
6.
Yes, sir.
6 semesters.
8 semesters.
8 semesters. Every semester OSCE is applied.
Yes, sir.
From the first semester onward.
Yes, sir.
And what is the level of entering into the world and even in the OT? They have to learn the techniques and the instruments and all these are taught in the lab or in practical inside the OT.
Yes, sir. So OSCE is a kind of clinical evaluation which is not done in the hospital. We are going to set up a station which is like a mini OT, for example. If we want to teach the student about setting up of a normal delivery tray, we are going to set in the OBG lab as a station. Adun adugi poto hana ozana satra da taani tak pasisu ozana takuma tamda OSCE oina dum tak to ineba sir. Aduga student na perform to hundeba. Na OT technique ki na traga scrubbing ki hairo amagi hairo adugi loin makse ozana hana satra da takpa satra na perform to khude mu sir college ki kano the station adum oiga doine sir.
Dugi 8th semester. 8th semester see what should they learn in the 8th semester?
So 8th semester 6 months they are totally sent to the hospital. Complete.
Just like internship.
It's intensive.
Intensive.
It's not just like it's exactly intensive, sir. Intensive ne. And the intensive 6 months work at the end of 8th semester, the student is assessed only by OSCE. No written, nothing.
Then during this 8th semester, they are supposed to work in hospital.
Yes, sir.
And OT, labor room,
Yes, sir.
everything they have to attend.
Yes, sir.
Okay. Thank you.
They will be sent to every area of the hospital, OT, oiro, labor room, or sir, loina magta chalhan ganeba. But magi evaluation assist tawdudi direct OT da changaga evaluate tawde, direct labor room da changaga evaluate tawde ba sir. OSCE station haina chap manab scenario ama akoina college set up tawraga evaluate taweba.
Jariba question si chini. Jiki form to buduka. When they come direct practical encounter with the patient, with the patient and lab, with adugine haise. Aduna moi kano si changaga OT de changa yahuraga di. When practicality the students when they went to work, what I mean employed, adu matamda they will face little problem.
Yes, sir.
Yeah.
I can understand. Sir, there is a little, I would like to highlight one thing. From first semester to seventh semester, the mode of practical examination is different from 8th semester. In 8th semester, we do complete only OSCE. But what we do from first to seventh semester is DOP and OSCE, 50 marks. So OSCE carries for 15 marks and DOP, direct observation procedure, it carries for 35 marks. And as I get 35 marks ki procedures, it is a hospital da chatlaga student ki performance to yeng mudo ineba sir. Aduda 7th semester bodi sir adugi chance amadi pi. Aduga 8th semester di hospital da perform to bogi chance pidre. Only is like structured tawraga same ba checklist to sir. Checklist to perform tawi na traga tawdi haibagi objective oina adu yengaga assess tawe sir. Any other doubt regarding OSCE? Let's go to some mini CEX di tawdi ko do karino haibadu made kitang haila tawjaramge. Mini clinical evaluation exercise haiba. Mini clinical evaluation exercise the kuni yengi se patient student ama chapma matam the real patient ama the mana kamai encounter tawge haiba potu ne mani yengi se aduga khudak to the magi feedback lawba. For example, direct observation in a clinical setting, and it's a very short assessment for 10 to 20 minutes. Student amachala ni bedside ni bedside to man 10 to 20 minutes the counter to matamda how they counter with the patient to the kamina counter to ge haibadu ne bi yengi se ko, and it is followed by immediate constructive ni ko kari haina phagadagi nang smile tawri han improve oigadagi haibagi 5 to 10 minutes ampire, and we check multiple competencies ama khatang na the competencies mayam ama check taweba, and we repeat with different patient and evaluators over time. Ngasina OBG lab ta, hayang na pediatric ta, ngasina mo emergency da, ngasina mo immediate dog bite lak matamda, na different da maze mini clinical evaluation exercise at all. What we see is how they can encounter with the patient. So here example in nursing, a final year student is assigned to assess a patient admitted with pneumonia. The educator observed the patient while they introduce themselves. Pneumonia na rin na care hekta hogdaba. Patient relation ni ko yeng se whether they introduce themselves, whether they take the history, whether they perform the respiratory assessment, whether they plan for the nursing care, and whether they communicate respectfully and professionally. That is what we see in mini CEX. So after the interaction, the educator discusses the student's strengths and areas for improvement. What we see is first 10 to 20 minutes. After that, we take 5 to 10 minutes to see, okay, this is how you perform. This is where your lacking part is. Improve Next is DOP. DOP lo magyawi ko first to 7th semester DOP yaw maniko. Ako na hospital da sa laga taw ko do karino ha thai na taw do na te ko patient pire procedure yenge after care before care adu na DOP de exactly taw do ri ba poto. What we see is we see the student is directly observed while performing a clinical procedure on a real patient followed by immediate feedback. See the exam the feedback sa kay laani mark to laani. examination nattaba matamda koina clinical gi thabase experience gi thabse di feedback pibudo yaiko exam da di feedback ki matamna te tawi taw di haibadu matuina koina pigadamni. So here the key features is directly observation of procedure skill, whether the student performed the skill or not, conduct in a real clinical setting oski dana kai simulated standardized patient amada DOP dana kai we are directly observing with a real patient the performance of how they are performing with the patient. Use a standardized checklist yenge student perform tawi okay ma sai tawra ke hand washing je tawbra tawdabra patient ki dignity maintain tawbra tawdabra privacy pibra pidabra mayam du yeng duini ko, then immediate constructive feedback and can be repeated to monitor the progress. Feedback pire sisi semdo haibdo mathang gi scenario pire mathang dong semdo pra semdo tabra haina check tawbudune. Next DOP ki example ama a nursing student is asked to administer an IM. An evaluator observes whether first one verify the patient identity. Adagi nurse station bed number 2 do da do piru so injection do piru so pantoprazole do kapu cho na ma se lae. Example ni koi na hai se. Chala aga ma je yeng matam je identity do ma yeng bra yeng da bra. Mark pi do ni ko hida ka pa hai bu do ngata na te bu ni yeng do se. Whether the patients identify student identify patient's identity, perform hand washing, use aseptic technique, select correct injection site, administer the medication safely, disposes of the sharp appropriately, document the procedure. Sige ma'am se tawbra tawdabra yeng do ni DOP da ni ko yeng do ise. Sige matungin ako na mark piran deba. Si checklist sembe yai. For example, each step you can give a marks of 2, so there are how many? 3, 7 to 14 marks pass fail. 50% phangadi pass, 50% phangadi fail. DOP hara ko na lamsam hekta out of 10 out of 20 ke pisan badu nate. DOP oitarzu you are going to form a checklist or a rating scale.
Can I interfere a bit?
Yes, yes sir.
In this checklist, please mention about the bed
number.
No, validity of the medicine.
Yes sir.
Yeah, expiry date and all these things.
Yes,
they
sir.
have to check there also.
Yes sir. So examples I give medication do check tawudo. Right medication koi rights me amma laidana. So right medication, right side, validity, expired oi they have a ma'am do. So this is how you exactly going to see in the patient, in the student, whether they are performing or not. So what is the difference between OSCE, Mini CEX and DOP? What we see in OSCE is, can the student perform the skill do ma tawbra ngambra haibra haitab kanada in a standardized examination. College te yeng baduni ko. What we see in Mini CEX is, can the student manage a real patient encounter? Student amagi manakta patient am hek counter to matam da ma counter to bra ngambra ngamdabra ma masana identify to bra ngamdabra haina yeng baduni ko masa identify to bra patient ura kamain deal to we haina yeng baduni. DOP dana kaino we are seeing specific clinical procedure on a real patient. This is the difference between two. Aduga INC Indian Nursing Council gi matungina akoy na evaluation processes na riba po sina first and third OSCE and DOP. So OSCE ga DOP ga ni ko main ko si na so settings e kai no OSCE we do in a simulated station ko na isa college sa tawri se ko mini dana real clinical amazu real clinical dani focus se kai no clinical skill and decision making. Here competency of how to counter a patient amazina clinical procedure de yeng ba DOP dana. Patients OSCE we see the patient can be standardized or simulated, but in case of the other two they are performing in a real patient. So here in case of OSCE the assessment is done in checklist or rubric. Rubric khangbibra angang nusmaina ga leiraga sanabado ai rubric ki example am pizera ke ko OSCE gi mini dana DOP dana rating dara natraga checklist feedback usually after examination. Aduga Mini CEX and DOP dana it is immediately after the procedure. Then there is also one type of evaluation called as portfolios. CDC na de ko nursing da nasai nursing da hai buduni si na di OSCE ga DOP khatane. Portfolios na karita wi a portfolio is systematic collection of students work and evidence. Students na kamay ta wi adugi proof evidence na kaino that demonstrate learning, skill development, achievement and professional growth over time. professionally nursing the profession na chang ta di nurse ki profession ji da mana magi professional course se first year de leram aduga second year leram da third year duga adugi growth assess ta wudune ba ngasai gi mayam duna kaino first year ki performance so tawi tawde second year gi practical adult health nursing community health nursing pediatric obg tawi tawde haini yenguduna mamangi mayam dune ba portfolio study over the time magi professional achievement development yengo mayam dune ko. So here, the key features is document learning over time, includes evidence, encourage reflection and self-assessment. Masana khangalo. Ai je first year chang matam da ai na nurse ki matang da khangam baduga ai na second year ai nursing ki matang da profession ki matang da ai na patient ama counter ta matam da ai je kayam na khangage ai isa gi self-reflection, self-assessment. Demonstrate achievement and review periodically by faculty with feedbacks. Ahoy na feedback pi doini improve oi de kari dana hena nang improvement mathau tai ta de haibudini ko. So nursing da ahoy na kari yo tawi casebook pai ko kari logbook first year dagi hauraga 8th semester bogi pai dro first year gi procedure myam at the end of the first year first semester da examiner principal sign myamum tawi adugi myam duni ko hairi ba pot se first semester da 8th semester bo carry tawroga chali. So it's all the example, clinical logbook, nursing care plans, skills, competency checklist, reflection, case presentations, health education activities, CNEs miyamama. Mana CNEs e first year day na 8th semester bo yaudre na khalo magi reflection ma masagi continuity profession sida ma kyam interest lai te na ta ka doine ba. Mana first semester second third sida marak te yauta di. We know that with that participation she is interested in the profession or not. Example, third year BSc nursing am natau is a clinical posting attendance. Lowi ko, magi clinical chapasida my attendance kamainta we clinical performance kamainta we. Chatlaga koi daily diary ka maintain ta hole ngang drug book ka maintain ta hole ko. Checklist writing, reflecting writing of the patient care experience. Daily diary ay punga sukto yawi, ay bed making tawi, medication tawi. Patient care pi comfort devices badagi doctor assist we can daily diary ihaliba ma'am adugi ma'am tuni ko portfolios ma'am se. Next is simulation. I'm not going in depth with the simulation as Madam Jamuna has already dealt about it, but we know simulation haraga ko na uriba ma'am duni mannequins ma'am ma adagi neonatally mama natally uriba ma'am duni ko simulations ma'am se. So yam man ba yam real way ba simulated care scenario in a safe and a controlled environment that is called as simulation. So simulation is replica of real clinical situation. Arms ka laidana injection site pi matam the veins ka do uraga yaudro. So it looks like real life. Next, types of simulation. As I madam na utpaduna high fidelity simulation iko. So mainly there are 3 types of simulation: low, medium, and high. Low is ina akoy na khud khatang injection arm CPR mannequin gumalay but it is called as low fidelity. Medium fidelity is in a basic computerized mannequin with limited physiological response. Akoy na ubaduni ko high fidelity guys di lower ekta pura high fine ko advanced computerized mannequin with simulated realistic patient condition. Patient response to rega high budo madam na that is high fidelity. Akoy da sida ayam balay is I think we all are having low and medium fidelity. High fidelity sa I think RIMS the delay ba madam they have high fidelity simulator in RIMS. Then standardized patient trained individual acting as patient. Asa hai gi budo psychiatry gi oski ma tawge di anga go direct to pura ga natraga psychologically disturbed kano gi manic patient am do ina lawbudu di oira roidana aduna maniac ki scenario em panta di aina patients hari mi to the instruction hana pi do ine nang sumai behave to nga mo de sisi khumo haidana that is trained individual acting as patient standardized patient haidu aduni ko. Virtual simulation ngasai mit virtually koina hapaga simulation uraga kano besagi step by step first step the injection tib the kari tongni tawroi have a virtual simulation dune. So this is a type of simulation ubi ko. So this is medium fidelity simulation. Now the challenges when we do the evaluation, the challenges we face is time constraint, faculty overload. faculty myam loi khangbiram gani overload myam oski ma prepare to bhai basida kyam change. Then large classes omukta the students 40 no ma evaluation tawba magi case book myam case study lesson plan ma check tawba myam limited resources. Then last one is subjectivity. How to encounter these challenges? First one is we are going to train the faculty. Student ki performance phahan ge hai tari akoi faculty oiba akoi hana yam trained oiba yamna competent oiba mathau taiba. So we need the training of the faculty, competency based assessment, and last one is standardized rubrics and continuous review. So this is a rubric. For example, kainoma yeng procedure ama yeng. So you can categorize the procedure either does not meet the expectation, approach expectation, meet the expectation, or exceed the expectation. Kari scope to know. Design dara, knowledge dara, application dara, presentation dara, process dara. Procedure ma yung sagi evaluation ama yung matam. You can use this rubric. And based on that, nangi score or name tari, you can rectify, you can modify it so that you can make a better evaluation procedure. Now, how far is OSCE productive? So there was a research done in by Dr. Jyoti Arora. The research was done on the perception of nursing students towards objective structured clinical evaluation. Dr. Jyoti Arora na OSCE da tawe ana volume 2 this and this. Si ki yengwa matamda 50 students was the sample size, and the finding indicates that the students' perception of the OSCE varied. But the majority of them expressing high level of satisfaction. So the subjects believed that OSCE was a good technique of evaluation since it was time limited, stress-free, assisted in enhancing practical knowledge and abilities. So the subject also discovered that OSCE was more adaptable and effective in detecting their competency gaps. Ana masagi OSCE je tautari ai hen adapt oi bi ai hen effective oi aduga competency the gap lei bese kari da aina haitabadu kari no haina khangdokda su mating pangi haidana. It has the research has been done. INC na OSCE lakositi semester system 2022 dagi oramgani ani wakhanda. So moi su research hana tawraga yengbadugi part amakhak aina sum hapsarakpani ko. So is there any question? Let's clarify. Ma'am.
And now the session is open to the group. Any question from the group? Any clearance from the group, please?
OSCE sidi yaudaba yadraba khangdraba yadraba poran practically tawriba poni ko huse.
Hi ma'am, your session was wonderful, but I do have a question. In OSCE, in your checklist, you gave a component for 2 marks. So my question to you is, can you do it, even if the students do the steps, but it's not somehow correct? So can we do the credit marking, or is it a 0 or 2? can we just do 1 if the step is somehow correct?
Yeah, thank you for the question. I have already highlighted that point, ma'am. For example, the maximum score is 2 for the particular step. For example, let's say the hand washing. If the student has performed few of the steps, but the student fails to perform all the subjects, so the scoring doesn't, you don't need to give 0 or you don't need to give 2. So if it's highly competent, you can give a score of 2. Medium competent, a score of 1. It is not competent at all, or the student is not performing at all, you can give a score of 0. And that marking 2, it is not very fixed. It depends on the examiner or the person who is preparing the OSCE, how you do the marking system. For example, hand washing itself, it can be a procedure for, it can be an OSCE for the first year students, for fundamentals of nursing. So depending on the performance, you can give full, half or 0. It depends on the examiner.
Any more questions, please?
So here, this is just an example. So if the student is fully competent, you can give a score of 2, partial 1 and 0. This is not a fixed rule. It depends on how you prepare the question and the score. Fully tawdaba tawramaga phatnang tokhibagumba yawbane ba duda chungtaw hek tawdaba ntraga pura hek lan bo ergana 0 pibiro kabuk sabuk step khara tawramragana 1 aduga yam perfect ergana give a score of 2.
Yeah, any question? Yeah, any look there again. So, okay, speaker ne yam phajana explain tawgre me yam loina bag bhab tabiramani na I think so. Aduga tabidaba yaurgadi still we have time in hand. Please clear your doubts. Ko aduga loisalakpada aina akoi speaker bu thagajabaga loina na aina wahai amatang thamjaning badi kainoda OSCE si ekoi da nauna hogdorakpani. Even when we were at medical directorate senior amoina ekoi khara select tawga OSCE training si tawrei OSCE training se tawraba matungda college singda kainoda ahanba sumaina workshop conference tawba matamda OSCE si adum class amoin hamnai hujiktu still anauba hangakpa singsida OSCE training tawbirakpa oza yauragadi yaure yauragadi OSCE kaino se requires faculty training simadi haijaramge faculty singsigi manungda OSCE training haiba amani yawa matamda adum discussion tawga adum thokani thokabudi aduna OSCE training se tokthokpi oina sumaina haijaningi kaino OSCE se INC dagi mas oirabanina
compulsory yes ma'am.
OSCE की ट्रेनिंग प्रोग्राम से तुम्हारे लेबरा है बा
Sir, OSCE की training program से I 6 weeks ama chacharuiba. OSCE training magdinate, but the performance was based on OSCE.
What I mean is, अखोई की Manipur से इस अदुगी तुम्हारे बसिन बल लेबरा है बा
sin badi leite sir.
अदुगी दमकता अखोई ना workshop में तो वया बरा है बा
Yeah, yes sir.
अखोई की association सम लेदना
Yeah, yes sir.
even अखोई की nursing institution अदगी अतः इतने ले nursing चीज़ तो वया बरा है बा
Yeah, yes sir. Yeah, yes,
that should be encouraged.
yes sir.
Okay, well presented.
Thank you sir.
So thank you very much Ma'am Bindya
Thank you ma'am.
for your wonderful presentation.
Thank you ma'am.
And you have maintained the time very well.
Thank you ma'am.
Yeah, adu kaino ma ka publicity.
अखोई की कनोदी resource person दी माई फंफम द चट्टे यार मतलब सुम लेप ले रहे
Thank you, ma'am, for your valuable insights.
Yeah, ke sukait.
On the topic strengthening evaluation skills in nursing education. Before proceeding to the next session, I would like to felicitate our next resource person, Mrs. Chintonlu KG, Principal in Charge, College of Nursing, Churachandpur. So I request our respected Mrs. Chungkham Bidani Devi, Vice Principal, Raj Medicity Nursing Institute, to kindly present this token of appreciation and memento to our respected resource person. Thank you, ma'am. Moving on to the academic session, which is the last session of today's first state level conference on the theme Teaching and Learning Process in Nursing Education. Before moving on to the last session, I would like to felicitate our resource person, Mrs. Namarapam Bindya Devi, Assistant Professor, College of Nursing Medical Directorate. I would like to request our respected patron, Dr. Kangujam Rajo Singh, Senior Consultant in the Department of Anesthesiology, Raj Medicity Hospital, and former Director, Health Services, Government of Manipur, to kindly present the certificate to our resource person, Mrs. Namarapam Bindya Devi, Assistant Professor, College of Nursing Medical Directorate. Thank you, sir. Thank you, ma'am. As a continuation for the last session of today's first state level conference on teaching and learning process in nursing education, I would like to briefly introduce about our resource person, Mrs. Chingthonliu KG, Principal in Charge, College of Nursing, Churachandpur. It is my privilege and honor to introduce our esteemed resource person for the last session. Mrs. Chintonlu KG completed her BSc Nursing from the Regional Institute of Paramedical and Nursing Sciences, Ripans, Mizoram University, and pursued her MSc Nursing from the Rajiv Gandhi University of Health Sciences, Karnataka. She has an impressive professional journey spanning over 2 decades. She began her career as a tutor at Sri Mulchan Karaiti Ram Hospital and Ayurvedic Research Institute, New Delhi, and later served as a staff nurse in the transplant unit at Sir Gangaram Hospital, New Delhi. She also had the distinction of serving as a lieutenant in the military nursing service at Kaman Hospital, Lucknow. Her academic career includes serving as tutor at the Royal School of Nursing, Imphal, assistant lecturer at Medica Super Speciality Hospital, Kolkata, vice principal at Kangpopi Christian Hospital and CMC College of Nursing, Imphal, tutor at the School of JNM, Lumfelpat, and assistant professor at the College of Nursing Medical Directorate, Lumfelpat. Since December 2025, she has been serving as the principal in charge of the College of Nursing, Churachandpur, where she continues to lead with dedication and excellence. Her vast experience in nursing service, military nursing, nursing education, and academic administration makes her an outstanding mentor and an inspiring educator. So, ladies and gentlemen, please let's join me in extending a warm welcome for Mrs. Chingthon Liu KG, Principal in Charge College of Nursing, Churachandpur. We welcome you, ma'am. I now hand over the last session to our respected conference chairperson, Professor M. Santi Devi, Vice Principal, Irengbam Thancha Devi College of Nursing. Thank you, ma'am.
So for these last sessions, the time given is 1:30 hours and 1.5 hours. And before 5 minutes, we will burst the bell, and that is the warning bell. Then 5 minutes is left, that means. And after that, there will be a discussion sessions. Now the session is to the speaker. Your time, please.
Thank you, madam. My respected dignitaries who are sitting here. I apologize for being late because I have some other responsibilities that I am running through. As we say that I'm in Churachandpur due to some official work, so I have to attend there. So I'm very privileged to stand here. Like this is again, I'm coming for the second time. The first time when I came for the NOC, it was really indeed a privilege. Then among my teachers, the previous, we are there together in the Cone Medical Directorate. So I really look upon them. Then I really happy to be here. So it is indeed, this platform is very important, and this indeed very important for me. And to begin with my topics, my topic is very interesting. I know everybody has known about this, but as they have given me the topic, so I have to go on with the topics. And my previous presenter, my HOD, my mentor, the registrar, Madam Jamuna also, I think she has elaborated regarding about this educational technology. Why this educational technology nowadays is important? Because in 5th semesters of BSc Nursing, according to the INC guidelines, we have a subject called Education Technology. When this subject was first launched and it was introduced by INC, at that time, nobody wanted to take the subject because it is education technology. So many people have already started communication and everything, they have started from the beginning. But at the same time, when we talk about the education technology and media and the technologies that are emerging into this world, that we need to understand. Being a nurse, we are master of all, as I have to say. I think if I say that we are master of all, it will not be wrong. Laloy darana khalle kay gino hairaga nursing subject ta yauriba mayam se. Nursing amana tangkakpa matamda akoy na BSc tamba, MSc tamba, adumayna level da suppose administration subjects introduced there, then slowly it introduced administration and research. Then the teachers, being a nurse, we have to learn the subject. And this also, it's part of a subject, and now it's under INC, and in the 5th semester, we are introducing this subject. Here, I'm not going to talk about a very boring subject. Now, OSCE ginway high krege, OSCE is very tough. Introduced to Bamatamdasu, but my colleague N. Bindya, she has presented her OSCE very well. So I hope that with that, this education technology, media, these things will not be so boring. As we come to this topic, like we have, just for introduction only, I have to give the introduction. We all know that this nursing is rapidly evolving around all media, education, media and technology. Do you agree or not? Yes? If we are not a tech savvy oidradi kamain to we. Smart de kaim ta khangda bane computer type to bahaite, presentation same bahaite, then we move backward. Adumaina adugi level akhoi gi hojiki generations da we have to compete with technology and media. Yes, do you agree? So everybody is competing now. Not only me. See the generations above us. From the morning they are sitting here just to be attended in this workshop, and at the same time they will see what they are teaching. Are they teaching correctly, or they will Google and see? Yes or no? So this is what we call our media and technology. This is not a new term for us. So this it involve around the emerging technologies hengat pegi maram oiduna akoi as a nurse ama oina akoi su adugi field da we have to got a tech savvy ne haiduna we have to be in the nursing tech savvy. Everybody is now going through ChatGPT. ChatGPT is a very common platform that we are using it. Yes? Angang matadigi class akoi kay no madigi ahandigi loy namak ChatGPT sizinay. Even myself also I am using it. Oza loy namak ChatGPT sizinay. Because we rely on that, because they give a study material, resource, and whatever we are asking, they are answering. So this type of media and technology is improving our educational teaching and learning. Then some of the media that I have here, PowerPoint presentations, we all know, videos and animations, we all show all the videos and animations, then chart models and posters, interactive, whiteboard, e-books and digital libraries, we all have this. But here I want to focus about LMS. LMS is what? Learning Management System. Even myself also, I am not that tech savvy, but to present here, to stand here, I have to Google, I have to search in this learning management system. So in learning management system, this is an applications of an online applications platform where we can create the content and where we can deliver our content and manage, then we can track down and assess the teaching and learning activities during in LMS, that is learning management system. So some examples of LMS that we have, I have just put up is Moodle. Moodle is nothing but it is a modular oriented objective. What? Do you heard about this? No. Anybody in the hall have heard about this Moodle? This is also a platform where we can learn, where we can deliver, where we can get materials. So that is why I just put this Moodle. Now you all will Google what is Moodle. At least that work will do. Right? I'm not going to go deep into Moodle the chatkada banate ba. But what I'm telling is tech savvy oiragadi, there are some platform that we can go. Moodle haiba platform amalayre. Aduda Google Classroom. Google Classroom also the same, where we can create these materials, introduce quiz questions hangba. Then another one is Canvas. Have you heard about Canvas? Yes? Yes, Canvas have you heard about? Then Blackboard Learning and Schoology. Sigi hairiba mayam se, it is nothing but it is a platform that where we can use our technology to get an information, to study, to assess, to track, and we can help the students to learn, and as well as with the teaching, with the help of the teachers. So these are some of the platforms that we have in the LMS. Then the emerging technologies in nursing educations. So what are those technology that we are relying on? We have heard about that simulation. Yes or no? So simulations, we have heard about that. Then VR and AR. VR is nothing but it is a virtual reality that we use the headset. When I was traveling in Kolkata for some of my personal works, My son was insisting me that, mommy, I want to play that game. I said that don't play, but he wants to play that game. Before he played, I was testing myself because it is just a 7-8 years old son. So I want to know exactly what the virtual reality is because they are giving the headset to the child. So before that, I na khangning ba. Ichana exposure to gada ba pot se karino hai base. So I just put on the headset, then I can see all because moina already headset to the set toraga di thamgada bane. That is a game. Aduna ni game ne ko, but I'm just giving you an example. Reality, as if like everything is real, then I'm just feeling the same thing. So my point is coming to that, nursing educations also, nowadays we are into virtual reality. Virtual reality da akoy na practice to ba natraga tamba tayo ba. I'll come to that benefits also. Then augmented reality. Augmented reality are something that we can study organs, 3D organs da. Different 3D sites da organs da. Especially handaki exam haidok pa se. Akoy gi any college ke oyo ba exam haidok pa matam da subject fail to gada ba se. Karino first semester da. Yes? Yes. Anatomy and physiology. Because the concept that we are getting image se larik ta khatta tammaga adudo akoy ngona concept ta low bangam da ba. Aduna this augmented reality will help us to grasp the image and concept with 3D dimension. We can study the physiology, we can feel the sight of the heart and everything. So that is the augmented reality. Then we have mobile learning application. Everybody is having mobile learning application? Yes or no? Mobile learning application is everybody akoy ngon lay ba. Nowadays, those teachers also, student na hena compete tawrak panina, teachers who compete taw darkar mataya ba. Tabra ne. And my student there also, it's not very easy. Moy ozana ta ise, hojik si ta ise, karino hai bada they will start. Because first semester dadi mobile piram da baya ba. But maybe in second year, third year dadi mobile pirakan ba. Mobile pirak mamatam da kay the way they'll start googling, they'll start finding out what are the things. Then they become a competency. That is learning and teaching becomes a competency between the students and the teacher by this media and educational technology. Yes? Then another one is electronic health records training, gamifications, and these virtual patients. Electronic health records. Sida koi gi ras Medicity da, I'll just give an example. Students among unda, any students yai. When one of the patients amalak pamatam da, OPD da, what did they do first? Yes, only one girl? I cannot hear. It's not an exam. Assessment na test ko. When we come first, OPD the patients la adi, what is the nursing responsibility?
We first start with the initial assessment. Like we check if the patient name is correct or wrong. And then after that, we start by checking their vitals. And then we check their height and weight and ask about their assessment.
Good. What you're telling is exactly what we have been doing for the past year until this now. But what I want to put here more is, as soon as we come, the patient is set here before the patient is Thank you, sit down. The patients come into the examination or contacted with the doctors. The doctors the contact patient's profile low re ko name, age, sex, aduga maigi any allergy, medication, loin maglaudra. So here, one thing is that akoy gi sigi ras Medicity jisu tawram gane I know that as soon as lakpa matamda sister amana adu data se loina ma computer da fit tawraga entry tawraga thambaneba. Yes, sir chumra. That is akoina, that is why nurses haibase not only nangna notes sa iba khata natreba. That is why we have electronic health records training. Everything. Not only nurses. Dr. Mayam Singh Su sir changaga doctor records se hujikan chi di inadre heba. Computer da loina mak centralized system. Every patients ki mana ngasai gi OPD da hek changba matam da mana click to ki number do sida loina putho akan sida my get the patients like with diagnosis everything. We don't need to go and check our records also. My automatically doctors gi room da available oira ani heba. So these are health electronics health record. Tawdi tawba akoina yam kanna kaya khanjalu da ba. But this is now important for us. It is very important for us. Aduna akoy di this is a setup of private institutions amagi setup yam phazeba Ras Medicity he. Because I always used to appreciate Ras Medicity gi private ki setup se yam phazeba. But when this setup hojik haidi ba pot se, when we go to the government sector that we may lag behind little. But what I want to tell all my dear students who are sitting at the back, because you are going to be the future techno-savvy nurses. Techno-savvy nurses oirakada baneba noina. So everything, you are very fortunate and privileged that you are in these institutions, that you can study all these media and technology within the course of time that you are provided. Yes? So try to take that advantages and try to learn every time new things. It's not a very big thing. Akoy gi government dadi akoy na it'll take times. But for the private sector, I don't think it will take time. Sir, do you agree? Yes, gamification. I forgot to mention about gamifications. Akoy gi SNA gi competitions ta ubama tamda, we always do competitions like banatra. Leaderboard ta, house wise, magi house na adu tare, adu gi yellow house, green house. I'm very interested in that. Okay. So adu matamda we have a quiz competition. Quiz competition yawe ko. Quiz competition that we never ask about the general knowledge atopa mayam hangdeba. Yes, we put some few questions, but we have to put the questions of anatomy, physiology, or pharmacology, so that the student will learn during playing this quiz competition. Adu ragadi akoy gi sina sitore first tare second tare na haidra, we have got the motivation. Adugi sports so first turning bagi maram oiduna kaidawe, we are learning and knowledge is retained within us. Akoy na learning by doing hibernate gamifications. Yes, it's not like mobile game playing. Okay, mobile game akoy hojikan di yam sanadra adu nate ko aina nursing gi gamifications haidi di. So it is that way. Example. So this is some of the picture. I know all of you are aware of it. Just to put on my slide, I have put up this, and Madam Bindya also told about the virtual, and Madam Jamuna also, the previous speaker, everybody has said about this. So this is the skeletal system. With the handset, they can see the reality. Then they can study. Especially, I focus on anatomy, physiology, organs, lungs, all mayam sing say. Angang say first semester dalak pamatamda. I myself, when I was doing my BSc in Ripan and Mizoram, I did not understand the concept of the organs. Kay ginuhairagans da akoy na organs to hangdo orga yengba natraga kay no ma feel to ba akoy ngon da laita bagi. But generation has come that all these things can be felt in that reality, VR and the AR. Then van finder, I think almost all the hospital are using the van finder. Angang sing di technology ne ko sina. Angang sing do akoy na pediatric nurse oy di angang gi van thi ba matam da wa do na akoy na phang da do na. I myself also a pediatric nurse, but it's very difficult to get vein. Vein finder, sige technology thok padagi kay daw haba. Patient sing se less moy gi pain oy ba natraga moy da hanjin na thin ba adugi problems solve taw reh ba angangsing kappado yengone soro honda na angangsing kappado. I remember even my mother also khara ahan yam ahan dinate khara ahan oire. I was taking to one of the hospital in the private hospital. Sample low blood sample low sida kamain to wai haiba matam sida adugi sample se low ningai ga they employ the best nurse si se masamak sister ne ko sister oi bene madi aduna noina khara phajana haiba mi malaga injection se sample se low biu sineba kauthare low re chinge thoktre again chinge thoktre 3 times haiba matam da she scolded me. Nang na sige hospital se nurse yam phaye na hairaga nang ben phangdri phau nang aingon na otlaga laigadro sineba. That time I feel that pain, okay. But I'm very grateful to all those inventors of the technology that we can use this one in the nursing education, and we all are very fortunate that in this era we are here. See, this is the vein finder that we are talking about for the adult. The one is for pediatric. And this is our all the high fidelity mannequins that labor makonto e haibado. Ako'y staff tigi kainoma Gurugram gida training chatluba yauruba. 5 days training, 6 days training. Yauruba laibra laite. Adugida I have seen this mannequin. Aina this mannequin will respond your answer question hang ba matamda. Simulator, high fidelity simulator ngasay madam bindiana high hibado. Akoy gidadi ay na mamanhang ba matamda di 1C high raeba. So aduna yam expensive oy ba ama oy ba nina akoy gi especially akoy government sector dadi shugu ba pangaroy sir. Aduna these are some of the kainoman neheba high mannequin, high fidelity mannequin mayam neba. Ako'y na question hang ba matamda nanggi labor pain kiam tawim nanggi severity nanggi kamain taw geharaga the mannequin will answer. It's not that suddenly the mannequin will answer everything. There is an operator room in site amada operator room amalayeba. Mana hujikna ay na hangiba mayam se operator na room digi tadoy neba. Tariba miduna answer tawgada baneba. Answer tawrisina as if like the mannequin is answering. So that way of mannequin se lakreba. Some low medium fidelity mannequins mayang say arms injection si hiriba mayam do. Chest compression, venipuncture, intramuscular injection, catheterization. These are some of the low fidelity mannequins. Ako'y na medium high gera ko. Medium fidelity mannequins later. I think almost all the colleges, school and colleges, INC na strictly high bane sungbas. We have to put in our college and institution so that this mannequin can be practiced. Okay na haji high bagum na imada laaga practice ta riba mido ahum raktin bado pen oyedana. Do we are using this mannequin for that. So what are the role of technology in the modern nursing? I'm going fast. I know it's quite boring in the last session, and by 4, yumda handabaya de haibigi amalaye. So I'm going to be wrap it up. Role of technology in modern nursing da. Nursing haiba madam sida. Nasay loy na mahay kre, nightingale adu da loy na mahay kre. But technology na ako'y gi modern nursing da kari-kari ako'y na mating pang ba natraga kari tawhange haiba madam da. Virtual reality ngasay ay nusu hay kre ko. VR can simulate the patient's encounter tawbayay, allowing you to assess the patient's care for and interact pau tawbayay, perform nursing, all the interventions. Then simulation based nursing amasu ako'y na use tawbayay like ngasay high kare injections, then high fidelity mannequins to na replica tawbayay, vital signs, even speech pau. How are you feeling? I'm good. Adum ba pau hay bangam meba. So technology sina ako'y gi nursing education sa play tawri ba say it's a very very big role. Then online learning platform ngasay na online learning platform hay kare ko. Online learning platform sida ngarangi webinar do kana ya hoge. Madam kaino mana register na ama thagalaktra webinar yawo hay do na. kana enter to hoban nang hoge nang hogde but they are live streaming nang de ay isa magso on tawraga dum thame du nang hogdre last ta kari thokpra host exit limit oi khre na thokre ba at last nothing to do only to see on the live streaming da but in live streaming that what I heard about that Mr. Dilip Kumar akoi gi president INC gi ko Indian Nursing Council ki president na ama haiba ay nataho ba malay. Now the generation, the future nurses has to be a tech savvy. Media and technology say the nurses hai sina mayam na encourage tauraga season na baho batare. Otherwise, this if we are lacking behind in this technology in media, then our akoigi performance quality, standardized, high quality, high mayam say, we will be lacking behind. But at the same time, he said something that human care, human touch, human compassion cannot be replaced by technology. So I really do agree in that point. Human touch, ako'y na kayo numa tawba matamda human touch hay bisa yam important na tra. Kaya isu tawdraga kut katang paibiba pao, so it's a healing process. So that can never be replaced by tech and media, but at the same time, we have to uplift our profession by learning all the technology and media maximum to akoigi standards of nursing care se hingat han ninga he namana amka high kri adu matamda. So effective uses in teaching sina Ojagida high reseko, Ojami Amsulay Banina. We can deliver the lectures very interactively using the multimedia presentations. I tried, but I cannot. I fail. To be frank, why? Adugi challenges ulakaniko horen. Then demonstrate nursing procedure do ako'y na demonstration da ako'y na tawdrago so video da tawraga uthalaga. Nowadays, asigi COVID matamdagi, we all started online, everything is online. And now myself, I'm posted in Churachampur. Sometimes I have to take class for the students, right? So still now I'm also in online. Online gida video post ba kara yantay ko. Sung ba mayam se ay zo hoji ay isa so hoji at present so tawriye ba. At that time to student interactions to ba quote pa aduna makhalaman ko, but online gi procedures mayam say we have to do it. So this is what we have to do as a teacher. Then we use simulation, AI based, all those part we are using as we have said. Then we provide ngasay instant feedback haibase. Instant feedback haibase, it's very important through online quiz ta. Koy na tawri ba pot se feedback ama sat thorakane ba, whether you are doing it correctly or whether you are performing in that capacity haibase. So everything will be online. So feedback ama thora eba. So we can encourage and collaborate this teaching, use effectively this AI and discuss the forum and digital platform. It's not a digital, I'm sorry for that, my mistake. It's a digital platform. So effective uses in learning. Learning na student mayam ge. Student kamay learn tau gani. Ako'y na dipang pirani how they will learn. So they have to access the learning materials anytime, anywhere. Ako'y na media gi kay no mada platform da matang haragadi. Tumda hipna. Ako'y na search tawragadi anytime, anywhere the material is available. Previously, I have done one online courses. Infection Control Nurse 3.0 and Management. Adugi course tau ba matam sida, I'm asking my time where available oy ba. During my office hour di ay available oy ba ngamdre heba. So I told them that I want to get it in like in the slot of 7, 8, 9. Adugi matamda where I'll be little free. So online gi aphabahay base, we can perform, we can take our course and we can study anytime, anywhere in our convenient time da. Adugi convenient time da laibigi akoy gi aduna angang singsu, don't say that class ki learning tawri basi khatana don't be a limited. As I said na, nowadays is a AI matam nina. Anytime no na hippaga hutlaga question se arise to bayai, question se hang bayai, then you can learn many things. Aduna anytime anywhere we can be perfectly fit. Then we can develop critical thinking. It's very important nowadays. Howjik se kari se, howjik ki generation se, we don't think, just they do action. Action ta udra. So critical thinking is very important. So learning process ta bamatamda in that platform, in that this thing, they will provide with critical thinking and analysis. Then we can improve our communication skills. Communication skills say, when I come back from Delhi, the ilak bamatamda, karita we hay bamatamda, sige da tak pase, may taylon tak pase sir, ay hate ba? Because ay na BSc tam Mizoram da tam me, then I work somewhere, adumay na tabak tawbat sa pamatam sida, adum may taylon da tak pase, ang wanda yam na inconvenience oiram me ba? This inconvenience, adum sida amka laaga ay nitigi amka class low ba with my training, with my learning, then mina hay bata ba adum mamatamdagi, then slowly I started catching up how to speak in Manipuri. Even now also I'm very weak. Suppose wahay ama may taylon da kitang na kay hay ni lak pamatamda, I have to go and ask si hay si kayno, si hay ning si karino. Because this is how we are learning. So online dasu, there are online platform, Google hay na laibane. Adugi platform da na linguistic learn tong ningay. You can learn the language. Ako na university dasu Korea language lay, kari language learn tong bayay ko. So aduna platform amalay ba adugi su language learn tong ningay. So we can go to that platform and we can learn our language. So communication also we can improve. Then we build confidence, and before going to the clinical area, we gain confidence in that clinical area if we can communicate well. Suppose patient naman lay rakan sa ay may taylon ngang ba hydradi ngasi kamay na tawge nang ngasi ngarang phazan na tumbra adu hydradi, it will be a barrier to me. IPR later we have interpersonal hoigi IPR lay ko aduna it is akoigi ling se laite heba ngasay hay bido sir Dilip na technology se adum se embrace to gada bani at the same time human touch akoy ge dung ba mayam di it cannot be replaced by media and technology hay bido sumayna relationship lay basu wari sanara kan sida loina ma akoy se compassion lay ba wari sanam thora eba natraga di aina Mizoram da lay kan sida how do we do tomorrow hayeng se aina duty chakani hairaga di daire gi maning du da idoi ne ba Moigi Mizol language se. Because the maximum of the patient there, they don't speak English, they don't speak Hindi. They only focus on their local language. So, aduna focus to bigi maram oiduna. I learned in these 4 years that community da ay moigi language da ay heltok pi bangam meba. So that is something akoigi kana ba ama su oyeba. But at the same time, those in Mizoram, they will never speak nang English kango su haining oyeba. Hindi maron hayo so haining ba. They will focus on their own linguistic. So another one is the impact of technology in learning experience. Akoy gi learning experience da akoy na nursing na kari impact kay malay gi hayba matam sida it will increase the accessibility. Increase the accessibility. Nga sa haybong anytime anywhere da accessible akoy oy bangam meba. Time is flexible. Anytime da. Then another one is interactive learning pibangam meheba. Moy na hayrak pa koy no kumba. Then another one is real-time feedback. Suddenly nang nahay ba poto mana loy kan da assessment da direct feedback pirakaneba. Then convenience in communication. So these are some of the impact of technology on learning. Then impact of technology on nursing practice. Practice to bahay say it's very important. Natra, not only learning. Sige technology sina akoy da kari tawhan lay harakan it makes our work more easier. Easier oy handra. So it makes our work more easier. Then it provides high quality care. Then ngasay time constraint hay ba mal laitra. Ngasay oski da time hay ba maloy na main to bahay ba everything has its time. Aduna sige su akoy na curriculum hay ba matam sida in curriculum we have a limited time. Semester amada 6 months hai bane. 6 months hai riba course se whole 6 months akoi para takte ba. 4 months or 5 months akoi para ta eba. 1 month na kay githamme assessment to ba angang exam to ba practical to ba adu mayam thamdra. So akoi na course se concise to ra tak pa matam da only 5 months da akoi ngon na matam laye ba. So asumai na koi na practical do so time constraint gi matam oiduna maram oiduna. So these are quality pi ningai natraga tak ningai natraga tambase aduna with the help of the technology it will help us more in learning and practicing. So it enables the data sharing and reducing the medical error. Medical error say sometimes akoi na kay dawe haba matam da as a clinical nurse oina I work to ramme clinical nurse oina work to ba matam sida what I have encountered patient say lak ba matam da sometimes lai makti akoi su natte doctor su lai natte nurses oisu we all are human being we are urged to have an error lan ba haibisidi akoi na lan na toge haibigi nataba that is not in our ethics akoi gi promise ta yaude ko but at the same time lan ki ba haibise tambangam de heba lan lagadi akoi adugi lan begi chances to we are dealing with the life we are not dealing with the dummy adu ama khanghogada bane heba aduna error haibase akoi na less chances of error when we are in technology ga akoi na ila collaborate tawraga akoi na larik tambadi the error is lesser. So to come effectively integrating the technology akoi gi technology se effectively akoi na integrate tawraga oja khangde teaching khangde then learning khangde then we have to have some few points that I have already spoken also but just for the topic we have utilize the virtual reality then implement the simulation. Nasai madam na so hai kare hanjin na simulation se akoi practice tawgadabani na hai kare ko then simulation is very important then we can leverage the online learning platform mayam loina makse not only me not only you not only her we have to leverage our online platform learning online platform sida noina di hairam gani ba smatam leite tawninga aduna but there are some online platform where we can pay and learn. Paisa thiraga aina ngahan yauroi haibde Astron International kaino mane school ne ko college ta then koi gi INC gi strict sphere haina leibro me khangbra strict sphere haina leyeba that is the platform for INC where they are providing free online courses ozamayam se adugi course to yumda leirakanda yam to they will have so many options aduda stress management newborn care resuscitation labor management PPH management course macha leibane adugi course na what happened you will get the credit score akoi na credit score se hojik phangragadi we cannot do akoi gi renewal to bayadre ko adu loina ma high khrabane so we need to have a credit score adu akoi na chalu ragadi akoi na tamba se ngamde heba due to our schedule due to our office job due to our personal or family's matters aduna there are online platform that you have to get it example adu the Coursera hairusu leibane EDX haibusu leibane platform se adune aina hairi se I think you might have heard about Swayam haibado university nu so toina panba platform amane Swayam haiba ama platform ama leiram gani there you can learn about your research methodology nangi materials study materials everything nang adu da phangakani ba so from today onwards try to see the platform and try to get your credit hours and credit score adu maina learn tawrakan sida akoi phangadabane we can never travel akoi na travel tawraga husband family adu ma tawra akoi learn tawbangam de so this is the only platform that we have to take an advantage and effectively use this platform. Incorporate AI and focus on inclusivity and accessibility and by these integrations only the nursing educations can become more engaging and interactive and effective and we can prepare the student in such a way that nowadays they can deal with the complexity of the modern healthcare system. hojikti hospital ama lakpa matam sida it's not like all previous system the tawreba even management and everybody they want to make it in such a way that they want a challenging area adugi fit tawningai what happened the teacher as well as the student has to learn that challenging thainagi matam do natre I beg pardon if I say thaina nurse tam mo hairagadi injection ga BP on ba hairadi yare haidra sir I beg to differ if it is like that because my mother also is a nurse. So when she make me study nursing field tamba matam sida mana adu matam da haye injections pi baga BP ying ba hay bakhatana nurse na te kon angon da hairam ba. Now I realize that. Akoy na khalis din nurse man lay kaya madal nurse man lay hairagadi BP ying hello injection
Hello, hello, testing hello. Hello, hello.
So there are many challenges I faced. Some of the challenges I just highlighted here. Okay. So high cost of technology and equipment. Do you agree? Nasai I know 1C haibado. High fidelity mannequins ta. Sibu maman kya muka oiram gadage na aina aigi kaino mada hangba matam sida. It will cost around 1C haiba because there have so many multimedia functions to begin ko. Not only one thing. Then limited internet connectivity. This is what it focused to me. It comes to me when I was preparing this. Internet connectivity se amung phangde sumaina. So internet connectivity ki se some areas ta ngahak lai raga amma phangani ngahak lai raga amung phangro edung bagi problems so malai gani ko. So this is some of the challenges and need the faculty training. Nasai madam mamangi no su high training chapadaka pai. So need the faculty training in digital teaching methods. Sigi training hai say there is no such as course a digital training course hai balai ko. Isa iton the training tok jaba. But if we go to another like digital training course hai raga computer tamba adumba A level grade level B level aduna makhalama oi khare ko. So then another one is technical problem. Technical problems se thok ta banate just now we are having technical problem. Yes, we have a technical problem. Then maintenance, then data privacy and cyber security concern. This is happening right now. An 11 years old boy who was caught, I just show social media da ubane ko. 11 years ne, mana school drop out ne ba. Mana kaidaw ramge hai ba matam da ma se police na phare ba. Police na phara kan sida kaidaw ge hai ba matam kari maram gi phari no hai ba matam sida. Mana around 30 platform ama digital platform ama fake hai batare semamba college se drop out oiba but he has the talent adu maina pharamba aduna akoi gi cyber fraud security hai base leita banate it's all there ngahan mu ikui dana su angon su message lae imanabi se I need 10k it's urgent please transfer hai phone tawba nangdana aina transfer tawbiragadi imanabi gi phone se aina amuka phone se try tawbam da my phone chatreba then in the another group they are telling that magi phone se hack tawkhrabane if anybody got this kind of message adudi fraud ne na hairakpa message aina thengnareba adudigi I know aduna technology haibase we have some benefits we have some disadvantages at the same time asi khaktana akoina kainoma tawde haibagi nate ko but we have to use cautiously use to badarkar matayeba angang sing da pau
mobile yengba matamda akoina icha nupa se yenghanba matamda nang kari yengino haiba hana akoina phaktoine ba, because we are cautious yam oibegi. So these are things that we are facing, challenges by using media and technology. So role of a nurse educator, we all know this is the role of the nurse educator, everybody knows, but just for a slight purpose, we integrate the technology in the curriculum. As I said, then in the curriculum, 5th semester education technology subject is there, that is for 40 hours, if I'm not mistaken. So then we have to train the students in digital competency, that is why we have computer subject. Yes or no? Computer subject Libra? Yes. Then encourage the evidence-based practice. EVD, it is also very important. Then we evaluate the effectiveness of the education technology. Aduna, ozai mathau tare ko. Kamaina akoina ngasai evaluations tawgadaba. Then we promote this haibase lifelong di promote taw haiba. Sige education, technology and media say lifelong promote taw haiba. That means we cannot stop learning by now. So the dignitaries who are sitting in front of me, the level that has crossed, moina crossed aura iba level se, sigi level da moina hana khangap matam da sigi level da laite ba. Now they are all a tech savvy, oi da ba yada ba, because the times demand it, the situations demand it, the generations demand it. So these are some of the role of nurse educators. So with this note, I'll just keep you with this note. Your life does not get better by chance. By chance na koi better lak panate ko. It gets better by change. So when you leave this hall, I just want everybody just to remember this quote. At least we need to change something from here. Coming out from this hall and aigi topic ta noina logshin bangam dragasu. Previous speaker ki topic mayam sida. Noina khara lokshin bangam bapot se. I hope that you will implement in your institution and academic and in your learning process. With that, I come to an end. Thank you.
So now, Ma'am Asingna, Mrs. Asing, Principal College of Nursing, Sultanpurna, Yam Phazaraba, enhancing nursing education through education and media and the emerging technology presentations. Now is the time for the group. It's open to the group now. Any questions from the group? Any queries from the group? You can please ask. Any question? Madam Asing kumba experience well exposed or ba ozama ngasi dai sa phamaga lecture pibiri ngai da du kumba advantage sing se lobi hona ba group ta ina haijari.
Okay.
Asai aina training gi platform me am do. Khangbi ramagadi phare khangbi dragadi platform me am se su madam
do aina do tang highlight tong jage if I permission. Ado ngasai gi modules ki kaino madusu amta haijage aina haibada ngasai miss tawre. Module haibada MOODLS haibane ba. Modules haibasi nothing, it is like modular oriented object oriented dynamic learning environment haibane ba. Modular object oriented dynamic learning environment haibane ba. Ado ngasai gi platform mayam do ay amam haijage Coursera. You can write down Coursera. Coursera, Coursera. Then EDX, small ngakta, EDX, small ngakta. Then Future Learn, hay basu amay yawe ko. Then atopa na Udemy, UDEMY, Udemy. Then asina international mayam da koi phangani Ellison, ALISON. Dung asai gi free web page haibado haibane ko. Estrika spare noina dumaina hairaga mobile app ta download already mathanda thora ane. Then NPTEL, aduna NPTEL India. adu ngasai aina haizakhiba swayam, SWAYAM. So these are some of the platform knowing asi chatluraga haipet yenguro aduda kari thorake haibado. So small course mayam tauba paid tauraga course akoi tauba yai ko, then free course khara leiramgani ko. International gumbadi we have to pay it. Then atopa su akoi na paid tauraga taugadabane ngasai gi free course di INC na asterisk piriba astrika sphere haibido aduna free course oigadoribane.
ꯑꯩꯈꯣꯏꯒꯤ ꯀꯩꯅꯣꯁꯤꯡꯁꯤꯅ ꯉꯁꯤꯁꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯇꯧꯔꯤꯕ ꯀꯩꯅꯣꯁꯤ ꯀꯟꯐꯔꯦꯟꯁꯁꯤꯗ ꯑꯩꯈꯣꯏꯒꯤ ꯀ꯭ꯔꯦꯗꯤꯠ ꯑꯋꯥꯔ ꯍꯥꯏꯅ ꯍꯥꯏꯕ ꯑꯃꯒ ꯀ꯭ꯔꯦꯗꯤꯠ ꯄꯣꯏꯟꯠ ꯍꯥꯏꯕ ꯑꯃꯒ ꯑꯅꯤ ꯊꯣꯛꯅ ꯈꯥꯏꯗꯣꯛꯑꯦ ꯀ꯭ꯔꯦꯗꯤꯠ ꯑꯋꯥꯔꯁꯦ ꯑꯩꯈꯣꯏ 5 ꯍꯥꯏꯅ ꯂꯧꯖꯔꯦ ꯀ꯭ꯔꯦꯗꯤꯠ ꯄꯣꯏꯟꯠ 5 ꯂꯧꯀꯥꯟꯁꯤꯗ ꯀ꯭ꯔꯦꯗꯤꯠ ꯑꯋꯥꯔ 1 ꯈꯛꯇꯅꯤ ꯃꯌꯥꯝ ꯏꯄꯦꯟ ꯄꯦꯟꯅꯈꯤꯗꯦ ꯅꯠꯇ꯭ꯔꯥ ꯍꯥꯏꯗꯤ ꯃꯃꯥꯡꯗꯗꯤ ꯀ꯭ꯔꯦꯗꯤꯠ ꯑꯋꯥꯔꯁꯦ 1 day ꯁꯨꯃꯥꯏꯅ ꯁꯦꯃꯤꯅꯥꯔ ꯇꯧꯀꯥꯟꯗ ꯀ꯭ꯔꯦꯗꯤꯠ ꯑꯋꯥꯔꯁꯦ 3 ꯐꯪꯕ ꯌꯥꯎꯅꯈ꯭ꯔꯦꯕ ꯑꯗꯨ ꯍꯧꯖꯤꯛꯇꯤ INCꯅ ꯁ꯭ꯇ꯭ꯔꯤꯛ ꯇꯧꯔꯛꯄꯅ ꯃꯔꯝ ꯑꯣꯏꯗꯅ credit hours-na 5 oiba matamda credit points se 1 dagi hena piba yadreba aduna INC gi matungina khoi credit points se 1 pire ineba ko ado hujiki hairiba platform myam sida hujiki ngasai gi madam dagi pangiba kaino myam da changaga akhoi on training tawba yaiba haidi paid oiba ya non paid oiba ya adu da su credit se on tawba yaiba akhoi gi darkar oiba credit to ai year simada credit asuk darkar oi haitra di adu gi platform sing da credit se on tawba yaiba adugi knowledge masu loksan biu credit se earn tongna bagi damakta yani ko. So today's topic is very advanced so far madam gi experience puna mak loina ba mayam da government tawraga high grabani adudaida this is because of the topic only topics in enhancing nursing education high ribanina advanced da nainara ineba adubu so we came down akoina lak kumdharakwa matamdadi traditional training kano education haibam de koi kaw busunga yade ba huzik raj medicity virtual training laire haire ko classroom da smart classroom laire haire smart classroom phaniam lairaga su smart classroom na loina ba coverage pi ba dinga moeba akoi physical si tawdaba yaroeba physical class adumak tawrim leba physical class tawna masai oja sing da hangba matam da haigi bado physical class e tawna aikoina oja sing na khangadab da hayang khatang thamjabge oja sing da aikoi gi kaino maneb si media makhala maneb angang lairik takwa matam da teachers kaino se teachers attitude si media mani haiba si ya bining bra maya the attitude of the teacher is also one of the media ozadna like the ibo ozadugi attitude si yaning da ri satana taning deba aduna teachers attitude se asisu yamna khanbi ga dabani ko aduna teachers singina value system khanbi ga dabani emotional outlook towards the students yamna khambi ga dabani this is also one of the traditional di oiba adum still important oiba aduguma media makhalam ni sai thamjage ko okay aduga aduga kenona haibi ki bado ngasai gi oja singna khumai dina first year se khwai fail oi gali se anatomy physiology ko anatomy physiology yam fail oi ga masi maram di kaino bo aikoina na ngwai akoi di medical college laiba college amada akoi di BS nursing tamak banina organ ga se putho ga anatomy sar duna medical college ge anatomy sar duna organ loina ba ulle ba khoi da tagle ba putho ga aduna akoi at least akoi da reality gi knowledge khara akoi da dum leire ba hujikti organ hairaga model khara thamani akoi gi kaino science lab ta aduna di hekta oiba yade ba ko aduna ngasai gi madam na tambi gi ba media ama augmented reality haiba do aduda asagi anatomy gi bones muscles vein kamai sen ba artery kamai na sen ba sigumba gi augmented reality gi sigumba kaino se ama thambiraga di platform ama thambiraga di akhoi gi chatra singna learn tawba yam nungai gani haina ai suggest tawjani leithokarbani na mi yengna honna bada. So any more questions please? Any clarification? No drop? Yare haine laura sira. Yeah, hane lozarage sir. No. So thank you very much. Very much.
Thank you, our last resource person, Mrs. Chington Liu KG, Principal in Charge, College of Nursing, Churachandpur, for the very informative session. Thank you, ma'am, once again. Before moving on to the next session, I would like to request our dignitaries, Conference Chairperson, Professor M. Santi Devi, to kindly step down from the dais and take her seats. Thank you, ma'am. In between, I would like to remind that there will be a tea break after the vote of thanks. So I request all the delegates to remain in the auditorium hall so that you can conclude this occasion after having the tea break. So now we have the validatory section, and for the validatory section, I would like to request our respected Patron, Dr. Aribam Ibotombi Sharma, Medical Superintendent, Raj Medicity Hospital, to kindly present the certificate to our Conference Chairperson of the afternoon session, Professor M. Santi Devi, Vice Principal, Irengbam Thamcha Devi College of Nursing. Thank you, sir. Thank you, ma'am. Finally, I would like to request our respected convener of today's program, Professor Okram Subadani Devi, Principal, Raj Medicity Nursing Institute, to kindly felicitate our resource person of the fourth session, Mrs. Chington Liu KG, Principal in Charge, College of Nursing, Churachandpur. Thank you, ma'am. So every successful program is the result of collective efforts, dedication, and teamwork. To propose the vote of thanks, I have the honor of inviting Ms. Monica Laishram, Assistant Professor, Raj Medicity Nursing Institute, to kindly deliver the vote of thanks.
Good evening, distinguished patrons, conference chairperson, resource persons, delegates, faculty members, and dear students. It is an absolute honor and privilege to stand before you today on behalf of Raj Medicity Nursing Institute to deliver the vote of thanks for this milestone event, our first state-level conference on teaching and learning process in nursing educations. First and foremost, I would like to express our deepest gratitude to our visionary patrons whose constant encouragement and support made this conference possible. A sincere thanks to Sri Haubizam Rajan, Chairman and Managing Director, Ras Medicity Hospital and Ras Medicity Nursing Institute for his constant encouragement and support in making this conference possible. Dr. Ngairangbam Narendra Singh, Chief Medical Services, Ras Medicity Hospital, Dr. Aribam Ibotombe Sarma, Medical Superintendent, Ras Medicity Hospital, Dr. Kanguzam Rajo Singh, Senior Consultant, Department of Anesthesiology, Ras Medicity Hospital, and former Director of Health Services, Government of Manipur. Thank you, sir, for your generous funding. Your contribution is commendable in making this session possible. I must also extend our heartfelt appreciation to our conference chairperson, Professor N. Nalini Baladevi, Principal, College of Nursing, Professor M. Santi Devi, Vice Principal, Irengbam Thamta Devi College of Nursing, for maintaining an exceptional standard during the entire session. We owe a profound debt of gratitude to our brilliant resource person who took us through the technical sessions today. Dr. Aribam Jamuna Devi, Registrar, Manipur Nursing Council, Mrs. Chingthonlu KG, Principal in Charge, College of Nursing, Churchampur, Mrs. Namairapam Bindya Devi, Assistant Professor, College of Nursing, Medical Directorate, and Mr. Lysram John, Lecturer, College of Nursing, RIMS. Your expert insights into innovative teaching, methodologies, and integration of technology in nursing education have truly ignited a new spark in all of us. We also thank Dr. Bijaras Haubizam, Executive Director, Ras Medicity Hospital, Sri Irom Inglenyai Meitei, Assistant General Manager, Ras Medicity Hospital, Dr. Bukrambam Rinko, Assistant Medical Superintendent, Ras Medicity Hospital, Mr. Chauba Stanley, Social Worker, Mr. W. Rasmani Singh, former DSP, Excise Department, Dr. T.H. Boboy, RMO in charge, Ras Medicity Hospital, Senior Managers, Deputy Manager, staffs of Ras Medicity Hospital, non-teaching staffs of Ras Medicity Nursing Institute. To our dedicated organizing faculties, Professor Okram Subadani Devi, Principal, Ras Medicity Nursing Institute, Mrs. Tungkam Bidyarani Devi, Vice Principal, Ras Medicity Nursing Institute, for skillfully steering today's program. A special thanks to our organizing secretaries, co-conveners, the entire registration teams, technical support teams. Thank you for your relentless hard work behind the scenes to make this event seamless. Last but certainly not least, a massive thanks to our delegate, faculty members, and students. Your active engagement and vibrant presence are what truly brought this conference to life. A special thanks to our media persons for covering a first state-level conference to reach the wider community. As we return to our respective classroom and clinical setting, let us carry forward the innovative strategies we learned today to bridge the gap between the traditional pedagogy and modern nursing needs. Thank you once again, everyone. I wish you all a safe journey home. Have a wonderful evening ahead. Thank you.
Thank you, Ms. Monica. Before coming to the closing remark of this auspicious ceremony, I would like to inform all the dignitaries and the delegates that we will have a photograph session, and I request everyone to take part in that photograph session. On behalf of Raj Medicity Nursing Institute, I sincerely thank all our esteemed dignitaries, conference chairpersons, resource persons, delegates, faculty members, students, and organizing members for your valuable presence and wholehearted support. We hope today's sessions have been informative, inspiring, and beneficial to everyone. So, at the moment of this conclusion, I request everyone after the tea break, we'll have a photograph session and to take part in that photograph session. Thank you. Have a wonderful day ahead.
Sister.